ParliamentLive.tv. 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 ParliamentLive.tv.
May emerge. I have seen over the weekend some reports in the media of unscrupulous individuals exploiting particularly elderly and vulnerable citizens, and certainly when we've been discussing these matters with police leaders on our regular calls, they are aware of that issue and are thinking more about how they could redirect resources towards that if it becomes systemic.
David Davis.
We probably have over 500,000 undocumented migrants in this country, people who, if they fall ill with coronavirus, may be afraid to declare themselves to the health authorities for fear of deportation. The Irish government, who have the same issue in Ireland, have firewalled NHS or their National Health Service data from other parts of government. I don't know whether this is the right answer, but will my right honourable friend look at this issue and find a similar resolution?
Thank you, Mr. Speaker. The point's well made, and we will certainly look at it. And I would say no one should fear accessing medical advice from our superb NHS due to an immigration reason.
Sarah Jones.
Thank you, Mr. Speaker. Concerns have been raised in Croydon, and I've seen it elsewhere, that religious organisations are not adhering to the new guidance about having their services or not. And indeed, I've seen some people seeing it as an act of faith that you're bold enough to go and to your religious service. What more can we do, both in terms of enforcement but also communication, to make sure people are doing what they should?
The Honourable Lady is quite right, and I received reports just this morning that there are particular communities in London in particular who aren't observing the rules, and we'll be talking to MHCLG colleagues this afternoon about what they can do to draw people together to create better observance.
Thank you, Mr. Speaker. Can I just thank you for raising the death of PC Keith Palmer, who tragically died 3 years ago. The pressures on the Home Office are only likely to increase. We've seen 20,000 armed forces mobilised, many of them which will probably provide military assistance to the police. In the event of a lockdown, could the Home Secretary say what role the armed forces might play?
Well, Mr. Speaker, the Honourable General is quite right to raise the capacity and capability of our military, which is second to none. And where we can, we will draw upon it. He will know that this is a country that has a proud tradition of a strong division between the civil and the military, and we wish to maintain that. However, our armed forces colleagues do have superb expertise in logistics in particular, and in planning and construction, which we aim to use to the fullest extent.
Order, order. I wish to make a statement which relates to parliamentary services and aspects of the Chamber and other parliamentary business. I ask our honourable members bear with me, as this is longer than I would like. Chamber attendance. Parliament as a whole continues to follow the latest government advice relating to COVID-19, including advising members and staff to work remotely where possible and limiting all but essential access to the parliamentary estate. I remind members and those watching our proceedings that steps have been taken to preserve social distancing in the Chamber. As a result, attendance will be more limited than usual, but that does not curtail the commitment of honourable members to fulfil their parliamentary duties. Video conferencing. We recognise the need to improve our video conferencing facilities to enable those working remotely to engage in committee proceedings. Regarding evidence sessions, these facilities are currently limited, not at least because the management of these sessions requires expert operators to produce audio-visual output of a suitable quality for broadcast use and Hansard transcription purposes. The teams who make such arrangements work are currently under, and I do stress, under significant strain because of staff absences. Further work in this area will be taken forward as a matter of priority over the Easter recess. Once the current situation is settled, I will commission a review to ensure we can develop systems to ensure we are ready and able to be more agile in the future. Catering. Some members and key parliamentary staff are still required to work on the estate to enable the House to continue to fulfil its important constitutional role. And as a workplace, it's important they continue to have access to adequate canteen facilities. The number of venues has been closed, but in those that remain open, we are employing a range of measures to increase social distancing, while encouraging diners to use takeaway options where possible. The following outlets remain open: tea room, terrace cafeteria, debate, dispatch box. Members, the members' smoking room remains open, but there is no service. I can confirm that from today, the sale of alcohol in the House of Commons catering venues has been suspended until further notice. I actually took that decision on Friday evening. All of these measures will be kept under constant review. Divisions. If divisions take place from today onwards until further notice, the arrangements will be modified to allow for social distancing. The entry of members will be staggered, with entry at separate times for 3 alphabetical groups. Members will be able to record their names at any of the desks. A division may take between 30 to 40 minutes to conduct it this way. Further details will be communicated via the whips and announced again if a division takes place. I just want to ensure that members all feel satisfied that we are, and all the staff are trying to do the best. I understand the wish for honourable members, particularly those not able to attend the chamber, to fulfil their duties to hold the government to account. However, I urge honourable members to think twice before tabling parliamentary questions. In particular, they may want to think about the impact of such questions on government officials who are working incredibly hard to respond to the current crisis. I've just got to say, if they are desperate questions, I understand, but multiple questions is absolutely blocking up staff members in this House, but actually government departments who need to be carrying on their duties. So please think twice. When a member puts 60 questions down, that is not helpful to anybody or this country. I should also mention that names added to early day motions which are not submitted electronically are not being processed. I am sure all honourable members will understand that in these exceptional circumstances, some changes to procedural services have proved necessary, and further changes may be needed. Conclusion. Finally, I want to again express my thanks to members and staff across the Parliament for their hard work in enabling that this House continues to function, and for their efforts in limiting the spread of coronavirus amongst our community. I've got to say, we've some absolute heroes in this House who I want to thank on behalf of all of us. Thank you. We now come to a ministerial statement. I now call on the Lord President of the Council, the Leader of the House of Commons, to make the business statement. Jacob Rees-Mogg.
Mr. Speaker, I should like to make a short business statement. Further to my announcement to the House last Thursday, the first item of business tomorrow will now be consideration of a business of the House motion, followed by all stages of the Contingencies Fund Bill. This will be followed by committee and remaining stages of the Windrush Compensation Scheme Expenditure Bill, followed by a motion relating to appointments to the Parliamentary Works Sponsor Body. The last item of business will be a general debate on the situation in Yemen, as determined by the Backbench Business Committee. The business for the rest of this week remains unchanged.
Thank you, Mr. Speaker, and can I thank you for remembering PC Keith Palmer in your earlier statement. Can I thank the Leader of the House for the business statement. We agree that the Contingencies Fund Bill should be accommodated in this new change of business.
Thank you, Mr. Speaker. I'm grateful for the support of the Right Honourable Lady, and our hearts continue to go out to the family of PC Keith Palmer. It was a great sadness that afflicted them and the whole House 3 years ago.
Thank you very much, Mr. Speaker. First of all, can I say I welcome your statement and the steps you've set out to enable this House to continue to do its democratic role, but in a way that is safe and consistent with the advice the government has set out and is expecting our constituents to follow. Can I ask in that spirit to ask the Leader, if he's not able to update us today, to think about what further steps that can be agreed between Mr. Speaker and usual channels to enable this House to properly hold the government to account over what may be a considerable period of time when we're dealing with this virus, but in a way that is consistent with the firm, important advice we're giving to the rest of the general public.
Mr. Speaker, my right honourable friend raises a point that is being considered by the government and will be discussed with the opposition and other opposition parties. We will need to legislate and we will need to ensure that the government is held to account, but we may well have to do it in ways that are different from those we have used previously. It is very encouraging to see that honourable and right honourable members seem to be sitting at least 6 feet away from each other in the chamber. And I would encourage that even on my own front bench, which is, seems to be observing the suitable gaps at this moment, as does the opposition front bench.
Patrick Rader. Thank you, Mr. Speaker. We're happy to support the government in its efforts to get the contingency fund bill so that it can make the expenditure needed to get the country through this crisis. And we welcome, Mr. Speaker, the announcements you've just made, particularly around social divisions, should we find, and perhaps we won't, but should we find that divisions are necessary. But it is continuing to put pressure on the continuing business of the House, continues to put pressure on staff, pressure on members. Can the Leader say what consideration is being given to bring recess forward to the end of this week? Because the reality is that any of us that return to our constituencies from London, the epicentre of the virus, are going to have to self-isolate. It would be inappropriate for us to go into our communities and therefore impossible for us to get back for sittings next week. So can the Leader please take that into consideration?
Yes, absolutely. I can assure the honourable gentleman that that is being considered. I would say to the House that pairing has been very widespread for this week to ensure that honourable and right honourable members who don't need to be here are not here. We obviously need to ensure that the emergency legislation is successfully passed this week, and that depends on the other place as well as here, and then the receipt of royal assent. But we will have other legislation to do in due course. But whether the toilets rate relief bill and the general debate before the adjournment is a central business that we all need to come back for is something that is debatable.
Greg Clark.
Thank you, Mr. Speaker. When the Leader speaks at Cabinet tomorrow, will he convey appreciation to the Chancellor of the Exchequer for the package of measures to support workers that he announced on Friday? He may only have been Chancellor for a few weeks, but it may be that he has saved more jobs than any of his predecessors. But will he ask him urgently to come back to this House, I know he's working very hard on that, on a comparable package for the self-employed, whose businesses are crucial to every constituency in this country and indeed to the nation?
Mr. Speaker, I will do better than my right honourable friend asks for. I will ensure the next extract of Hansard recording the thanks of my right honourable friend are sent to the Chancellor, and his proposals have received widespread support across the country in the House. His point on the self-employed is very well made, and I will ensure that is also passed on.
Kevin Jones.
Well, can I also add my welcome to the support that was given last week to those in employment? But there's real anxiety out there amongst self-employed. Bill Croney, for example, one of my constituents, runs an event catering business, contacted me this morning. These people have got no money coming in, and I think people need to realise that. The government need urgently to bring forward a packet of measures And I think an indication of a statement tomorrow would be at least, I think, a ray of hope for some of those people who are in desperate times.
Mr. Speaker, I would say that though the bill coming before the House tomorrow is not specifically directed at the self-employed, the scale of tomorrow's bill is that it will allow expenditure of £260 billion on account. That gives the government the flexibility that it needs, assuming the House is willing to pass that bill, to ensure that steps can be taken. And I know that my right honourable friend is giving urgent attention to ways of helping the self-employed. I think across the House it is accepted that that is something that needs to be tackled.
I also welcome your measures to try and keep all the staff and ourselves safe in this House. Could I ask my right honourable friend, the Leader of the House, we're about to go into recess sometime in the near future. We don't know what's going to happen over the next few weeks, but undoubtedly there will be problems in all of our constituents. Can I ask him to urge all his front bench colleagues to treat any queries from any of us as if the House were sitting with the urgency that they are needed to be dealt with?
Mr. Speaker, may I refer to your statement, which I think gave the House very good advice. We, as honourable and right honourable members, need to consider what is urgent and pressing and needs raising with ministers, and what is routine and can wait until after this crisis is solved, because it is of the greatest importance that urgent messages get through and they are not swamped by routine messages that we would usually be passing on to try and seek high-level responses. And I think self-denying by us will help ministers to ensure that the right responses are given to the most urgent items.
Kevin Brennan.
Thank you very much, Mr. Speaker. Could I also add my voice to those of the Honourable Member for Tunbridge Wells and for Durham in relation to the self-employed and freelancers, and ask that the Leader conveys to the Chancellor the urgent requirement for him to come back to the House with a statement in relation to the self-employed and freelancers, and also commend to him the report issued by the Musicians' Union today, which is outlining the impact that this has had on many people in the creative industries.
Mr. Speaker, the honourable gentleman is right to raise the issue of the creative industries, who are mainly self-employed and have been particularly affected because, of course, the places that they perform have been closed. The government is inevitably conscious that when by order it closes places and that has an effect on people's livelihoods, there is a societal responsibility. And my right honourable friend the Chancellor is fully aware of that.
Mr. Speaker, you may recall that I have, over the last couple of years, secured not one but two emergency debates in this House on the Yemen, and have been a pretty staunch critic of the government's policy in respect of that country. But even I wonder about the timing of this debate tomorrow, and whether it really is wise for the House to be devoting time to that particular subject.
Mr. Speaker, I'm very grateful to my right honourable friend, who I know has campaigned to bring the attention of the country at large to what's going on in Yemen. It is always open to somebody who is going to move a motion not to move that motion, and honourable members may want to consider whether they wish to bring forward specific business.
A list to come.
Mr. Speaker, as things stand, we will be returning from the Easter recess just as this epidemic reaches its peak, or it heads towards its peak. Inevitably, either by agreement or for any other reason, a lot of members will not be here. So can I ask the Leader, Mr. Speaker, to take your indications with regard to the use of modern technology for distance working seriously over the recess, so that we might have the appropriate provision in place for members, which after all is what we are asking people in workplaces the length and breadth of this country to do.
Mr. Speaker, many aspects of distance working are already available in terms of e-tabling and so on. A motion will be brought forward to the House later on today to allow greater flexibility for the working of select committees, which will be an important step in allowing them to hold the government to account during this period. As regards the workings of the floor of the House, there will be discussions with leading figures in opposition parties, I hope during the course of this week, to see if we can, by agreement and consensus, work out how to limit the numbers of people who need to be in the chamber.
Richard Drax.
Thank you, Mr. Speaker. Some of businesses in my constituency are already looking to the future and asking that when they get back on their feet, they are sadly going to have to make some redundancies because the business will not be turning over or making the profits they're making now. They're asking who is going to meet that bill. Could my right honourable friend ask the Chancellor what the answer to that particular conundrum is?
Mr. Speaker, my honourable friend raises the question that is at the heart and underlying what many honourable and right honourable members have been saying. How do we take care of businesses that were sound on the 1st of March and during this crisis may find that they are not sound when it ends? The government is doing everything it can to help ensure the continued soundness of businesses, and that, in my view, is absolutely the right thing to be doing.
Catherine West.
Thank you, Mr. Speaker. In light of the fact that on the 21st of April, when the House is due to return, it may not be possible for health reasons, is it possible to lift the convention that members don't usually lay parliamentary questions over the recess so that those questions can be spaced out in a way that's sensible rather than a huge backlog that might be put in next Tuesday afternoon?
Mr. Speaker, the Honourable Lady makes an interesting point, which I think is certainly worth us looking into in the few days that remain before we go on to recess.
Mark Pritchard.
Mr. Speaker, on the issue of the self-employed and freelancers, and following on from the Right Honourable Member for North Durham's question, can I ask that when a statement is given, hopefully it's a statement that comes forward quickly, given the immediate need of a lot of self-employed people, 6.5 in my constituency of the Wrekin. Could that statement be forthcoming when the House is sitting rather than when the House has risen, in order that honourable members and right honourable members can interrogate constructively the government's suggestions?
Well, my honourable friend puts his finger on the reason why it is important for the House to be sitting, so that the government can be held to account and that questions can be asked on statements. I am sure that within the next few days, if there aren't statements from the government, there may be receptiveness to urgent questions. So I think that information will be forthcoming.
Caroline Lucas.
Thank you. I welcome there's an indication of moving to more virtual ways of working, but could I ask that that also incorporates electronic voting as soon as possible? It is ridiculous that we're all going to be cooped up in those lobbies. And secondly, on self-employed, can I just reinforce the importance of action there and say in particular that the insurance companies need pressure put on them, because they are saying that because coronavirus wasn't listed as one of the diseases, they won't pay up. Clearly the insurance bodies need to be brought to heel here.
May I record my gratitude to the opposition for deciding not to divide the House last week. I think we have become aware that politicians in this country can act in the interests of the nation and of us all and can come together to do this. And I think that we have shown that with surprising speed. And may I reiterate the thanks given by my right honourable friend, the Secretary of State for Health, to his shadow, who has been particularly helpful in this difficult period. The issue regarding the self-employed is of great importance and has been widely raised.
Chris Brown.
I warmly condemn the... no, warmly commend. I warmly commend the Secretary of State for Health for recognising that sometimes people on this side of the House have been wanting to be helpful in the criticisms that they've advanced, and there have been specific issues such as the treatment of employees, the treatment of those who are in rented properties, and for that matter now, the point that's already been raised in relation to those who are freelancers and sole traders. I think across the House, proper questions can get us to a better place. But my anxiety is we're telling the nation that we should bend every sinew to deal solely with this issue in the country. And yet in the House, we're still doing all sorts of other things which aren't solely directed to coronavirus. Can I suggest to the government that we shred every other piece of legislative process that's going on at the moment? We should only be debating issues that relate to the national crisis. And can you just tell us when we're going to have the votes which are necessary under the Public Health Act 1984 to enforce the measures that were introduced last Friday in relation to pubs and clubs?
Mr. Speaker, I won't make cheap shots about the honourable gentleman's default position when he's trying to be helpful. The difficulty is that some of the business we carry on needs to be carried on. I think it is important that the Windrush compensation scheme is debated and dealt with tomorrow. The honourable gentleman knows the procedures of this House better than almost anybody and will be aware that we need to have the finance bill introduced within a set period of the motions being introduced. And so there is routine business that needs to be carried out. And there are other things happening where MPs will want to hold the government to account. So while I understand his point, I think we can't go quite as far as he is suggesting.
Bill Esterson.
Thank you, Mr. Speaker. But we can lead by example in this place, right here, right now. There are 4 people sitting within 6 feet of the Leader of the House as I look. Certainly less than the 2 metre. I'll come over the tape measure in a moment. But my point is this. We have to demonstrate by our actions. And I think the visual example with people sitting immediately in front and behind other members does not give that. But my main point is about the self-employed. My honourable friend from Cardiff West mentioned the statement from the Musicians' Union. When he speaks to the Chancellor about it, they have 2 specific proposals. One is an immediate payment of £400 to everybody who is self-employed per week. The second is to use the longer-term evidence in the records, in the tax records of income to deliver 80% of long-term income. Will he make sure that those figures are given to the Chancellor?
Mr. Speaker, I accept the point and encourage honourable and right honourable members to try and keep 6 feet apart. I think we're doing pretty well considering how much we practically sit on each other's laps during ordinary sessions of Parliament. So I think it is a very significant and visible improvement on what it used to be. And as he has asked me to be the postbox for the Chancellor, I will of course do so, and I will make sure those points are passed on.
Stephen Deutscher.
Thank you, Mr. Speaker. Can I add my voice to the chorus, those asking for measures on the self-employed, for the chance to come forward? Every single day that goes by at the moment is livelihoods devastated, and particularly the voice from the musicians and from the creative industry is absolutely vital. But can I, and I'll draw attention to my declaration of interest in that as well as a supporter of the Musicians' Union, but can I ask the Leader of the House to urgently get a statement on the situation for charities? There was a very welcome set of measures by the Chancellor on the wage subsidy, but of course charities are expending large sums of money on providing services, not just on staff, and they face a 4.3 billion drop in their income over the next 12 weeks. Hundreds of members from 8 parties in this House have signed a letter on that. Can he urgently get a statement, whether it's written or otherwise, clarifying the situation for them?
Mr. Speaker, I'm grateful to the honourable gentleman for raising the plight of charities, which is well known to the government, and the wonderful work charities are doing to help in these circumstances. I hope honourable and right honourable gentlemen members will understand that the government is working through a very large number of issues and is doing it in an orderly way. I think the priority was rightly to give reassurance to those in employment so that we didn't face mass redundancies, which was likely, but that doesn't mean that the charity sector and the self-employed have been forgotten.
Gavin Newlands.
Thank you very much, Mr. Speaker. Can I also echo the sentiment on support for the self-employed? But a sector that's crying out for support and clarity is the aviation industry. In addition, we have bus and coach companies who have drivers on short-time working who are unsure as to how to treat those employees. Has the Transport Secretary indicated to Leader of the House will be making a statement in due course?
Mr. Speaker, I think the issues with the transport industry have been at the forefront of people's minds from very early on in this crisis, and I know that my right honourable friend is working very hard to try and find solutions for these problems, and I will bring this to his attention and point out there is an interest in some statement being made to this House.
Liam Bass.
Thank you, Mr. Speaker. I very much associate myself with the calls from across the House for urgent action to help the self-employed. But can I ask the Leader of the House to bring forward a very urgent debate now about an issue that we've not touched on, and that is the need for urgent price caps and action to stop price gouging. I highlighted an issue in my constituency last week where a disreputable chemist had increased the price of children's medicine by tenfold. As I highlighted this issue, I have been flooded with complaints about businesses, small and large, doubling, tripling, quadrupling prices. 2/3 of American states have legislation in place, activated in emergencies, that sets a price cap of 10 to 20%. We are obviously going to need such measures here, and the sooner we debate them, the better.
Mr. Speaker, may I say first of all that at business questions, whenever a large number of honourable and right honourable members raise one issue with me, and in this case it has been the self-employed, I invariably raise that with the relevant department immediately after the session, and I will absolutely assure the House that I will do that in relation to this session. On his second point, profiteering is extremely disagreeable. There have been times in our history when it has been illegal and subject to quite strong penalties. His point is exceptionally well made, and I will ensure that it is made also to the right person in government.
Mr. Speaker, and I thank the Leader of the House for coming and making a statement as well. Also want to put a record my thanks to the Chancellor. The issues that are coming to myself and to others in this House are legion, whether they are HMRC, employment, whether they're health issues, DWP, business. But the help for the small businesses, which the government has guaranteed, is helpful because the employees are covered by the 80% grant, or monies that come forward to cover their wages. Those are small companies, by the way, that are lucky to have their jobs because the small companies that employ between 6 and 16 people, what happens is their employers cannot employ them because there's nothing in the package that seems to help those people. So the employees are looked after, it seems, and thank you for that, but the employers who employ those employees aren't. What can we do for them?
Mr. Speaker, the honourable gentleman as always gets to the nub of any matter that this House is discussing, and he is absolutely right. We are bringing forward packages to help as many people as possible, and the more people who are kept in employment, the more business there will be across the economy. But the scale of the effect of these closures on the economy is much bigger than anything that we have normally come across, which is why it has required this enormous response, including the announcement that I made at the beginning, that we would have a bill that allows for up to £260 billion to be advanced to departments.
Bob Seeley.
I'm delighted that my right honourable friend is making is going to go back to the relevant department when he about some of the matters raised. Can I add my voice to the importance of looking after the self-employed? In my constituency, we are going to be especially badly hit because of our reliance on tourism and the visitor economy, and many of those people are small businesses and self-employed, and our economy is going to be devastated this summer.
Mr. Speaker, his point is extremely well made and echoes what has been said by many other honourable and right honourable members.
Okay. We now come to Coronavirus Bill. Business of the House motion. Minister to move.
Formally.
The question is that Coronavirus Bill, Business of the House motion as on the order paper. As many of that opinion say aye.
Aye.
The contrary no. I think the ayes have it. The ayes have it. The clerk will now proceed to read the orders of the day.
Coronavirus Bill, second reading.
Now.
Minister to move second reading. Secretary of State, Matt Henkel.
Thank you very much, Mr. Speaker. I beg to move that the bill now be read a second time. Mr. Speaker, coronavirus is the most serious public health emergency that has faced the world in a century. We are all targets, but the disease reserves its full cruelty for the weakest and the most vulnerable. And to defeat it, we are proposing extraordinary measures of the kind never seen before in peacetime. Our goal is to protect life and to protect every part of the NHS. And this bill, jointly agreed with all 4 UK governments, gives us the power to fight the virus with everything that we've got. I'll give way, yes.
Well, the Health Secretary for giving way. Like many honourable members, I've had a huge number of issues raised with me by NHS workers about the issue of the availability of PPE to the frontline staff and also testing. Could he take the opportunity during second reading, because I know he wants to protect NHS staff through this bill, to update us, perhaps with any information as from across the UK about progress on those matters?
Yes, if it's okay with you, Mr. Speaker, I'll answer that intervention and then get on with the point in the bill, because these are out with the bill, but they're incredibly important and very much a part of the topic. In terms of making sure that NHS staff and social care staff and those who need it clinically get the protective equipment they need, especially but not only the masks, we are undertaking enormous efforts to get that equipment out. The equipment is there, we have it, it's a distribution effort. And because I wasn't satisfied with the stories I heard of people running short, we've brought in the military to help with the logistical effort, but also because I want to hear from every single member of staff in the NHS or in social care who needs that equipment but doesn't have it, we've introduced a hotline and an email address which is manned. I've had an update on that. It has had a number of calls, and they are all being responded to. And that way we'll find out where the gaps are to get this distribution out. So it's a mammoth effort. We've been working on it for several weeks, but the increase in the use of the protective equipment in the last week has been very sharp, as I'm sure he and the House will understand, and the logistical effort is a very significant one. On testing, we're expanding the amount of testing. We're buying tests. We're buying them, both ones made abroad and made here in the UK, because testing is absolutely vital to getting out of this. And I want to get to a point where anybody who wants to get tested can get tested. At the moment, we're having to reserve the tests that we've got for patients, especially in intensive care, so that they can be properly treated according to whether or not they have coronavirus, and very soon getting the tests out again to frontline staff so that they can get back to work if somebody in their household might have the symptoms and they're household isolating. So I understand absolutely the importance of testing. We're working on it incredibly hard. We were working on it all weekend, and we are making some progress. If I give way here and then there, and then I might make some progress.
I'm grateful to the Health Secretary giving way. I just wonder, on the point of testing, could he be absolutely clear? Does the current test available show whether somebody's got it and has previously perhaps had COVID-19? Does it do both, or does it do just one? And if it does just do one, when are we likely to have a test that does both?
Tests for both of those have recently been developed. The test for whether you have coronavirus, what we call the case test, that was first developed here by Public Health England, and that's being expanded. But also the antibody test to test whether you have the antibodies that make you immune to coronavirus, that has now been developed, and we're buying it in large quantities.
Nobody denies this bill is necessary, but given that this bill gives unprecedented powers to the state to enforce isolation on people who've committed no crime, for the first time in our history, will the Secretary of State reassure the House that this House will be fully involved in renewing this once this crisis is over, and there won't be any drift in this matter?
Yes, I'll turn to this point very shortly, but I would just correct my honourable friend, because the measures that we are taking in terms of being able to hold people in quarantine, they build on the 1984 Public Health Act, which are the ones that we've been using hitherto. So in that element, this bill is not unprecedented. What it does is it changes it makes these powers UK-wide, and it changes the basis and strengthens the basis on which they can be exercised, but are not unprecedented. But nevertheless, the point he makes about this House's ability to scrutinise these measures and to ensure that we are, as a House, content with their continuation is an important one. If I just turn to that, because I'm just going to answer this point by making a little bit of progress, and then, of course, I'll come through. Because the bill is jointly agreed between the 4 UK governments, and, of course, there are measures that are significant departures from the way we normally do things, but they are strictly temporary. And I think that they are proportionate to the threat we face, and they'll only be activated on the basis of the best possible scientific evidence. Crucially, to my honourable friend's point, the right honourable friend. Yes, I thought so. Crucially, the legislation is time-limited for 2 years, and the measures can each be switched on and off individually as necessary by the relevant authority, whether that's the UK government or the devolved government, depending on who exercises the powers. And, as an additional safeguard, we've brought forward an amendment to give this House the opportunity to confirm that the powers are still required every 6 months. And we've tabled that amendment today. I'll give way here and then over there.
I'm very grateful to my right honourable friend, and everyone admires the steps that he's taking. Just on this question of testing, he knows that I've been questioning and corresponding with him on this for some time. Can he explain, given that the test, as he pointed out, was developed in this country, why it is so much less available, it would seem, in this country than in other countries around the world?
Well, we have done more testing than most countries here. There are some countries that are ahead of us, and we're racing to catch up. So we've tested far more than, say, in France or America, but not as much as in Italy. So it's something that we're putting a huge amount of effort into, and I understand the pressure that he rightly puts on me to expand this testing capability, and we're increasingly using private companies to do the testing and to expand their production of the tests and the execution of the tests, rather than just doing it in the brilliant public health labs that we have at Porton Down and around the NHS. I will give way over there and then behind.
For giving way, and can I commend what he said about working with the devolved administrations to get the measures in this bill right. I think it's absolutely crucial that many of these measures are on a UK-wide basis. I realise it's unusual times. There's a specific power in Schedule 21 about the ability to limit entry into premises and to close down, again applying to all 4 administrations. Can you be clear about whether that will apply to care homes? Because I'm getting a lot of concern from constituents who are worried about some care homes that are still not restricting entry to individuals and therefore putting elderly residents at risk. There's a real demand for this to be unified across the country to protect the elderly residents.
We have other ways to enforce that with care homes, not least contractually through local authorities. I understand his concern, and to making sure that when people are in care homes, then they need to be protected, and many of them shielded from this virus, because many of the most vulnerable people are in care homes. I'll take away the point and to look at whether there's more that needs to be done, but we do have other powers that are available to deliver on what he and I think, agree is needed.
I thank the Secretary of State for giving way, and obviously I commend him for accepting the 6-month review, I think it is, that he has just announced. But will he tell the House, in the event that the House decides that one element of this Act is working badly, will we be able to amend or strike out that element, or do we have to take the whole thing or reject it at those 6-month points?
We're proposing, as discussed with the opposition, a 6-month debate and vote on the continuation of the bill. And before that debate, we will provide evidence and advice from the Chief Medical Officer to inform the debate. And there is also a reporting mechanism for a report every 8 weeks on the use of the powers in the bill. I'll give way. Thank you. I'll give way over here and then up there.
Can I first of all thank my right honourable friend for the time he has taken in explaining every stage that he has used the powers of his office to this House and indeed to the people through the media. I'm hugely grateful. I know many others are. Could I just, however, state that over the last 3 weeks the world has changed in a rather more radical sense than many of us appreciated, and the powers lying within this bill, even over 6 months, are likely to change and are going to be exercised in different ways. Can he assure me that not only he but all other ministers will be exercising their powers and looking at them reasonably in keeping with only the coronavirus issue and making sure that they are limited to the purpose for which they were intended? Because these powers could, in different circumstances, be used in a particularly malicious fashion.
Well, yes, I can confirm that this bill is to deal with the current coronavirus emergency, and that is an important point. But I'd also say that although the world has changed in the past 3 weeks in ways that many couldn't have imagined, every measure that has been taken by the government has been part of the action plan that we published 3 weeks ago. And this bill, which of course has been drafted over an awful long time because it started on the basis of the pandemic flu plan that was standard before coronavirus existed, and then has been worked on over the past 3 months at incredible pace by a brilliant team of officials right across government. This is consistent with the action plan, and so whilst some people might have been surprised by each of the measures we've taken, they have all been part of the plan that we set out right at the start. But I can confirm to him that it's only for coronavirus. And I also want to give further detail to my previous answer to the honourable gentleman from, I think, Swansea, who's on his phone. Thank you. Which is that Section 21 does not specify what it defines as a gathering or an event. It is deliberately broad, so it could include a care home, should we need it to, and that would be defined in secondary regulation, should that be necessary. I'll give way up here and then make some progress.
Thank you very much, Mr. Speaker. I'm sure the whole House will want to support my right honourable friend in the provisions of this bill. I just want to reinforce 2 points. The first is that I am was very concerned to see the 2-year time period, which is why I signed New Clause 1 and New Clause 6 in the name of my right honourable friend. And I'm very pleased to hear what the government has said about the 6-month review. But notwithstanding what he just said about the period of time in which this has been produced, it is a heroic effort. 321 pages of legislation, which may well be subject to changes in the next few weeks and months as this crisis develops. I hope, therefore, he will see the 6-month review not just as a rubber stamping effort, but also a chance to improve the legislation, should it require that improvement.
Well, we could consider that. The proposal is to have a debate and a vote, as opposed to a whole new piece of legislation, and of course only to renew it if the measures in the bill are still necessary, and then of course they'll fall after 2 years. I understand the concern of my right honourable friend and his wisdom, and I know that as Secretary of State he dealt with some of these issues, albeit not here but around the world, and he knows the sorts of measures that are needed, which are contained in the bill. I'll take one more intervention and then I must make some progress.
I thank the Secretary of State for giving way, and would he just clarify on the point of the 6 months? Obviously, for people who are chronically ill or have a serious disability, 6 months is quite a long time, and some of the changes are proposing social care implications with the devolved regions or with local government. What will happen if there is negative effects on people who receive social care within that six-month period? What recourse will members have to bring that to the House?
There is recourse. I'll come on to that in a moment, because in the social care measures, which are very important, the purpose of the social care measures in the bill is to allow for a prioritisation of social care, should that be necessary. But there are a number of restrictions on that, because local authorities will still be expected to do what they can to meet everyone's needs during that period. So whilst local authorities will be able to prioritise to ensure that they meet the most urgent and serious care needs, there are restrictions to require them to meet everyone's needs, and indeed to fulfil the human rights obligations that those in receipt of care have. One final time I'll give way, and then I really must make some progress.
I'm most grateful to the Secretary of State in giving way. Can I first of all thank him for the excellent work he's done in ensuring that individuals get the care they need in these difficult, challenging times. On the human rights perspective, can I thank the Secretary of State and the government for listening to faith organisations, because initially, under Part 2, there was concerns that loved ones would have to be cremated. And as somebody from a Muslim background, and also the Prime Minister's Special Envoy for Freedom of Religion or Belief, taking into account the views of the Muslim and the Jewish community, it was completely unacceptable to look at that. So can I thank the government for now ensuring that deceased wishes will be taken into account in relation to their final rights?
I pay tribute to my honourable friend who's worked hard on this to ensure that we come through with a solution in this bill, given the amendments that we've tabled today, to ensure that we can both have dignity in the case of a large proportion of the workforce not being available, but also accede to the wishes of the families and of faith, the communities of faith of many different faiths who had concerns with the way that this was originally drafted, and pay tribute to my right honourable friend of the Paymaster General, who found a way through which I think everybody can be content with. If I can make a bit of progress, Mr. Speaker, if I can make a bit of progress. Essentially, the bill gives all 4 UK governments a legislative and regulatory toolkit to respond in the right way at the right time and working through the action plan. And while I hope that some of these powers will never have to be used, We will not hesitate to act if that is what the situation requires.
I thank the Minister for giving way, and following on from the Honourable Member for Gillingham, I'm grateful for the work the Government has done in this area, because quite naturally many of my constituents, both from the Muslim background and the Jewish faith, were rightly concerned about this, and this is one of the major tenets of faith, and everybody has the right to have the dignity and faith in death. So I'm grateful for the Government to listen. But will the Minister also join me in this very difficult time for all our communities, the role that our faith communities and the difficult decisions that our faith communities are taking? Will he join me in thanking them for all the support they are giving?
I highly agree, and in a way this exchange is an example of the cross-party approach that we're all taking. I'm very grateful to the Honourable Member for the work that he's done on this, working with the Paymaster General and bringing this point to light. I'm also very grateful for the work that he's done with many others to ensure that those who understandably want to gather as faith groups of any religion, understandably it is upsetting not to be able to do that. But it is also right that they cease large gatherings, or indeed any gatherings where there is social contact that can spread the disease. It's happening around the world. It is a difficult thing for some, and I pay tribute to those faith organisations who have made the right decision and the faith leaders who have done the right thing across all faiths here, and I urge all faith leaders to see what has been done by those who've taken the right steps and follow them. I also want to thank the honourable gentleman opposite for the constructive approach that he's taken to the passage of this legislation and the constructive tone that he has taken to this whole crisis. And just to reassure him that I listen to what he says very carefully. Even when he doesn't agree, he's done so in a calm, sensible and evidence-based way. And I think you can see from the bill that we've taken on many of his suggestions, and they go into law along with the Labour administration in Wales and the SNP government in Scotland and the multi-party administration in Northern Ireland. We've taken on ideas from all parties. The measures in the bill fall into 5 categories. 1, because we rely on the NHS and social care staff now more than ever, the first set of measures helps us increase the available health and social care workforce. 2, easing the burden on frontline staff, both within the NHS and beyond. 3, measures to contain and slow the spread of the virus so we can enforce social distancing. 4, managing those who the disease has taken from us with dignity and respect. And 5, supporting people to get through this crisis. And I'm going to briefly take each of these 5 parts in turn. The first part is about boosting our healthcare workforce at a time when it comes under maximum pressure, both through increased demand and because household isolation and because large parts of that workforce may fall sick. The bill allows for the emergency registration of health and social care professionals, including nurses, midwives, paramedics and social workers. And I can tell the House, I can update with numbers, 7,563 clinicians have so far answered our call to return to work, including members of this House, and I want to pay tribute to every single one of them. These are difficult times, and they have risen to the call of the nation's needs, and we know that many more will join them. Our thanks also to the social workers who play such a vital role in protecting the most vulnerable in this country, and the bill protects the income and the employment status of those who volunteer in the health and social care system. Volunteers will play a critical role in relieving the pressure on frontline clinicians and social care staff, and again, I offer our thanks. I give way to the Liberal Dem.
I'm very grateful for the Minister giving way. Is he aware that there are many in the refugee community in the UK who are qualified healthcare professionals? I've spoken to refugee charity RefuAid, who says they have 514 qualified healthcare professionals on their book, people who are willing to work, fully qualified in their own country, but there are bureaucratic barriers for them coming forward. Will you please look at this with great urgency so these people can help us out?
Yes. If he'll email me with the details, we'll get right onto it. What he calls the bureaucratic barriers are, of course, we've got to make sure that people are able to do the work that is necessary, but we have already shown in the bill that we're willing to both bring people back into service and also put into service those who are towards the end of their training to make sure we get as many people in full service as possible. I absolutely want to pick up on the proposal that he makes and take it up with the GMC or the relevant regulator to see whether we can find a way through for the period of this crisis. I'll give way here and then there.
I just wonder whether he may not need an additional power in relation to the Home Office being able to waive the fees for Tier 2 and Tier 5 visas for foreign nationals who are already working in the NHS and are about to have to renew their status in this country, or for those who've been studying as students.
It's already in the power of NHS Trust to pay those visa fees if it's necessary. Yes.
Also look at the immigration surcharge as well for doctors and nurses who are working in our ICUs, and also would he look to personally at the issues around research trials for potential new drugs or treatments, or existing drugs or treatments that are being used, where I've had concerns raised with me that those processes are all being delayed by traditional randomised controlled trials processes, which may not be appropriate given the emergency we face.
Absolutely. This point is one that the Chief Medical Officer is personally looking into to make sure that when there's a treatment we can bring it to bear as soon as safely possible. Now, there is a challenge with a disease which has, thankfully, a mortality rate as a proportion of the overall population as low as this one, which is that you don't want to do more harm than good. But many of these drugs are already safe because they're already in licence for another purpose, and it's a question of repurposing. This is on treatment rather than vaccine, and is something that we're actively working on. If she's got examples of particular barriers that we need to crunch through, then I'd like to know about them. If she could email me, I'll take them up with the MHRA. I'll just make a little bit more progress, because I also want to bring the House's attention to the professional indemnity clauses. Where there is no existing professional indemnity agreement in place, the bill provides legal protection for the additional clinical responsibilities that healthcare staff may be required to take on as part of the coronavirus response. I don't want any clinician not doing something that they can do because they worry about the indemnity and what might happen if it goes wrong. I want everybody in the NHS to be doing their very best to the top of their qualification to be looking after people and keeping people safe. Yes, I'll give way over here and then up there.
Secretary, now can I commend him for everything that he and his team are doing in order to ensure that we have healthcare professionals who are returning at the right time, which is to say when this disease peaks around about Easter. We're going to have to really move at pace in order to put the indemnity he has cited in place to ensure that people are physically and mentally fit to do this work, and crucially to ensure that they are skilled or reskilled in order to do what we're asking of them. Can he assure the House that those three things are being put in place?
Absolutely. All of that is absolutely in hand. He's quite right to raise it.
I'm grateful to the Secretary of State for giving way and genuinely thank him for everything he is doing, and we are all rooting for him to be successful. I am genuinely worried about what is happening in London hospitals already and what that says about the prospects for the rest of the NHS. He's right to try and get staff to return, but we've got to be able to keep them there when they arrived. I've seen disturbing reports over the weekend of agency staff walking out mid-shift because they don't have the right protective gear and the right hand sanitising hand gel and the things that they would expect to keep themselves and patients safe. Can he look really urgently at this issue because London is really the story that will follow for the rest of the country if we don't get this right?
Yes, this is what I've been spending the weekend on. Absolutely, it's incredibly important. If I turn to the second part of the bill, Mr. Speaker, which is about easing the burden on the front line and follows from that intervention, this refers not only to the NHS front line, but to the dedicated public servants who guard our streets, who care for our children, look after communities in local government. In short, all those who keep the UK running safely and securely. By cutting down on the amount of paperwork they have to do, by allowing more remote working, by delaying some activities until after the emergency has ended, we can keep essential services going while we get through the pandemic. Some of the measures, Mr. Speaker, are difficult and not what we would choose to do in normal times. For instance, the bill will temporarily modify mental health legislation, reducing from 2 to 1 the number of doctors' opinions needed to detain someone under the Mental Health Act because they pose a risk to themselves or others. In circumstances where staff numbers were severely affected, the bill allows for the extension or removal of legal time limits governing the short-term detention of mental health patients. The bill also allows for an expansion of NHS critical care by allowing for rapid discharge from hospital where a patient is medically fit. NHS trusts will be permitted to delay continuing healthcare assessments, a process that can take weeks, until after the emergency has ended. The people who need this support will still receive NHS funding in the interim. The bill contains powers allowing local authorities to prioritise the services they offer, as we discussed earlier with relation to social care. And this prioritisation, while challenging, is vital. The measures would only be activated in circumstances where staff numbers were severely depleted. They do not remove the duty of care to an individual at risk of serious harm or neglect. We do not take any of these measures lightly, Madam Deputy Speaker. I hope that many will not have to be used, but we will do whatever it takes to beat this virus.
For the Secretary of State giving way, being very generous. On the point of frontline care, particularly those working in intensive care units around the country, can I ask the Secretary of State again, press him again, when will those staff be tested? There are many staff that want to go to work but are afraid that they may be carrying the virus. And those that are at work, if they're tested and they have the virus, they want to go and isolate in order that they can return as quickly as possible to the front line. When are they going to be tested?
The answer is as soon as the tests that we're buying are available, and expanding testing is absolutely critical to everything that we're doing. Madam Deputy Speaker, this section of the bill also covers other mission-critical parts of public services, not just the NHS, including schools, borders, justice and national security. The bill empowers schools, for instance, to respond pragmatically to this situation, including the ability to change teacher ratios, to adapt school meal standards and temporarily to relax provisions for those with special educational needs. The bill also gives the Home Secretary the power to close and suspend operations at UK ports and airports, powers that will be deployed in circumstances only where staff shortages at the border force pose a real and significant threat to the UK's border security. It expands on the availability of video and audio link in court proceedings, so justice can continue to function without the need for participants to attend in person, and to ensure that the Treasury can transact business at all times. The bill makes it possible for a single minister or Treasury Commissioner to sign instruments or act on behalf of other commissioners. At a time of unprecedented social disruption, it is essential also to maintain our national security capabilities. The bill allows temporary judicial commissioners to be appointed at the request of the Investigatory Powers Commissioner, and for an increase in the maximum time allowed for an urgent warrant to be reviewed from 3 to 12 days. This means that vital investigation warrants can continue to be issued and our security services and police can continue to protect the public. And I'll give way.
Secretary of State for giving way, and on the key points of people with mental health problems being signed off by one doctor and the question of children with special needs and a loosening of the regulations around that, what measures can be put in place, perhaps by local authorities or by others, so that there is a review mechanism on those two very important, crucial points for vulnerable people?
Well, clearly, these are issues of the highest sensitivity. It is important that we take these measures in case they're needed in the circumstances where staff numbers available are low, to make sure that we can get these the support needed as appropriate and make the interventions that are sometimes difficult to make. Because it can be, in some circumstances, far worse, for instance, not to detain somebody under section in the Mental Health Act, where they are a danger to themselves or others. And if there isn't the availability of a second doctor because of staff shortages because of the virus, then I think it is appropriate. But the safeguards are an important part of getting this right, and it's an important part of why this is time limited.
He's been incredibly generous. Section 23 talks about food supply chains, absolutely crucial, and he'll have seen that many supermarkets are taking on additional workers to meet the demand that's there. But whether he could provide an answer or get one from the Treasury, I've had many people who are thinking of applying for those jobs, perhaps to make up loss in income. So even if they're covered by the 80% wage subsidy, whether they're able to take on extra work or they would lose the 80% wage subsidy from their existing job. Could he get some urgent clarity on that? Because it could be deterring people from taking up those important jobs in our supermarkets and supply chains.
Well, that really is a question for the Treasury. My understanding is that the 80% wage subsidy is for those that are furloughed, as the Chancellor put it, as opposed to those who've moved into other jobs. But he'll have to ask the Treasury for a more detailed answer. I'll give way over here.
Can I thank the Secretary of State for giving way and also for all the work that he is doing and indeed the House is doing with regard to this essential legislation. Can I ask him with particular regard to university settings? Seems to be some confusion. I've looked at the sort of Universities UK advice, but it seems to be that some universities just don't seem to be following this and seem to be requiring students to attend, notwithstanding the advice the country at large may be given.
I'm surprised to hear that because we've been very, very clear about universities alongside schools. Of course, it's a matter for my right honourable friend, the Education Secretary, in the first instance, but on the public health grounds, we made it absolutely clear that we were taking the steps to close schools and nurseries and universities and colleges, except for the children of key workers, where they absolutely need to be at school, where they, for instance, need a parent can look after them, but all those at university can stay at home on their own and don't need a parent, and so I don't think there's any excuse whatsoever. I'll give way.
I'm extremely grateful. Our local authority, the new Unitary Bucks Council, has made the point that workers who are furloughed in leisure centres may need to be redeployed into other council areas where they wouldn't normally be employed. This raises a particular problem that they really need to use the furlough scheme, take those workers out of the leisure centres and put them into social care, quite a different industry. Will he undertake to make sure that that is possible?
I don't think it needs a legal change in order to do that, because to essentially second somebody from one job into another is perfectly possible under existing employment law. In fact, the bill brings in a statutory volunteering scheme, which is essentially a new form of employment through volunteering, which is one way that this could be done. But I wouldn't expect it to be the main way, because if somebody was moving to do a different type of job, because we need more people doing some things and fewer doing others during this crisis, that sort of secondment can be done in an entirely normal way, unless I've misunderstood my other friend.
Well, he's slightly misunderstood, and I hope he won't mind me saying so. The point really is that all councils will be hemorrhaging money at this time, and they will need that 80% support with those workers who they would otherwise furlough, so they can then use them as volunteers. The point is to constrain cost.
Okay. I'll take that up with the Chancellor of the Exchequer. I'll give way one more time and then make some further progress.
I thank the Secretary of State for giving way. Whilst we understand that these are exceptional circumstances, there is understandably grave concern about the lowering of social care standards. We are talking about some of the most vulnerable in our society, the elderly and disabled of all ages, and having the human rights, the Convention on Human Rights as a backup could see care standards lowered to a dangerously low level, putting these people at risk. Could the Secretary of State outline what will be the thresholds for turning these powers on and indeed back off again to ensure that these do not become the new norm?
The threshold is about the amount of staff shortages that there might be, and I would gently, Madam Deputy Speaker, say to the Honourable Lady, I understand her concerns, but in fact the purpose of these is precisely the opposite. It's to make sure that those who need social care, when there is a shortage of social care workers, those who need social care to live their everyday life can get it, and that they can be prioritised over and above those who have a current legal obligation to legal right to social care under the Care Act 2014, but for whom it is not a matter of life and death. So this is absolutely about prioritising the vulnerable, and that's the purpose of the legislation. But I understand where she's coming from, and that's why we've put the safeguards in place to ensure that the prioritisation is as intended. If I could just, yes, one more, and then I'll move on.
Thank you. I'm so grateful for my representative for giving way. I want to ask a generalised question about the supply of medicine. Paul Howard, a consultant in palliative medicine at our excellent hospice on the island, says that under patient group direction, that's group prescriptions, nurses can give out morphine, but due to a quirk in the rules, they can't give similar powerful opiate painkillers. My question is, will this bill enable nurses to give controlled drugs as part of patient group direction, specifically just in case medical supplies run short, but specifically also because we are reliant on ferries on the island, and it gives us slightly more diversity in patient treatment?
Well, I'll look into the specific point that he makes. There are parts of the bill that would help to tackle the problem that he describes if it's appropriate to do so, but I think it's better if I get some medical advice and get back to him. The third part of the bill, Madam Deputy Speaker, are measures to slow the spread of the virus. As this disease accelerates, our goal is to protect life, to protect the vulnerable, and to protect the NHS by flattening the curve and minimising unnecessary social contact. This is a national effort, and everyone has their part to play. Self-isolating if you or anyone in your house has symptoms, working from home wherever possible, avoiding social gatherings, and of course, regularly washing your hands. And the bill provides for us to go further. It gives us stronger powers to restrict or prohibit events and public gatherings, and where necessary, to shut down premises. The bill gives the police and border force the power to isolate a person who is or may be infectious. And this part of the bill also allows us to close education settings or childcare providers and to postpone elections that were due to take place in England in May this year for 1 year. And these measures, Madam Deputy Speaker, are not measures anyone would want to take, but they are absolutely necessary in this crisis. I'll give way there and then here.
To the Secretary of State of giving way, he will be aware that over the weekend thousands of people made the distance to holiday areas and rural areas such as mine. Can I just ask him, in terms of Schedule 21, do the powers there allow ministers to require people, in the circumstances where local health boards are saying that they are under increased pressure, to remain in their primary residences?
It's a really important point, because we have advised against all unnecessary travel, and I don't regard going to your holiday home in Wales as a necessary journey. There is a risk of putting extra pressure on the NHS in rural areas from large numbers of people going to second homes, and so I entirely understand the concern that the Honourable Gentle has raised. And the powers do allow for a constable to take somebody to a place in order to prevent the spread of the infection, and making sure, therefore, that we can police the public health guidance that we've given. And we've been absolutely clear over the last few days that if people do not follow this advice, then we will not hesitate to act. And we did this last week with pubs and clubs and restaurants, where we said that people shouldn't go. It was clear that some were still open, and so we then took the decision to close them down with the enforcement powers for the police and trading standards. And this bill provides those powers more broadly. I'll give way to the front bench of the Scottish National Party.
I'm very grateful to the Secretary of State, and I'm pleased with what he's said. This is a very significant problem. I've had more than 1,000 emails over the weekend from constituents that are petrified as to what is going on. The Highland area is more than 10% of the UK landmass. We have one acute hospital in Inverness. Some of these tourist destinations are more than 3 hours from Inverness. We have been absolutely inundated with people that show no concern for the local population. People that are saying that they've now been denied the right to travel to the islands by ferry because we've stopped it, that they're going to come to Skye. This is a dangerous, dangerous situation where they're imperiling the lives of our constituents. They must go home and they must stay at home, and I'm sure the Secretary of State would agree.
Well, what can I say? I am concerned that people are not following the public health advice.
And to the Secretary of State for giving way. Some holiday companies have been responsible. So Sykes Cottages, for example, has cancelled a whole raft of bookings for weeks ahead. But my honourable friend, the member for West Ham, raises by phone the fact that there are lots of Airbnb bookings still available in holiday resorts. Surely this is irresponsible. If the companies won't do the responsible things by limiting access to holiday properties, does this bill give the government to act? And if so, will the government act to stop this kind of behaviour?
Well, if it is deemed a risk to public health, then this bill does give the potential power through secondary legislation to take action if that is needed. I'll give way here and then here.
I'm grateful to him for giving way, and I mean this in a constructive way, but it does feel that we are constantly behind the curve. We are always waiting for people not to do what we've asked them to do before we then step in and try to introduce more strict communications. And so I would beg him, will he underpin this legislation and everything else the government is doing with a much bigger, wider, louder, more comprehensive public education campaign? Because right now it clearly is not getting through. Anyone who is looking at the coverage over the weekend around people gathering in Richmond Park and elsewhere will know that it's not being heard. We need to be doing an awful lot more to be able to catch up and get ahead of this.
Madam Deputy Speaker, there is the most comprehensive public communications campaign probably in the history of government peacetime communications, and maybe I'll send a poster to the Honourable Lady. Yes.
My right honourable friend, the issue around Brits seeking to isolate in remoter parts of this country is a big issue for me again in Rutland. Over the weekend I went around the constituency, I saw pile after car, I saw caravan parks open and hotels advertising for self-isolation holidays and breaks within my constituency. So can he just confirm, for the benefit of all those in the House, that the current guidance is that people should stay in their own homes and should not be travelling for self-isolation holidays or anything of the sort?
Yes, I agree with my honourable friend. If I can turn, Madam, I'll take one more intervention, and then, Madam Deputy Speaker, if I might make some progress.
I'm grateful to the Secretary of State being very generous, but these are important issues. On the issue of social distancing, is there something that he feels might happen tomorrow that currently isn't happening today as far as people's behaviour is concerned? People gathering in their thousands on the beautiful landmark of the Wrekin in my constituency. It's right that people should have exercise, physical, mental health and well-being, but social distancing is not being followed by many, and whether it be the Wrekin, whether it be Holland Park or Hyde Park or St James Park, or in counties around this House today, can I ask what behavioural changes he expects? Is it not the case that we will have lockdown, and isn't it better to have it today rather than next week?
Well, my honourable friend makes an important point, and we're absolutely clear that we're prepared to take the action that is necessary. I'm going to make some progress. The fourth part of the bill contains measures for managing the deceased in circumstances where many of those involved in the registration and management of death will themselves be self-isolating. And we want to ensure that those taken from us by the virus are treated with the utmost dignity, while protecting public health, of course, and respecting the wishes of bereaved families. Among other measures, the bill will expand the list of people who can register a death to include funeral directors. It will mean that coroners can only have to be notified where there isn't a medical professional available to sign a death certificate. It'll allow death certificates to be emailed instead of physically presented. It'll remove the need for a second confirmatory medical certificate in order for a cremation to take place. And the bill gives local authorities the power to take control of elements of the process if needed. These powers would only be used if absolutely necessary and on clinical advice. But, Madam Deputy Speaker, we plan for the worst, even while we work for the best. I'll give way and then make some further progress.
So we'll know that the new medical examiner has been introduced in many areas, including in Durham. They have a role of looking into deaths in hospitals. Clearly, their role is going to be inundated if you get large numbers of deaths. Is there anything in the bill that loosens up their role? Because otherwise they're going to be overwhelmed by the number of examinations they'll have to do.
Well, I very much hope that they won't, and the medical examiners regime is a very successful one. That, as he says, we're expanding across the country, and we don't deem it necessary, not least because we think that we can expand that if necessary. So we don't think that there's need for a statutory change in what is an area that's improving. I'm going to turn now to the fifth and final part. I'll give one more time, and then.
I'm very grateful. It's just obviously there may be instances where it's impossible to allow for a normal funeral in the way that one would be used to having, and it might be that there have to be mass funerals, or for that matter, that there might have to be instances where just one person is allowed to attend apart from the celebrant themselves. I wonder whether it might be possible to ensure in all local authorities, in particular in crematoria, that it's possible to film such moments so that at least loved ones have an opportunity to feel that they're somehow engaged and online, if not in person.
I know that the Honourable gentleman speaks from experience of having presided over these events, and yes, that is available and increasingly available, and I entirely understand why many people would want that. The fifth and final part of the bill includes measures to protect and support people through this crisis. This is not an exhaustive list of everything we plan to do, but the principle is that no one should be punished for doing the right thing and self-isolating if they or someone in their household has symptoms. And to make that happen, the bill will ensure that statutory sick pay is paid from day one, and this will be applied retrospectively from the 13th of March. Small businesses with fewer than 250 employees will get a full refund for sick pay relating to coronavirus during the course of the emergency. And finally, the bill will require industry to provide information about food supplies. This all comes alongside our plan for people's jobs and incomes announced by the Chancellor on Friday. The bill allows the 4 UK governments to activate these powers when they're needed and deactivate them when they are no longer needed. We ask for these powers as a whole to protect life. We'll relinquish them as soon as the threat to life from coronavirus has passed. And Madam Deputy Speaker, this bill means we can do the right thing at the right time, guided by the best possible science. That science gets better every day. This disease can isolate us, but it cannot separate us from the ties that bind us together. And with patience and resolve, and with the painstaking use of data and evidence, with the whole nation working together as one united kingdom, we will get through this, and I commend the bill to the House.
The question is that the bill be now read a second time. Shadow Secretary of State Jonathan Ashworth.
Thank you, Madam Deputy Speaker, and may I start by putting on record my thanks to the Secretary of State for his kind words, but also for the way in which he has continued to keep me updated throughout this process, for the arrangements he has made for us to be briefed by officials and the Chief Medical Officer, for keeping me informed of government decisions and for ongoing engagement with the bill. And I hope that he understands, and indeed members across the House understand, that when we ask the Secretary of State probing questions, we do so constructively, and we do so not to undermine the Secretary of State or to create some false dividing line for the sake of political point scoring. We do so because this is a frightening time for our constituents, and we all have an interest in ensuring that the government get this right, and we want the government to succeed in defeating this virus. Can I just make a few remarks about the position as to where we are responding to the virus before moving on to some specific comments about the bill? But as always, our thoughts are again with those who have lost loved ones to the virus, and again we put on record our praise for the extraordinary efforts of our NHS staff and other dedicated public servants. This unprecedented global health crisis tests each and every one of them like never before. We are forever in their debt. And today, this House is being asked to make decisions of a magnitude I simply would never have dreamt of only a few weeks ago. And I know no member came into this place to put powers like this onto the statute book, powers that curtail so many basic freedoms that our forebears fought so hard for, and so many today take for granted. But I also know that every member here will want to do all they can to support all means necessary to save lives and protect our communities in the face of this virus. This is a global health emergency, the like of which the world has never seen since the Spanish flu outbreak over 100 years ago. Throughout this outbreak, I have said this virus spreads rapidly, it exploits ambivalence, it thrives on inequality. And the government has quite rightly, quite correctly, sought to promote social distancing as a means to reduce person-to-person transmission of the virus. These measures have been, for the most part, on a purely voluntary basis. But still, too many, I am afraid, are not following the advice. We'll all have seen this weekend the pictures of bustling markets, packed tube trains, busy beaches and parks. I'm afraid the public health messages still are not being heard loud and clear. Everyone who can be at home should be at home. Everyone who can must work from home if they can. And this House must also send a clear message to young people, to millennials, that they are not invulnerable either to this virus. They are at risk too. And to be frank, Madam Deputy Speaker, we in this House need to adjust our behaviour as well. I love and respect this chamber. I think members will agree that I relish the cut and thrust of robust debate across these dispatch boxes. But if other workplaces can use Zoom calls and Skype and conference calling and so on to make decisions, then why can't we? So I do look forward to the reforms that Mr. Speaker is looking into. Yes, of course.
I'm very grateful, and can I also thank him and the Secretary of State, who are remiss not to do so, for the way in which they're both responding to this crisis, even though they're on opposite sides of the House, in the interests of the country as a whole. And I think the whole House appreciates both of them for the way in which they've conducted themselves throughout this crisis. On the point that my honourable friend is raising, an acquaintance of mine who's an NH nurse asked the question, why is the public creating more work for us, medical staff, and exposing us to the risk of dying? And I thank my honourable friend for giving those messages so clearly. Does he think there's more that could be done to communicate more effectively to the public what social distancing means in practice and how people should behave, given the scenes we've seen this weekend?
I mean, I do agree with the honourable gentleman. I did note that the Secretary of State talked about the comprehensive public health advertising campaign, and we welcome that campaign. But we would encourage the Secretary of State to use his offices to see if that comprehensive campaign can become even more comprehensive. Could we have more adverts on television, more adverts on radio stations? Can we have a leaflet going through every door, for example, explaining what social distancing means, explaining what shielding means? Before this virus took hold, I don't think the words social distancing and shielding were used often in this chamber at all. So if they're not words that we are familiar with, we can bet that our constituents are not entirely familiar with, of course.
The Shadow Secretary giving way. He will know Telford and Wrekin very well. He's visited many times indeed in the last 12 months, flooding and other issues, and I'm grateful for his visits despite being an opposition member. Is he aware today that the Labour-led council, a decision by the way that I support, has decided to close all of its public parks and play areas and open spaces that it runs, and that in turn is going to cause more pressure on the other open spaces that are not currently run by the local authority? So can I encourage him to continue to press the government to move quicker to this lockdown that we all want to avoid, but will ultimately save lives?
I thank the honourable gentleman for his contribution, and I have to tell him my attempts to change the political complexion of Telford and the Wrekin have completely failed to date. But I am grateful for his comments. I'm grateful for his comments about the Labour Council, and I think this is the nub of the matter. It's a point I just want to put the Secretary of State, who, while he is still here. Sadly, we've just heard, or it's just been reported on social media that the case fatality figures are continuing to climb, and there is some discussion on social media that we are seeing now an exponential growth in line with Italy. Now, I appreciate there's different demographic issues in different nations, but clearly people are of concern that our death rates are increasing and at a rate which suggests we could be heading to an Italian-style situation. We all know what's happening in Italy, And I think the point is that we've also got at the same time clinicians telling us or warning us that our intensive care bed capacity, our high dependency unit capacity could very quickly be overwhelmed. We've already seen a critical incident at one hospital, and no doubt we will see more in the coming days. And this is a crisis, and it is a crisis which demands an overwhelming government response. Yes, of course.
I think it's vitally important that we have a sense of national unity on this. So if it becomes necessary for the government to impose a lockdown, which I suspect may well become necessary if people don't change their behaviour, can we rely on the opposition to support the government?
Hear, hear.
The Honourable Gentleman has rather anticipated my point, because looking at the graphs, and I do caveat this with a recognition that different countries have a different demographic profile, but in terms of fatalities, we are now beyond the numbers when Spain and France announced their stricter enforcements, their lockdowns. I don't really like the term lockdown because it actually means different things in different contexts, but I think we broadly understand what we're talking about this afternoon. I would say, to answer the Honourable Gentleman's point, that we as a Majesty's Loyal Opposition actually do now call on the government to move to enforced social distancing and greater social protection as a matter of urgency. Because I'm sorry and disappointed, but I'm afraid that many people are not adhering to the social distancing that we expect. Yes.
I thank the Shadow Secretary of State for Health. Would he agree with me that he's absolutely right in the points he makes, but there are those that are finding it difficult to socially isolate themselves because of the financial circumstances they find themselves in, such as self-employed taxi drivers, those in the gig economy, and others who sometimes are actually just getting by in the first place. So there needs to be clear financial packages available to put those people on equal footing and provide that facility for them also.
Honourable friend is absolutely right, and it's a point that has been made repeatedly by my honourable friend, the Leader of the Opposition, and the Shadow Chancellor, and I put it like this. I think the challenge to social isolation will not be boredom and fatigue, as some of the behavioural scientists have suggested. I think the biggest challenge to social isolation will be personal finances and so on, which is why the measures that we have put forward on sick pay are so important. It's why we have welcomed some of the measures that the Chancellor announced last week, but we think they need to go further. I'll just give way to the Honourable Lady from Brighton, and then I'll make...
I'm grateful to him for giving way, and grateful to him as well for taking more seriously the issue of communications than the Secretary of State did. The point is that we do need leaflets going house to house, and we need them in different languages as well, so that different communities can actually hear this. His point about a strict lockdown is well made, but can I just echo what others have said about the importance of guaranteeing economic security to make it much more possible for people to actually cope with that, and in particular for those people who are self-employed, who are struggling so much now. Statutory sick pay is not enough for them.
Right, I'm very proud to represent the great city of Leicester, probably the most diverse city in the United Kingdom, where every language in the world is spoken. So I entirely endorse what she is saying. But of course, if we funded local government properly, local government would be able to put in place the sorts of measures that she is talking about. And of course, I entirely agree with her broader point that if we are having to ask people or force people to stay at home, then we would support the government if it took that action. And I think the government do need to take that action. Then we also need to provide people with the economic security that they rightly deserve. I promise, I'm afraid, I'll give way to Mountain Friend Cardiff and Wally, then I must make some progress.
I thank my honourable friend for giving way and for the whole way in which he's approached this issue on a day-to-day basis. I completely add my support to what he said about the need for enforced social distancing, and I know that there are many members across this House on all sides who would support that. I've been struck by contact I've had with friends in Italy and elsewhere who are simply aghast, quite frankly, that we haven't moved to tougher measures sooner, and anybody looking at those graphs, anybody looking at the situation there, definitely wants to avoid that here, so I'd wholeheartedly support him, but it's got to come with those economic measures that he's rightfully talked about.
I totally agree. The honourable friend from Wally, and then I'll make some progress.
Thank my honourable friend for giving way. And a lot of talk about income, but it's also about expenditure. I've had many complaints from constituents about prices rocketing, particularly for staples. What's really unclear is whether it's the fault of the retailers or the wholesalers and the cash and carry, or indeed of the suppliers. Now, I know the Competition and Markets Authority are looking into this. Can we, in his discussions, urge the government to do that urgently and, frankly, crack down on profiteering from people's difficulty?
Friend for Wally makes an excellent point, and we're seeing it in my own constituency, and I've had complaints from my own constituents about this exploitative profiteering. So I hope the government can come forward with some proposals to stamp it out. It is an absolute disgrace that this is happening at this time of national crisis. Honourable friend. And then.
I also raise the issue of, once again, of housing. Social isolation it is great, but if you happen to live with your family in one room in a shared house, as so many of my constituents do, sharing kitchens, sharing bathrooms, deeply overcrowded, this is a really difficult thing, particularly when the kids are off school. So there needs to be some thought about letting them out in parks and stuff like that, because they don't have gardens.
My honourable friend makes an excellent point. I, like her, well, I represent a inner city seat. I appreciate her seat is on the outskirts of London, but nonetheless, both our seats will have similar demographics. And I know full well that there are many, many families living in very cramped, small flats, intergenerational families with perhaps elderly mums, elderly grandmothers and so on, who will have various comorbidities, perhaps, who actually need to be shielded. So I hope if we do go into a situation where we're forcing people to stay at home, that the government is looking at how to support these families. Because I do think it is quite outrageous that in many parts of the world, especially in London, but also in my own constituency, we'll have flats with families of 9, 10 people, people sleeping on floors, and so on. And then we have property developers who have flats standing empty. Why cannot we take over some of those empty flats to house some of these very vulnerable families to help us get through this national crisis? The honourable gentleman.
Can I commend him for the stance he's taking in this debate? I think the whole House will respect him for it. But the series of interventions he's just had, I think, demonstrates something, a rather wider point. And that is the need for the government, sadly, and I didn't think I'd ever say this in this House, but the government to get into intrusive levels of planning that we've never seen before. Because every time we have a change in the level of ferocity or whatever intensity of our dictation to what the state should do, what the society should do, we run into a new set of problems. Whether it is crowding on the tube trains, overwhelming our own desire to have social distancing, or whether it's young mothers having children at home, finding very difficult to get to supermarkets and therefore literally running out of food, even more fundamental than running out of money. And so we need to think forward. And I say this because we've seen in Europe, between Germany and Italy and Spain, very, very similar levels of, very, very similar policy actions, but completely different outcomes. And I suspect it's because of a different approach, maybe by the German government or German society, than the Italian or Spanish or whatever. And we have to think about that as we go into the next stage.
The honourable gentleman is absolutely right. We are asking people, and probably on the cusp of forcing people to radically adjust their behaviour in a way in which we haven't been used to probably for 70 years, but more than 70 years. The last time we asked people to radically adjust their behaviour was in the Second World War. We have generations here who are not used to this. We're a society where we're used to going where we want, buying what we want, doing what we want, socialising when we want. And clearly, for a lot of people, it is not dawning on them that they are going to have to change the way in which they behave. And that does have huge knock-on effects. Knock-on effects for how public services are going to organise themselves, knock-on effects for how the criminal justice system is going to have to work, knock-on effects for how the food distribution systems are going to work. And it is right that we continue as parliamentarians to ask government ministers serious questions about that. But we also have to be aware that we have a responsibility to set an example to the country. We have to socially distance ourselves. So I really hope that the good offices of the Speaker and the Leader of the House and everyone who is involved in House business can quickly find a satisfactory set of procedures for us to continue having our discussions and asking ministers questions, but not setting the example that we are unfortunately setting today. I'm not making any personal criticism of any member because it's the situation we're in. We have to debate this bill today, but we are going to have to hold government to account on these far-reaching, extensive powers that they are taking. So perhaps I will, and then I must make some progress.
The Honourable Gentleman always listening with great attention to what he has to say. Would you agree with me that part of the problem with this is policy has to be based on behavioural science? Yeah. But behavioural science is one of the most imprecise of sciences. It's not like chemistry or physics. And there's the difficulty. And it means that we have to have a wide margin of error when designing policy. What that means, in effect, is erring on the side of caution and safety, which I think is the burden of the direction that he is urging upon ministers. And that, in a sense, is getting ahead of the curve by bringing in measures which we all would regret. But if we're going to base policy on behavioural science, it being fairly inexact and difficult to predict, as we've seen over the weekend, we have to have that margin of error, that caution, which I think is what he is recommending.
I think the Honourable Gentleman has shrewdly interpreted the stance I am taking. Throughout all this, given the way in which this virus spreads so rapidly, and given its reproduction rates, and given the mortality rates, I have always urged upon the government to take a precautionary principle approach to every decision they are making. I have been a bit sceptical about some of the behavioural modelling that has been used. I mean, I'll just give the Honourable Gentleman a quick example before returning to my remarks. I think we've all heard throughout this, before the government banned mass gatherings, we were told by ministers and officials, and I hope no minister takes this as a personal criticism. I certainly don't mean it. I'm not saying it in that respect, in that way. That there's no point in banning the football match with 70,000 people in the stadium, because the person with the virus isn't going to infect the other 70,000 people in the stadium. And actually, if you stop them going to the stadium to watch the football match, they'd all go to the pub and watch it there, and they'd infect more people at the pub. I'm sure the Honourable Gentleman has heard the example. Well, I'm very proud to represent Leicester City Football Club in my constituency, and all the football fans, or a large proportion of the football fans, go to the stadium before the match and go to the stadium after the match. Pub, I beg your pardon, pub. They go to the pub before the match and they go to the pub after the match. And some of them do avoid the stadium, actually. Yes. You see, yes, they go to the pub. But you see the point, the Honourable Gentleman sure sees the point I'm making. Some of these behavioural models don't always, it would seem, reflect how humans behave. And given that, I think ministers and government should be taking a precautionary principle at all times, which is why we are now urging government ministers to come forward with their plans for enforcing compulsory social distancing. There are different models in different countries, but we have France, we have Spain, we have Italy, we have New Zealand overnight, we have Greece, we have Germany banning more than 2 people meeting outside of their house other than families. There are different models across the country. We think the time has come for the United Kingdom to go down this line, and we would encourage the Prime Minister to come forward with plans for how he thinks it should apply in the United Kingdom. Okay, and then I must make a bit of progress.
I thank the Shadow Secretary of State for giving way. Behaviour is changing, and unfortunately some of it is unhelpful. I've had probably one of the most upsetting emails throughout this today from my local food bank, who tell me that 2 of the main supermarkets in the area are refusing to sell them food. The people who get that food from the food bank have no other means of obtaining food in the midst of this crisis. And does he agree with me that the government needs to speak urgently to the major supermarkets to ensure that food banks are able to secure sufficient supplies to supply people who have no other option?
It's a very good point, and I totally agree. That's an absolute disgrace, and I hope the government can look into that, because food banks shouldn't be necessary in this day and age, but we know they are so vital in this day and age, and I hope the government can resolve that swiftly. But so we would, to originally answer the Honourable Gentleman's point who asked it me so long ago, we would support the government if they came forward with such proposals. But suppressing and defeating the virus is about more than just so-called lockdowns and enforcement, however. We need more testing. We need more contact tracing. We need more isolation to break the chains of transmission as well. Because as the World Health Organization has famously instructed the world, test, 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 we agree. And on this side of the House, we have called for testing for the virus to be carried out within our communities on a mass scale, starting with NHS and care staff as a priority. We urge the government to rapidly scale up testing, and we also thank, of course, all NHS lab staff and PHE staff who are working so hard. Could the government consider, for example, what is happening in the Republic of Ireland, who currently have 35 community testing facilities in operation? They have 6 more planned. The largest one, Croke Park Stadium in Dublin, provides a drive-through service that is dealing with which tests 1,000 people per day. Okay.
I completely agree with him on the need to, in particular, protect all key workers and therefore make sure that there is testing available for them. But is it not important that at the same time we make sure that path labs have enough resources and capacity to be able to do, for instance, cancer biopsies and get them fast enough back to people, because all those other conditions and diseases which are very time critical will be just as important.
Absolutely right. Path labs, virology labs are under intense pressure because not only are they being asked to test for COVID-19, they also have other testing responsibilities as well, whether that's HIV or influenza or measles or all the other illnesses which are still circulating and still have to be treated as well. So he makes a very, very important point. I just hope the ministers in response could just update us on testing capacity, because looking at the figures, it appears that between 21st and 22nd of March we did around 5,500 tests, but the previous day we did 8,400 tests, and the previous day to that around 8,100 tests. So I'm told that many labs at hospitals haven't been able to start testing or are currently testing at under-planned capacity because there is now supply chain issues with the relevant chemicals that are used and the kits to do the testing. If this is the case, could the government update the House on what they are doing to urgently procure the testing kits we need? And could the government also explain to the House why we are not currently part of the EU joint procurement project initiative for testing kits and indeed other equipment? And of course, I emphasise the point that I've made in this House before, that we really need to be testing our NHS staff. Not testing NHS staff puts them at risk, and it puts their patients at risk. This weekend we heard powerful messages from doctors, literally shouting out for help, telling us they feel like lambs to the slaughter because of failures in the distribution of protective kit and not able to get access to testing. I've heard of GPs, indeed GPs have got in touch with me directly, telling me they're going to DIY stores to make their own PPE kit. And indeed, one of the healthcare supply chain distribution chains of today, it's reported, have put out a call to DIY stores, asking them to donate, to hand over their visors and goggles. Pharmacists are worried that they can't get through to CCGs to get the appropriate PPE when sick patients are walking through the door daily asking for advice. We've heard stories of community nurses, health visitors, paramedics without the PPE. And indeed, the Daily Telegraph reports today of staff at Northwick Park Hospital forced to wear bin bags because of a lack of PPE. The health, happiness and the lives of our constituents and their loved ones and neighbours depends on our NHS staff now more than ever. We shouldn't expect our NHS staff to go into battle exposed and not fully protected, lacking the armour they desperately need. If more PPE has been delivered in the last 24 hours, as the Secretary of State indicated, then we welcome that. But to be frank, it shouldn't have taken so long. Our NHS staff deserve every ounce of support we can offer. And on that front, could ministers also consider binning hospital car parking charges for NHS staff as well at this time of crisis? And those working in critical services more widely, our police, our care workers, our postal workers, need the appropriate protective clothing too. We urge the government to ensure all public services can access the appropriate PPE speedily. For example, In the Sunday Times yesterday, it was reported that flights continue to arrive at Heathrow from Italy, Iran and China. Those flights are obviously coming from hotspots. I mean, perhaps ministers could explain why that is still happening. But also, what protections are being afforded to airline and airport workers, or what measures are in place in respect of those passengers on arrival? And on the tube and on the train, there is real worry that services are being reduced too steeply, again, causing our key workers onto crowded carriages, putting everyone at risk. So what assurances can ministers give us that there is a sufficiency of public transport services to get our frontline workers safely to their workplace? Let me turn to some specifics in the bill. First on health and social care clauses, which the Honourable Lady from Twickenham raised with the Secretary of State. But first on the health clauses, the bill makes provisions for retired staff and final year medical and nursing students to rejoin the health service for the duration of the pandemic. We understand why and welcome this. Can ministers tell the House, either in response to the debate or in the committee stage, if final year nursing and medical students will be able to return to learning and complete more supported clinical placements if needed once the crisis is over? Can ministers also outline how these students will be fully supported while working during what will undoubtedly be an incredibly stressful time for new doctors and nurses? Will students be properly remunerated for their work, and what protections will be available for retired staff, many of whom could also be in the vulnerable group? And also I put on record our thanks to those retired staff who have returned to the front line. Madam Deputy Speaker, some of the most vulnerable people in the country absolutely depend on all of us here to defend their human rights and civil liberties, and that they are the ones in receipt of adult social care services. On social care, this bill makes sweeping changes to the duties which are placed on local authorities. It removes the duty to assess care needs, including on discharge from hospital, so there will be no duty to assess people who might need care or their carers, and no duty to assess some of those with the most severe needs who may be eligible for continuing health care. Can ministers reassure us that this will not mean that carers, disabled people and older people are left abandoned by the state until after this crisis? Most significantly, it downgrades the level of support which councils are obliged to provide to older and disabled people. Rather than the current wellbeing measures, councils will now have to provide services where necessary to uphold people's basic human rights. In short, this means that they will only be entitled to receive social care to keep them alive and uphold their rights to privacy and a family life. Obviously, this is not the vision of the social care that we legislated for in 2014, but we all appreciate these are incredibly difficult times. Many older and disabled people and their families will be concerned that this will lead to existing care packages being significantly reduced overnight. Local authorities are already struggling to meet statutory needs, and increasing levels of workforce absence will only make this harder. What none of us want to see is the new legal minimum of support become the default. Where local authorities can provide more comprehensive packages of support, they should do that, and they should always bear in mind that people who use social care are not simply passive recipients. They are doctors and nurses who rely on social care, as well as teachers, shop staff, food manufacturers and countless other vital professionals. When councils are reducing care packages, they must be careful not to end up causing yet more difficulties for staff in crucial services. Yeah.
Shadow Secretary of State for giving way. Would he agree with me that in a context where the courts are likely to be stood down and where disabled people often ensure that their rights are protected through the courts, that we're in a doubly difficult situation for disabled people and for elderly people?
Absolutely, and it's why these particular clauses in the bill have to be scrutinised and looked at so carefully by members across this House. We've put down amendments to Schedule 11 to recognise that we recognise there will be difficulties delivering social care over the coming weeks and months, but it should not be possible for local authorities to immediately drop care packages to a lower level. As long as it is reasonably practicable to do so, they should continue to meet people's care needs. The presumption should always be that services will be disrupted as little as they can be under the circumstances. Nothing in these amendments would stop a local authority cutting back care hours if they have to, but it would mean that disabled and older people can be reassured that any reductions in their care will be a last resort rather than their independence being the first sacrifice to be made. There are also particular concerns about people who live alone or are being held in inpatient units and care homes. We have seen visits to these settings stopped as part of the government's shielding approach, and the CQC have halted all inspections. But we know from incidents like Walton Hall that it's too easy for abuse to go unnoticed, something which the current situation could make worse. How will we ensure that some inpatient units and care homes don't become hotbeds of abuse of human rights over the coming months? Of course.
This is precisely the reason I asked the Secretary of State earlier on whether, when we get to the 6-month review and renewal of this business, that we will be able to amend the bill. Because if there are oppressive behaviour in one part or another, whilst the rest is all very, very important to the survival of our people, what stance will the Labour Party take on that?
Well, I think the Honourable Gentleman is absolutely right. We cannot just have a take it or leave it approach to these things, because we are the House tonight will give the government extraordinary powers like we've never seen before, and it's right that we as parliamentarians are given an opportunity at after the appropriate time frame to look how those powers have been used and hold ministers to account. So I think I agree with the spirit of the point the Honourable Gentleman is making, although I cannot at this particular stage, it may emerge later in the debate I suppose, but I can't at this particular stage give him a commitment on a particular amendment this way or the other, but we'll see how the discussions proceed throughout the afternoon. But I certainly endorse the spirit of what he is saying, because these are, as I say, quite extraordinary powers that the House will be granting to the government this week. But to come back to the amendment that we are putting down a new clause related to Schedule 11, and we are proposing that a relevant body, such as the Equality and Human Rights Commission, be tasked with overseeing the impact that this bill has on the provision of social care. They would have to report every 8 weeks on the operation of these changes and whether they should be amended. They would provide the oversight which is needed to prevent people's rights being undermined. One of the ways that the bill seeks to free up medical staff is by relaxing the requirements in the Mental Health Act. Specifically, it means that only one medical professional will have to agree to someone being sectioned rather than the 2 it currently takes. The scale of this change should not be underestimated. No longer will a decision to section a person have to be taken in consultation by two doctors. There will be no requirement for anyone involved to have prior involvement with the patient. Our medical professionals are going to be under huge pressure over the coming months, and mistakes may well be made. The bill says a decision should be taken on the basis of one signature if requiring a second signature would be impractical or require an unhelpful delay. This seems too vague and potentially open to misreading. I hope ministers can tell us what exactly this means and what safeguards will be put in place to prevent this change being misused. Our amendments to Schedule 7 would mean that this would be narrowed so that a second signature can only be left off if acquiring it would mean an undesirable delay. If something is impractical, it will, by definition, create an undesirable delay. By narrowing the wording in the bill, we can avoid, we believe, the potential misuse of powers. We are also proposing changes to ensure that private mental health hospitals cannot detain someone solely on the single recommendation of one of their employees. This could create a conflict of interest whereby a doctor comes under pressure to sign a detention authorisation because doing so will provide their employer with income from the NHS. No medical professional should be put under that kind of pressure, and our amendment ensures that it cannot be. Was the Honourable Gentleman seeking? No. The bill also extends the length of time somebody in hospital can be held waiting to be sectioned, up to 5 days from 3. This may seem like a minor change, but for the individual concerned, it could make a significant difference. I hope ministers can reassure the House that the intention should still be to adhere to the timetables set out in the Mental Health Act, with the changes we are discussing today only to be used if absolutely necessary. Turning to some of the proposals on education and schooling. Many parents of children with special educational needs and disabilities will understand the need for flexibility during this difficult time, but they are also extremely nervous that they could see the erosion of their hard-fought-for rights of disabled children and young people, children and young people with special educational needs particularly, and their families. The bill gives the Secretary of State powers to change Section 42 of the Children and Families Act from from giving children rights in law to requesting public bodies take reasonable endeavours. We believe this sets a low bar, and we'll be seeking changes to a duty to take all practical steps which will be much further. Moving on to some of the other issues in the bill, we are concerned, has been alluded to, that the bill has still not gone far enough in providing people with the incomes that they need in order to did I have a no? That the income that they will need in order to self-isolate. We welcome much of the Chancellor's statement last Friday setting out plans to support the incomes of workers impacted by the coronavirus outbreak. However, there are still some gaps in the provisions that were offered. Currently, as it stands, the proposals for income support through the Job Retention Scheme does not include the self-employed and freelancers, whose incomes are now increasingly being seriously affected by the coronavirus outbreak. Will the government today offer assurances to these groups of workers who don't have the safety net to safeguard and help them through this time? We have welcomed new measures by the government to improve access to statutory sick pay for workers. However, the bill doesn't extend eligibility to all workers, including the just under 2 million workers who earn less than the threshold to qualify of £118 a week on average. It doesn't raise the level of statutory sick pay, which is at £94.25, which is already the second lowest in Europe. It doesn't raise the level. So these are issues that we will hope the government would respond to quickly, because as we have continually said throughout this, people should not be expected to make a choice between their health and hardship. Madam Deputy Speaker, nobody also should lose their home because of this virus, and it's welcome that ministers have listened to Labour and committed to an evictions ban for renters. But despite promises made by the Prime Minister that the government would legislate for this, this is not currently in the bill. 8.5 million households rent their home from a private council or housing association landlord in England. Our analysis of government statistics show that 6 million renting households have no savings at all and are particularly vulnerable if they lose their job or have their hours cut as a result of coronavirus. To give people confidence and reassurance during this difficult time and ensure that no renter loses their homes as a result of coronavirus, rent needs to be suspended for those adversely affected by the impact of the coronavirus outbreak. Madam Deputy Speaker, like many members across the House, we as the opposition support this bill with a very, very heavy heart. Heavy not just with the shock and grief that this deadly virus has brought, but also with the very real threats that emergency powers of this nature pose to human rights. The bill contains the most draconian powers ever seen in peacetime Britain. Powers to detain and test potentially infectious members of the public, including children in isolation facilities. Powers to shut down gatherings, which could impede the ability to protest against the overall handling of the crisis or against the abuse of these powers themselves. It needs no explanation and very little imagination to understand the huge potential for abuse that powers like these and others in the bill, however well intended and needed, still contains. These words will chill every liberal and libertarian instinct of members across this House, and it's why we were grateful to the Health Secretary and the Solicitor General for discussing these measures with us and my shadow Cabinet colleagues in the rapid preparation stage of this bill. We've heard many wartime analogies in the press. Many have talked about Winston Churchill. Of course, Churchill not only was remembered for victory in the war, but he was remembered for the European Convention on Human Rights at the end of the war. So notwithstanding the Anti-Human Rights Act and anti-judicial review grumblings we've heard in recent times, this bill comes under cover of a statement of compatibility under Section 19 of the Human Rights Act. Further, the bill does not attempt to oust the supervisory jurisdiction of the courts. That means every single exercise of executive power and administrative action under this legislation must and will be measured against human rights and common law standards. These include necessity, proportionality, rationality, fairness, and crucially non-discrimination. I thank the government for this concession on its part and for agreeing, I hope once and for all, that human rights and the rule of law, far from impeding national efforts in times of crisis, should instead guide and inspire them. It's important that various measures in this bill Some interfering with liberties and other deregulating standards may be turned on and off as and when needed by the appropriate administration under our devolution settlements. It's welcome that the bill contains a 2-year sunset clause, but Madam Deputy Speaker, as we have discussed, 2 years is a very long time in normal days, longer still in the context of this pandemic, which is why we on this side tabled an amendment last week seeking parliamentary votes on the renewal or revocation of these emergency powers at 6-monthly intervals. Indeed, many of us would prefer even more frequent reviews, but given the particular challenge, even for Parliament of this crisis, I am glad the Government seems to have moved some way towards the compromise offered by the opposition in the constitutional interest. I hope, of course, and then
I welcome the spirit in which he's making his speech and also his proposal for review at 6 months, and I certainly support that. But would he agree with me that we could sunset the powers in this bill after 1 year, and the government could then bring forward a bill? There's plenty of time to do it between now and then, and that bill, which would go through Parliament about this time next year, could make whatever changes prove to be necessary between now and then, and would not involve us today signing off on 2 years. So review, and then after a year, a bill.
Well, as I understand it, our amendment is calling for a review every 6 months. But the Honourable Gentleman makes an interesting point, which I'm sure that the ministers will respond to in the committee stage and when we get to that point later on. So, Madam Deputy Speaker, I hope the Government will be able to explain the differences between their amendment and ours and reassure the House that there will not be large exceptions to the 6-monthly review, especially in England, which has only this House to hold executive power to account. We have been scrutinising this bill on behalf of our constituents. None of us came into politics to put a bill like this on the statute books, and I, for one, will never rest until the day, hopefully not too far away, when I can come to this House to vote to get rid of this bill. But, Madam Deputy Speaker, what we have seen in recent months is concerning, if not frightening, all our constituents. And it is right that we are taking the powers that we are taking today, although we have to continue to hold government to account. We will overcome this virus, Madam Deputy Speaker. And when we do, serious lessons will have to be learned. The crisis has exposed the vulnerability of a society in which insecure work is rife, deregulation is king, and public services are underfunded. When we come out on the other side, as we will, we have to build a society that puts people first.
Order. It's been very important that Honourable and Right Honourable members have had the opportunity to intervene on the Secretary of State and the Shadow Secretary of State, but that has inevitably meant that the opening speeches have been somewhat longer than normal, so therefore there is immense pressure on time. I would say two things. Those who have intervened a lot might feel that they had made their points and might not want to continue to make another speech. There is also, I would point out, the committee stage where a lot of issues have been raised. But it's very difficult to see how everybody's put their name down for this second reading debate, which has to finish at 8 o'clock. It's difficult to see how they can all get in. But I would start by urging colleagues to stick to 5 minutes, obviously not the leader of the SNP, but that way we can hopefully get as many people in as possible. Jeremy Hunt.
Madam Deputy Speaker, the Health Secretary, quite understandably, is not in his place, but I wanted to start with a tribute to him. I think I am the only person in this House who's sat behind his desk, and I can testify even without a pandemic it takes years off your life. And this Health Secretary has made himself exhaustively available. He has worked tirelessly, and no one could have done more or better to prepare the NHS for the crisis we now face. And I also want to thank the Shadow Secretary of State for the way that he has risen to the challenge of his role, and all of us as parliamentarians are proud of the exchanges that we've had this afternoon and on many occasions. Ordinarily, our role as MPs is to scrutinise every detail of legislation, to understand it, to try to improve it. And there are many questions about this legislation, but we are in a national emergency, and every day we delay could cost lives. So I support this bill 100%, and I encourage all colleagues to do the same. A week ago, the government said we were 4 weeks behind Italy. That then changed to 3 weeks behind Italy, and today our mortality rates are just 2 weeks behind Italy. Our hospitals, especially in London, are filling up. We've had a critical incident at one. Others say they're running out of ICU beds. According to the papers, we have one nurse fighting for her life in an ICU unit. One London hospital has 7 doctors in just that one hospital, also with the virus. And yet still, people are going to shops, parks, beaches, holiday homes, as if nothing has changed. It may be too late to avoid Italy, but to have any chance at all of doing so, we must move to lockdown rules now that ban non-essential travel. It is time not just to ask people to do social distancing, but to enforce those social distancing rules. Not next week, not this week, but right away. So I support the call made by the Shadow Secretary of State to do that, and I think it's very important we do so as soon as we possibly can. There are 2 areas I think this bill could help with. The first is on protective equipment for staff. Last week, Sir Simon Stevens told the Select Committee that there were sufficient national supplies of PPE, but distribution problems. And since then, I know the government has moved heaven and earth to try to resolve those. All hospitals have had deliveries, and I pay tribute to the Health Secretary and everyone at the HSC for doing that. But there is still a lot of concern on the front line. And the main reason for that is because on March the 6th, Public Health England downgraded the recommendations as to what PPE equipment doctors should use. That appeared to be at odds with World Health Organization recommendations. I understand that has now been clarified by Professor Keith Willett in a message sent out on Friday that does bring our advice more into line with WHO guidelines. And most importantly, the advice now makes it clear that you should wear goggles if there is any risk of being sprayed. But obviously doctors would feel vastly more secure with more extensive protection of full-length gowns and FFP3 masks. So is not the solution just to order manufacturers to make more of this vital equipment? Not just a little more, but massively more. And if that needs legal powers, then this bill should give the government those powers to require every factory that is able to devote itself to the production of this life-saving equipment to do so. Madam Deputy Speaker, numerous doctors have died across the world, including Dr. Li Wenliang, the courageous Chinese doctor who first tried to blow the whistle on this virus. 23 doctors have died in Italy. This weekend, France lost its first doctor, and none of us want that here. So, given the total determination of the Health Secretary to protect our frontline staff, could he urgently look into whether we need to be manufacturing more of the highest grade equipment? I'm happy to give way.
I'm grateful to my right honourable friend. Does he share my dismay at being told just now that my authority, Wiltshire, is having masks and PPE that were meant to be delivered tomorrow, now being delivered on the 9th of April? I'm not sure what the situation in Surrey is, but that seems to me to be extraordinary. Would he also agree that it has to be the right PPE? It can't simply be a paper face mask necessarily from B&Q, as we've heard earlier on. It needs to be appropriate, and people need to know how it works. And when you wear it, that you're likely to have to work harder, because wearing PPE is not easy, it's not straightforward.
Well, my right honourable friend knows this as a clinician himself, and I am concerned that in our desire to get PPE equipment out, we haven't understood the vital importance that local authorities play in this, because residents in care homes are extremely vulnerable and their carers need that equipment. So I very much support his concern on that. A second area which I think the bill needs to do more to help on is testing. Now, a week ago today, our strategy changed from mitigation to suppression, and I strongly support that change in strategy. Suppression strategies have been followed very successfully in South Korea, Taiwan, Hong Kong, Singapore and China. places that appear to have turned back the virus. Here, all our public focus has been on social distancing, but testing and contact tracing to break the chain of transmission are every bit as important, if not more important. And those countries that have turned back the virus rigorously track and test every case and every suspected case. They identify every single person a COVID-19 patient has been in contact with, and they take them out of circulation. The result is that those countries have avoided the dramatic measures and some of the economic damage that we have seen in Europe. South Korea has avoided national lockdown, despite having a worse outbreak than us. Taiwan introduced temperature screening in malls and office buildings, but kept shops and restaurants open. They've had just 2 deaths. In Singapore, restaurants remain open and schools are reopening, although working from home is discouraged. Again, in Singapore, just 2 deaths. But 10 days ago in this country, we went in the opposite direction and stopped testing in the community. How can we possibly suppress the virus if we don't know where it is? So far, we have had 281 deaths, tragically. According to the modellers, it's about 1,000 deaths for about 1,000 cases for every death. So that means we've got just under 300,000 cases in this country. And according to those same modellers, it's doubling around every 5 days. That means at the end of next week, we will have around 1 million cases or more in this country. Unless we radically change direction, we won't know where those 1 million cases are. Now, the Prime Minister talked about expanding testing from 5,000 to 10,000 to 25,000, which is welcome. He even talked about 250,000 tests a day, which would be more than anywhere in the world, and I welcome that ambition. But ambition is not the same as a national plan, and we have not seen a national plan on testing. I will give way to the Honourable Lady, yes.
I thank the right honourable gentleman for giving way. He may have seen reports today that there are actually some care providers who are refusing to take patients that are being discharged from hospitals because those hospitals are unable to test them before discharge. And quite understandably, care homes are concerned about having patients who may be carrying the virus being admitted given the other vulnerable people in that care home. Would he agree with me that as the testing is ramped up, as well as health and care professionals, patients being discharged should be a priority?
Well, I am very worried about that. A doctor in my own constituency told me of exactly the same problem. And of course, the risk is that hospitals then fill up and don't have the space to treat people who urgently need hospital treatment. But we have this ambition to increase testing to 25,000 tests a day. But at the moment, we are still only testing between 5,000 and 8,000 people every day. On Saturday, we tested 5,500, which is no significant increase to a week ago. Now, it's not just South Korea that's testing more than us per head of population. Germany is, Australia is, Austria is as well. So now is the time for a massive national mobilisation behind testing and contact tracing. Now is the time, if we do have that antibody test, to become the first country in the world that says we are going to test every single citizen. Now's the time to introduce weekly tests for NHS and social care staff to reduce the risk of passing on the virus to their patients. If the Crick Institute in London is doing any research into anything other than COVID-19 right now, they should stop it. We need them to be designing tests. If the Sanger Institute in Cambridge is still decoding genomes, they should not be. We need them to process COVID-19 tests. And it isn't just the science, Madam Deputy Speaker. Contact tracing is manpower intensive. Yet Public Health England has just 280 people devoted to this. We probably need 280 people in every city and county in the country. Every local government official doing planning applications, every civil servant working on non-corona issues, volunteers, all should be mobilised in this vital national task. And testing is also, as we heard, absolutely vital for NHS staff, desperate to get back to work. Here's one tweet from a midwife called Katie Watkins, who speaks for so many. She said, "I know this is happening all over, but I had to call in sick for my clinical shift on a labour ward today as my husband spiked a temperature last night. I feel fine. yet cannot go to work? Where are the tests for NHS staff I could be helping, but instead am sat at home? But testing is also vital, Madam Deputy Speaker, for the economy, because if we are going to have a year of stop-go as we try to protect the NHS if the virus comes back, then testing and contact tracing allows an infinitely more targeted approach and an infinitely more targeted way to control the spread of the virus than economic measures that are much more blunderbuss and do much more damage. This bill could help that by giving the government powers to require any pharmaceutical company in the country to manufacture tests, require any laboratory in the country to process those tests. It could stop the scandal of £375 tests being available to wealthy people in Harley Street, when in a crisis every spare test should be used by NHS staff to get them back to work. And this bill could help with something else done very successfully in South Korea and Taiwan, namely the use of mobile phone data. In those countries, they look at the mobile phones of COVID patients to identify other phones that they have been nearby when that patient was infectious. Now, that has civil liberty implications, but in this national emergency, being able to do that would save lives. So those powers too should be in this bill. Finally, please do not take my word for this on testing. Dr. Tedros, the Director General of the World Health Organization, and virtually every epidemiologist at the World Health Organization makes the same point. His words: "It is not possible to fight a fire blindfolded. Social distancing measures and hand washing will not alone extinguish the epidemic. Our key message is to test, test, test." Two other very brief issues, Madam Deputy Speaker, because I know that time is short. On social care, we've had very good points made this afternoon. This bill replaces the duty to meet care needs for local authorities with a power to meet care needs, except when it's a breach of human rights. Bluntly, there may be less provision of social care as a result, and we understand in this House why that may be necessary. But if this lasts as long as a year, that will mean more pressure, not less pressure, on hospitals. If there was any lesson from my time as Health Secretary, it is that you need to invest in social care as well as in health. And we need to make absolutely sure with these new measures that we don't have the unintended consequence of putting yet more pressure on hospitals that are already on the point of falling over. Secondly, and my final point, on mental health, the measures in this bill mean that someone can be sectioned not by 2 doctors, but by 1 doctor, and that doctor doesn't have to be someone who knows the patient. Now, I understand why we're having to take these measures, but obviously that causes huge concerns amongst people in the mental health community, that someone could be locked up on the say-so of a doctor who doesn't even know them. So I would like a commitment from the government that all cases will be reviewed on the basis of the current procedures as soon as this virus is behind us, and certainly within the first 3 months of this virus being behind us. I just want to finish with a tribute to frontline staff, Madam Deputy Speaker. This is not from me as a politician, but from an 8-year-old constituent of mine called Tamsin. She said, "I really want to thank all the doctors and nurses who are working so hard to look after all the sick people. They're all risking their own lives to try and stop the coronavirus instead of being safe at home. I'm missing my Nana, Gamma and Grampy a lot because they have to be isolated at home, but if they get sick, they will need the doctors and nurses to help them get better. Doctors and nurses are amazing." Tamsin is right. We mustn't let them down.
Ian Blackford.
Thank you, Madam Deputy Speaker. And I must say it's a pleasure to follow the Right Honourable Member for South West Surrey. And I have to say, I don't think, and he will not mind if I put it this way to him, I cannot think of a time when I would almost agree with every single word that he said, and I hope that people do listen to his wise words from his experience. There's an awful lot in his contribution that was sobering. And I have to say, I think the way that we're conducting this debate and the collegiate style of this debate, the contribution from the Secretary of State and from the Labour front bench, is a tantamount to the importance that we all give to this, to the crisis that we're all in. And I think the desire that all of our constituents would have in this vital issue, in this national emergency that we all do work together. Madam Deputy Speaker, I want to begin by saying something that is often repeated but simply can't be said enough. From all of us on these benches, I want to thank all of those that work in our NHS. To our doctors, our nurses, and all those others in support roles around them, who day after day make the choice to go into work, literally risking their own health to save the lives of others. At a time when the fragility of human life occupies all of our thoughts, their example, their care, and their limitless compassion is a source of inspiration and comfort to all of us. They are nothing short of heroic. In return, Madam Deputy Speaker, they deserve all of our thanks. But even more importantly, they need all our support. Today, all of us would do well to keep in mind that the primary purpose of the emergency legislation is to help them, to help those that work in our NHS across all these islands. They need our help to slow the spread of this virus. They need our help to flatten the curve of infection. And they need our help to reduce the pressure on their services. In taking forward these emergency measures, we all have to be fully transparent and open. That means being honest about the uncertainty of the timeline ahead. There are few things we can say for certain, but we know we are only in the foothills of this mountainous challenge. There remains a long way to go. We have to be honest that in fighting this virus, we may be only approaching the end of the beginning. No one knows for sure when this will end. But we do know that NHS and governmental action won't be enough on its own. Everyone has a part to play. We can only get through this, and we can only overcome it when we all work together. Let me turn now to the specifics of the emergency legislation. Firstly, I'm pleased to confirm that the Scottish Government has worked constructively with the UK Government on this bill. That is important to say given the context of the last few years. It is no secret that there has been a virtual standoff in other legislation. However, the joint efforts and the extensive cooperation on this legislation highlight the extraordinary public health and economic challenges posed by this virus. Passing this legislation is fundamentally about protecting and saving lives. Politics cannot be allowed and will not be allowed to get in the way of this. The Scottish Government tabled its legislative consent motion with advice to approve consent on Holyrood last Thursday. The LCM will now be considered by the Finance and Constitution Committee at Holyrood on Tuesday morning and will be debated in the Chamber on Tuesday afternoon. The urgency of that timeline is unfortunately necessary. Madam Deputy Speaker, it is clear and we accept that this bill cannot be scrutinised in the way that we would normally wish. The immediacy of the pandemic and the unprecedented challenges facing Scotland and the rest of the UK simply do not permit that. The stark reality is this: there is simply no time to lose.
I thank the right honourable member for giving way. There is common cause even between Unionists and Nationalists on this issue, and the Northern Ireland Assembly will tomorrow give consideration to the legislative consent motion. Does he agree with me that before this legislation is enacted and enforced, that the government must move swiftly to reassure self-employed people who he represents and I represent, to give them the reassurance they need before these measures are implemented, that they will be supported?
I'm happy to say I completely agree with my right honourable friend. He and I were at meetings with the Prime Minister last Friday morning, and there was a consensus about the economic measures that had to be taken for those that were in employment. One of the reasons being we were fearful of the potential risk to unemployment if we didn't do so. And I commend the government for the actions that were taken and the announcements that we had last Friday afternoon. But there is unfinished business for the self-employed, for the unemployed, and we need to make sure, Madam Deputy Speaker, that collectively working together, that we do what we need to secure the incomes of those that we are asking to take action to protect themselves and protect the rest of us over the course of the coming months. And I do hope that the Chancellor will be in a position to meet with opposition leaders over the course of the next few hours and to come to this House tomorrow to tell us all as to what we're going to do to make sure that we protect the interests of absolutely all of our citizens.
Very grateful to my right honourable friend for giving way. Over the course of the weekend, I've got a number of Glasgow taxi drivers that live in my constituency and they're self-employed. Many of them last week have taken their cars off the road. So can I say to the government, through my right honourable friend, that really the time is running out here. We really need the Chancellor to come to the Chamber tomorrow and make crystal clear that support will be given to taxi drivers and lots of other self-employed people, including those in the wedding industry, because time is running out. The measures that have been brought forward so far are very, very good, but for self-employed people, time is literally running out.
I agree with my honourable friend, and I hope the Minister make some reference to this when she sums up later in the debate, because we're respectfully saying to the government, let's work together to make sure that we can offer that financial security that all of our citizens need, whether you're talking about taxi drivers in Glasgow or whether you're talking about those that are providing bed and breakfast, guest houses and so on in my own constituency, that I'm asking that they shut their doors. It is important that we provide the financial security that they all need. Madam Deputy Speaker, it is impossible to understate the scale and the seriousness of this health and economic emergency. None of us have witnessed or experienced anything like this before. It is no exaggeration to say that the COVID-19 threat is the biggest challenge that we have faced since the Second World War. That is the frame of mind that all of us should be in. It is for that reason that the extremity of this time that we welcome the measures in this bill. They are the measures that we need to fight this virus. The breadth of measures contained in this legislation reflect the enormity of the challenge across these islands, whilst they also include bespoke provisions for Scotland to reflect our different legal system. For the public looking on today, it is crucial that we explain fully that the powers that are being discussed and sought and the reasons for. They include additional public health measures to assist with the containment or the mitigation of the spread of disease. Give me some time and I will. The part of the world I live in, the Highlands, needs the powers in this bill if we're to protect our population. And I know that that goes for many other honourable and right honourable members as well, not least the honourable member for St Austell in UK, who I know has been outspoken on this over the course of the last few days. Madam Deputy Speaker, let me put on the record the challenge that we're facing. If I take the Highland Council landmass, it is 25,656 square kilometres. Of course, this area doesn't include Argyll, the Northern Isles or the Western Isles. That Highland Council area is 32% of the landmass of Scotland and 10.5% of the UK landmass. We have one acute hospital in Inverness. For many, that hospital will be more than 3 hours' drive from home. Just think about that. If we think of those that live in the urban areas, if there's a hospital that has an issue with capacity, often people can be transferred to another hospital. We don't have that opportunity in the Highlands. We have that one hospital. And I'm asking everyone that is thinking about coming to the Highlands to think about that threat that there is to our NHS. Now, I've been working with the NHS, I've been talking to the police. And on the back of what we have witnessed over the course of the weekend, I would want, with your forbearance, to read to you a press release which came out yesterday afternoon from the Chief Executive of NHS Highland. As a community in the Highlands, Argyll and Bute, we are friendly, welcoming and hospitable to the thousands of visitors that we get all year, every year. However, We are currently in a situation that we have never experienced before, and for the first time, we're making a plea for you to stay away. We have heard that there are many people using camper vans, motorhomes to make their way to the Highlands and Argyll and Bute as a way to self-isolate during this period. Please don't. National advice is quite clear that we as a nation need to stay at home, self-isolate and stop all non-essential travel. This includes using our area as a safe haven. We have asked our communities in NHS Highland to do everything that they can to stay safe. This includes self-isolating, working from home where possible, and limiting their contact with the outside world. Madam Deputy Speaker, that is a very clear and it is a very stark message.
On that point, will you give way?
I will give way on that.
I thank the right honourable gentleman for giving way. This situation is fluid and ever-changing, and I'm sure everyone is receiving multiple emails about the changes in the constituency. And the point that my right honourable friend makes about the need to self-isolate is absolutely a central part of any infection control programme, and it is a public health emergency. And constituents of mine have contacted me today to say that their employer, Amazon, is refusing to pay members of staff unless they self-isolate and can prove that they have a positive COVID test. That is forcing people to make a choice to go into work and not self-isolate. Does he agree with me? That is absolutely reckless behaviour on behalf of Amazon.
I have to say that is the height of irresponsibility, and Amazon and anybody else that would behave in that way needs to think again. Now, of course, there are companies that are engaging in best practice, and I've had a number of complaints from people in the Highlands. I will in a second to allow the honourable member in. I've had lots of complaints about those that haven't been doing the right thing. But let me thank Highland Express Tours, who I spoke to this morning, who have suspended all their activities and sent their drivers home. Now, I know the honourable member for Enfield mentioned Sykes Cottages earlier on, and I have to disagree with them because their behaviour has been absolutely reprehensible. And let me read to you what they sent to me on Saturday. Given concerns surrounding the current outbreak, it is understandable that people want to arrange private accommodation in more remote locations to distance themselves from larger towns and cities. As latest government advice does not prohibit travel in the UK, we are continuing to provide a service for customers. Madam Deputy Speaker, a service for customers to come from the urban areas, deliberately creating the circumstances that their customers should come and self-isolate in an area where we have limited public health capabilities. It simply was not good enough. And I'm delighted to say that on the basis of the pressure that has been put, that they have now relented and they are stopping new bookings and sending people up to the Highlands and Islands over the course of the next few weeks. But I'd simply say this to them, that they have sent a considerable number of people up to the Highlands that are there today. They should be delivering immediate advice to all those guests that they should be returning back home to their place of origin. But I also give the same message to those that have holiday homes, those that have second homes in the Highlands. Do not come to the Highlands. Do not put additional pressure on our public services. We will welcome tourists back to the Highlands once this emergency is over. But don't put us in a position that you're threatening the health of our constituents. And of course, in many of these rural areas, in my own district, 35% of the population are aged over 65. We have to think about the needs of those that live in those areas. Now, in addition to Sykes that I've mentioned, let me also mention cottages.com, because they are refusing to allow people, those that own cottages, to see a cancellation of bookings without penalty. And it simply is not good enough. And I hope on the basis that this is now in the public domain, that all these providers will think about their responsibility. But, as I mentioned, there are providers that are behaving in a more responsible manner. The provider Home Away have got guidance on their booking site of refunds that should be given to those that have broken. But I want to read to you just one last email, which has come from somebody living in the Lake District. My family and I were due to take up a holiday home rental from the 28th of March. We will stay away and remain in the Lake District where we live. However, you might be interested to learn that the owner of this holiday home, Let Through Home Away, is refusing at present to cancel my booking, refund my payment of £957 or move my reservation to next year. He maintains that Skye is an ideal place to self-isolate, and as a home is available, he is refusing to refund the total of the booking fee. I could hear an honourable member shouting, shocking. Madam Deputy Speaker, Skye or anywhere else in the West Highlands is no place, Madam Deputy Speaker, for anyone to self-isolate. And I hope this individual and others that are behaving in such a reprehensible manner change their ways. Of course, it's not just those that are providing accommodation. I think everyone knows about the Harry Potter films and the attractions of the rail line from Mallaig to Fort William, or I should say from Fort William to Mallaig. The steam trains that operate on a regular basis are due to start on the 6th of April. I have to say to the Jacobite Steam Company, what on earth are you thinking? What on earth are you thinking? These train trips, along with every other visitor attraction in the West Highlands, must close, and must close today. My message to anyone thinking of coming to the Highlands: you will be made welcome when this is over, but for the time being, stay at home. And if you're in the Highlands just now, please go home. The Scottish Government has already announced that ferry traffic is going to be prohibited to those on non-essential journeys, but they've got that ability to return home today. Please do so. Madam Deputy Speaker, included in this bill are also badly needed powers allowing for increased numbers of health and social care workers to join the workforce. This includes measures to remove barriers to allow recently retired NHS staff and social workers to return to work, as well as bringing back those on a career break or bringing in social work students to become temporary social workers. It has to be said that the numbers of doctors, nurses and carers already seeking to re-register to help in this emergency has been one of the most uplifting stories of this crisis. This bill allows that process to become much easier. Its provisions also allow for the relaxation of regulatory requirements within existing legislation in order to ease the burden of staff who are on the front line of our response. The next few weeks and months need simply to be about saving as many lives as possible. Try as we might to save these lives, unfortunately the truth is this virus will inevitably end up with many of our people dying before their time. That terrible reality is why it is right that this legislation includes special arrangements and provisions to manage an increase in the number of deceased persons with respect and dignity. Finally, and something this party has repeatedly raised since the early stage of this crisis, is the economic interventions required to help our people through this emergency period. I note that the legislation includes provisions to support the economy, including issues around statutory sick pay, which are aimed at ensuring COVID-19 impact on small businesses is lessened. And whilst we've welcomed many of the measures brought forward by the Chancellor, we've also put on record that we need to do more. The self-employed, the unemployed that we've talked about earlier, need to be considered within this. They are under pressure and they need to know that we've got their backs. They need the security of a guaranteed income. Now is also an opportunity to overhaul and fix the universal credit system, ending the delays, uprating the level of support and scrapping the bedroom tax. If we are to fight this virus together, then we must ensure that everyone is supported equally and that no one, Madam Deputy Speaker, is left behind. Madam Deputy Speaker, the emergency and extensive powers in this legislation have rightly raised questions and concerns, and we've heard many of these this afternoon. The nature and the imposition of measures that will significantly alter individual liberties deserve full and frank scrutiny, no matter the context. We know that the bill sunsets after 2 years. However, there are serious concerns around the 2-year period and the scrutiny of this measure. I know there are aspects of the bill that will be discussed at later stages of this legislation and amendments will be discussed. I hope that the Government will look carefully at safeguards for regular reporting, review and renewal if required.
I thank the Honourable Gentleman for giving way. He's making a powerful speech. On this question of 2 years, as he knows, I have an amendment coming in committee stage on 1 year. I asked our Health Secretary, in the proposal of the 6-month review, would we be able to amend or delete an element of the legislation? Because otherwise we'll be faced with a circumstance where we've got maybe 8 good bits of legislation and 1 or 2 bits that are doing badly, and we're forced to vote the whole thing through, rendering the whole thing a rubber stamp. Does he not agree that either my amendment or a variant of the Harriet Harman amendment, which actually allows us to change the Act, will be the better way to go forward?
I have to say I agree with my right honourable friend that would be a very good way to move forward. It's important that we enact this bill, but the House has the ability to have oversight of it in the period ahead, and I would commend him for the approach he's taking in this. If I take the Scottish Government has pledged to appropriate reporting and how and when the powers in the bill would be used by the Scottish Government. They will embed such reporting and renewal in law. The Scottish Government have also stressed that the creation of these additional powers does not automatically mean we will be required to use them. I hope that the UK Government will follow this lead and can give assurances in the remaining stages of the legislation this evening. Madam Deputy Speaker, the emergency passage and the extent of this legislation demonstrates what all of us are now faced with. This is not a normal time, and unfortunately the truth is that none of us will live normally for some time to come. As our First Minister has said, if individuals are continuing to live normally, then they need to ask themselves if they are following all the scientific advice. The sheer speed and the spread of this deadly virus has shocked us all. It has naturally made us reflect on the way we live and the vulnerability we're all exposed to. But it has equally demonstrated our dependence on one another. We live in an ever smaller world, and the major challenges we face are all the same. We can only face them together. The provisions in this legislation are about saving as many lives as possible during the biggest health emergency this planet has faced in 100 years. If we do not take immediate and unprecedented actions, then we will be responsible for putting people at risk. If we act fast, we know that we can save thousands of lives. It is as simple and as clear as that. There has never been a more important responsibility placed upon all of us. Saving these lives must now be our sole focus.
I'm going to put a 5-minute limit on speeches from here on in. Theresa Villiers.
Madam Deputy Speaker, there can be no doubt that this is an extraordinary bill for extraordinary times. As others have said this afternoon, none of us, when we put our names forward to stand for election to this House, must have contemplated the day when we would be asked to back legislation of this kind, but back it we must, and we must do so today. It is hard to find the words to really comment intelligently on a situation that's been so exhaustively analysed and debated by the media, and in every household and workplace the length and breadth of this country and much of the rest of the world. And I should provide the reassurance that the slightly hoarse tone I'm speaking in relates to a condition I've had since August relating to my vocal cord, so nothing to do with COVID-19. If it were, I would be back at home self-isolating. But I'd like to express my sympathy and support to everyone across the country who's grappling with this disease, who's had their lives turned upside down by this disease, or who've lost loved ones. I have not experienced anything like this in my 15 years in this place, nor indeed in my whole lifetime. It's difficult to point to any crisis as severe as this since the flu epidemic of 100 years ago. Of course, there have been many political upheavals, especially in the last 4 years, but there's been nothing which has had such a direct and dramatic impact on the daily lives of every single occupant of these islands. And there's nothing that's come close to matching the potentially devastating impact on our economy. And it's welcome that the government's announced a wholly unprecedented package of support for jobs, wages, businesses and benefits. The plan to stave off economic disaster is a bigger injection of support into our economy than anything that any government has carried out in our peacetime history. The consequences will be far-reaching. We and future generations will be paying off these debts for many years to come. But as a great Prime Minister once said, there is no alternative. Yeah. And I'd urge the Chancellor and the Government to ensure that the grants, the loans, the other measures get out to the people who need them as soon as possible. Not in 3 months, not in 3 months, not in 3 weeks, but now. And we do need to find more to help the self-employed and freelance workers. And of course, it's vital that we do all we can to protect the NHS and social care workers. It's at times like this that we really appreciate how incredibly lucky we are that the NHS is there for us. How incredibly lucky we are to live in a country which has one of the best healthcare systems in the world, staffed by the professionals of outstanding skill and expertise. And I want to express my gratitude to every single one of them. If we're going to get through this crisis without massive loss of life, we need to ensure that our NHS staff and our social care staff have the best, most comprehensive personal protection equipment. That means masks that fit properly and equipment which is compliant with WHO standards. We also need to be testing thousands and thousands of our NHS staff so that we can keep them healthy and keep them on the front line. The commitment to stepping up testing to 25,000 a day is welcome, and I'd urge ministers to ensure that NHS staff are first in the queue. And I've been contacted by care homes who are crying out for a complete ban on care home visits to help them ensure that they can say no to visitors. For the safety of our elderly relatives and the people who look after them, care home visits need to stop. In conclusion, Madam Deputy Speaker, these next few months are going to test us in the way none of us, except for the World War II generation, have ever been tested before. It will be difficult, it will be disruptive, it will be exasperating, it will be at times alarming and distressing. But we must, as a nation, rise to this challenge, and this legislation is part of that. We need a collective effort to keep our loved ones safe from this terrible disease. We must rise to the challenge as previous generations did when they too faced periods of great adversity and hardship. So my advice to everyone and my constituents in Chipping Barnet is stay home, stay safe, protect the NHS and save lives.
Yeah.
Bill Esterson.
Thank you, Madam Deputy Speaker, and I entirely agree with the message given by the Right Honourable Lady, the member for Chipping Barnet, about the message we should give to our constituents. And we have to support health workers as a priority. We have to support all essential workers. And we have to make sure that everything we do delivers to that objective. And I want to just say a few words about information. We need information clarity. I think one of the problems we've had over the last few weeks has been the change in the information advice given by government and by others. And what the Right Honourable Lady just said is exactly right. Stay at home. Stay 2 metres away from everybody else. Wash your hands and protect those health workers and essential workers so they can look after us. And I do think we are going to need more stringent measures and need them soon. I'll focus my remainder of my remarks on the financial measures. The bill references sick pay. 4.7 million self-employed workers, many of whom have lost their entire work, do not qualify for sick pay. A further 1 million company owners, the same applies. And it is essential that the Chancellor brings forward those measures that delivers sick pay, yes, but a package for our self-employed workers, as the Musicians' Union have suggested, which means real living wage, They've suggested £400 a week initially and an equivalent 80% figure based on previous year's earnings. It's to put the self-employed in a similar position to the kind of package the Chancellor suggested for employees on Friday, which I think was a very important step forward. And there have to be rent and mortgage provision which doesn't put people into arrears. It's no good pushing people into debt and making life more difficult. And the reason I say these things is because if people are not financially secure, they are more likely to take to make risky decisions, to try and go to work and to act in a way that is counterproductive to achieving those objectives of supporting our health workers and reducing infection. Another point put to me by many self-employed workers is insurances simply aren't working. So provision has to be in place for business interruption and for income protection, neither of which, and those policies are being regarded as not being valid by the insurers. I've had many constituents come to me, I've had many business organisations coming to me. Examples like a self-employed couple who already cannot put food on the table. So the other point I wanted to make is the importance of the actions being taken quickly. The government needs to say for employees, as well as announcing the package for employers, exactly how people access the funds. How do businesses get the money quickly so they can carry out the income replacement schemes? Given that it won't apply in March, there's a risk that hundreds of thousands of workers will miss out because businesses won't survive. Because there are additional costs that have to be covered, the costs of rent, the costs of insurance, the costs of utilities. And for many businesses, they simply won't be able to cover those costs to be in position to take advantage of the measures announced on Friday. So, speed of access, making sure that the schemes are available and the cash gets through as quickly as possible, and that does mean this week, and I'm glad the Minister is taking notes on these points. The loan scheme announced as well. The banks are saying they want personal guarantees. That is going to stop businesses taking out loans. Those loans which might have delivered some of that, the cover for those other costs are simply not going to be viable for too many businesses. That's another aspect that needs sorting out. There is so much detail that needs attention, I appreciate that, but the schemes need to be up and running. So, emergency workers, especially in the health service, need everyone to be able to stay at home. The schemes need to be implemented. Information from the government needs to be clearer. And the government can now take advantage of advert breaks because the commercial advertisers aren't going to be using them. Let's get that information out there on telly. Let's get it out there on the radio. Let's get it out there on social media of how people can access these schemes. Let's get the information about staying safe. And let's make sure these schemes are in place quickly to look after people in employment and self-employment.
Maiden speech, Robert Largan.
Thank you, Madam Deputy Speaker. I rise as one of the last new members to give their maiden speech. I had planned to speak on the budget last week. However, I did not feel that a traditional maiden speech, full of local anecdotes and questionable jokes, was suitable in the current circumstances. Needless to say, the speech I am giving now is very different from the one I'd originally written. I had desperately wanted for my parents to be able to sit in the gallery and watch me give this speech today. But my parents are both in their 70s, in high-risk groups, and frankly, I dare not wait any longer. My dad was one of 8 children from an Irish Catholic family in Salford. He was the only one of his siblings to pass the 11+, and went on to do a wide range of jobs, from being a Shabbos goy, to a postman, to a trade union shop steward. My mum left school with no qualifications after having to take care of her younger sisters following the death of her father on her 11th birthday. Despite that, she had a groundbreaking career at the DSS, helping unemployed people back into work. My parents taught me the importance of public service and doing the right thing. They are the reason I am standing here today. It fills me with more pride than I can ever fully explain that they're able to watch me give this speech, even if it has to be on television. I'm also very grateful to see the Shadow Health Secretary in his place. Like me, he went to Phillips High School. For a comprehensive in North Manchester to have produced 2 members of Parliament is a very rare achievement indeed. When I put myself forward for election, campaigning for improved transport in the North, I could not have possibly imagined making my first speech on a debate like this. But as it turns out, being in this place makes me incredibly fortunate. I stand here with a secure job for the next 4 years at least, and a guaranteed salary. That many of my constituents do not have the same security plays heavily on my mind. I'm particularly concerned about the self-employed. They don't benefit from the job retention scheme, and many are seeing a big drop in their income. The government have sensibly brought in protections such as the mortgage holiday and suspension of evictions, but many self-employed people, often with families to support, are understandably worried about the future. So I call on the government to urgently look at more ways to support them. And I realise that's a simple thing to say and a difficult thing to do. Anybody can be a critic. And I know a huge number of people are working day and night, many not seeing their own families, to tackle this pandemic head-on. I'm sure I speak for the whole House when I say to those people, thank you. This crisis is without precedent. We are all navigating without a map. Events are moving in minutes and hours, not days and weeks. And that's why this emergency legislation is necessary. We have to give the governments the tools they need to respond quickly to events. But I think it's also essential if we can keep Parliament functioning as best we can, so we can continue to challenge those decisions and hold ministers to account. Madam Deputy Speaker, this crisis is undoubtedly bringing out the best in the people of High Peak. It is a staggeringly beautiful place, and we are very lucky to live there. But as beautiful as the High Peak is, it is the people who make it so special. And in this crisis, people are pulling together, just like they did during the evacuation of Whaley Bridge last year, when the dam at Toddbrook Reservoir partially collapsed. This time, volunteer groups have sprung up in almost every town and village. Teachers are delivering packed lunches to the homes of children on free school meals. Food banks are working day and night to support the most vulnerable. In many ways, that's what makes this situation so hard. People want to come together and look after each other. Social distancing is counter to our natural instincts. And I do worry the toll this isolation is going to take on the nation's mental health. Madam Deputy Speaker, I come to this place intending to take an independent-minded approach, prepared to criticise my party and the government when they get things wrong. And they will, as I've no doubt I will too. And I'm keenly aware that I was elected by the smallest of margins, just 590 votes. People did not vote for me because they agreed with every single line of the Conservative manifesto. Many lent me their vote, often reluctantly, after their pencil hovered over the ballot paper for a long time. So I want to make it clear to the people of High Peak that I am working round the clock and trying my best to represent everyone, no matter who they voted for. I will not get everything right, and I will make mistakes, but I promise I will always put the High Peak ahead of party politics. I just want to quickly finish with a note of caution on the limits of power and our ability to achieve the things we hope for. The best intentions can easily get blown off course by events. Far too often, politics is boiled down to a contest between a simple, easy-to-sell magic solution and the nuanced, hard-to-explain truth. And the truth is that governing is hard. It involves taking almost impossible decisions between competing lesser evils. There are rarely, in reality, obvious right and wrong choices. So we should be wary of those who are always certain or never change their minds. Ideological purity is a moral maze many get lost in. And for that modern Puritan, it's no longer enough to accept that someone disagrees with them. They think that others can only disagree with them because their motives are malign. And if our history has taught us anything, it's that we must reject that Puritanism. Our greatest reforms, universal suffrage, civil liberties, the NHS, were secured not through ideological purity or confrontation, but by collaboration, and taking the view that compromise isn't betrayal, but a kind of victory.
Chris Brown.
Thank you, Madam Deputy Speaker. Can I warmly commend the honourable member for High Peak, who I think made a magnificent speech. He delivered it with simple earnestness and a dignity which I think will commend him to many members of this House. It's a sad moment, isn't it, when you think that being an MP is the most secure job around. He was quite right, I think, to say not only what he said about no party has a monopoly on truth, and ideological purity rarely serves anybody does anybody any favours, but also in what he said about being an independently minded member. I warmly commend everything that he said. However, Madam Deputy Speaker, I completely despair of some of the scenes that I've seen from our fellow citizens over the last few days. The panic buying, the hoarding, frankly, of essential goods which will therefore be denied to many people who most need them, including our key workers, is a disgrace. It's born out of selfishness, and it must stop. People ignoring advice because somehow or other they think they're going to be immune to this disease, or because it's only going to affect some other people, that is, again, an instance of massive selfishness, and it really must stop. I'm sick and tired of people saying that they know better than all the experts. And the number of armchair epidemiologists and virologists in this country seems to have grown dramatically without any evidence of qualification. I hate the idea that there are companies who are actively profiteering in this country. It was a criminal offence in the war, and it should be a criminal offence now. I hate the scam merchants who are going round preying on the vulnerable at the moment, which I think is why it's all the more important that local councils are running proper schemes for volunteer forces, so that if somebody's knocking the door, an elderly person can know that they're getting the right person. I hate the way that some of our police have been treated in the last few days, spat at and coughed over deliberately as an offensive weapon, as it were, when they've merely been trying to prevent people from gathering in the way that the government has been advising. This goes back to what we've been trying to do for the last few years in stopping assaults on our emergency workers, and I bet my bottom dollar that there will be more assaults on emergency workers during this process. This must come to an end. We as a nation must show the best side of our humanity, not the worst side of our humanity. And I'm sorry, but I say to politicians in various different countries around the world who have somehow or other trying to dismiss the experts, including those who have dismissed the idea of vaccination over the last few years, I say to you, you are dangerous and you must stop it. People will die because of your misinformation. This is, of course, a draconian bill for two main reasons. One, because it suspends lots of protections which are there for the protection of the individual, such as who is able to certify a death. I know why it's there. But frankly, the idea that in the end it could end up just being a funeral director certifying a death is worrying, and let alone the provisions that there are in relation to the sectioning under the Mental Health Act. It also gives ministers the power to impose restrictions, significant restrictions. We all know that these are draconian. And on top of that, as the Attorney General, who rang me, I'm grateful for the phone call the other day, but Attorney General, sorry, Solicitor General, all right, well, let's stand upon these matters. They're the ones that matter. But as he rang me the other day and made an important point that we are suspending, very unusually, the normal process in allowing ministers to switch powers on and off. All of this is extraordinary in peacetime. Now, I think there are some things we have to do simultaneously, and they have to happen at the same time. First of all, there must be a deal for sole traders and the self-employed, because otherwise, I've had people ringing up my office and in floods of tears, worrying how they're going to make ends meet over these next few weeks, and they need an answer to that urgently. Of course we're going to have to, because of the ludicrous misbehaviour of so many of our fellow citizens over the last few days, we are undoubtedly going to move forward with enforced measures to, that must happen. But it can't happen before you put in place the provisions for sole traders and the self-employed. I also believe that we've got to put much more protection for our NHS staff in place. Every single fashion brand in this country, through from Marks and Spencer's to, I don't know, Burberry, should be ringing up the government now to say, what can we do to provide more, to provide more PPE protection for our staff? Many local councils, including my own, have hardly a stitch to be able to give to their key workers now. We need to give them that protection.
There is still considerable pressure on time, so after the next speaker, I will reduce the time limit to 4 minutes. Steve Bryan.
Thank you, Madam Deputy Speaker. Can I echo what a beautiful maiden speech that was from my honourable friend from High Peak? Well done indeed. I'm going to be rather novel here and speak about the bill. But before I do that, I just thought I would the package that's been announced thus far in the budget and last week is incredibly welcome. But can I echo what so many members have said in the House so far today? The self-employed next, please, because we are desperate, many of my constituents, for the government's help. Madam Deputy Speaker, I rise to speak in support of the bill receiving a second reading. Nobody, of course, wanted to be here, but this is an essential and urgent piece of legislation. We may be discussing the coronavirus bill today, but for some, this is in large part the flu pandemic bill, which I was very much involved in when I was fortunate enough several years ago to be the Public Health Minister. Now, this legislation, it won't make COVID-19 suddenly vanish, as President Trump bizarrely proclaimed the other day, but it will help the state and our government do what it has consistently stated is its primary objective here, which is to protect the NHS and save lives. As the Secretary of State made clear, these are extraordinary times, and these are measures pursued as a result. But I think, because I too have had lobbying this weekend saying that this goes too far and it's disproportionate power grab from the government, I think it's worth saying these are not measures dreamt up on the hoof by the Secretary of State over the last week. The UK Influenza Preparedness Strategy of 2011 set out our preparedness for a severe pandemic. It was tested through a major 3-day exercise called Cygnus, involving about 1,000 organisations as well as the devolved administrations in 2016, and that demonstrated a number of things that we do well as a country and a number of things that we need to improve upon, one of which was the drafting of the draft pandemic influenza bill, which forms the basis of the legislation today. So the scrutiny we're giving this legislation on the floor of the House is not what we do in normal times, of course, but these are not normal times, and Parliament needs to work swiftly with deftness of touch to match pretty much everyone else right now. I have to say I am satisfied the legislation, as was always intended, is time limited, and it makes clear that it is neither necessary nor is it appropriate for all of these measures to come into force immediately. What's more, the lifetime of the Act can itself be ended early if the available scientific evidence supports that, and we can extend the lifetime of the Act for a temporary period if it's prudent to do so. Let me just turn to a couple of areas I want to home in on, if I may. Obviously, increasing the health and social care workforce is mission critical, so the bill introduces the new registration powers for the registrars of the Nursing Midwifery Council and the Health and Care Professions Council. That's absolutely right, but I think we just need to hear from ministers, as indeed mentioned in the impact assessment, exactly how DHSC plans to engage with the professional regulators to ensure that sufficient infrastructure is in place in order to implement the policy. Also, I note the sensible move to allow the early registration for final year students studying to become nurses, midwives, paramedics and social workers, and the government's assumption that all 28,100 students estimated to be in their final year studying these professions in England will be willing to join the register early. So I would ask what evidence we have that this is happening or likely to happen, and also are the costs noted in the impact assessment covered so as to give total confidence to the regulators that they can get on with this. On food supply, I'm very pleased that DEFRA holds responsibility for food as a critical national infrastructure, and working with the Food Standards Agency, it has to, of course, maintain our high standards, but I have to say I don't think this legislation goes far enough in protecting stock on the shelves. Like all of us, I've had hundreds of constituents contact me in the last few days on many different subjects, but consistently coming back at me is the jarring between what they're hearing from ministers and the supermarkets about being there enough food and what they're seeing on the ground, or more importantly online, when they try and book a slot. Now, of course, the government is not to blame for a change in our food policy from the sort of dig for victory in the last century, backed up by local food networks, to a very centralised distribution controlled by the big 5 supermarkets that we have now. But how sad it is, Madam Deputy Speaker, that we've literally put all our eggs in one basket, and how we're reaping what we've failed to sow now when we need it most. Finally, on the subject of volunteering... Yeah, sure.
I'm very grateful to my old friend for giving way. He's making a very good speech on different aspects of the bill before us, but on the first point he touched on, which is the issue of how we manage to give reassurance to the self-employed, does he agree with me that there will be no single scheme which covers every situation perfectly, but the crucial thing at this moment is the reassurance that there will be something done to help everybody who is self-employed?
Agree, and I understand why we had to do those through PAYE first, because employers were making decisions about job losses this weekend. But I completely agree, we need to hear something from the Prime Minister, and I understand he's going to be addressing the nation this evening, and I think we can probably all guess what's coming, but he could say something very reassuring to people who are self-employed and sole traders this evening. I think it would be very welcome. I just said finally, Madam Deputy Speaker, on the subject of emergency volunteering leave covered in clauses 7 and 8, I think it's very welcome unpaid statutory leave the Secretary of State mentioned earlier on. Clause 8 says the Secretary of State must make arrangements for making payments to emergency volunteers by way of compensation for loss of earnings and for travel and subsistence. So could the Minister, in summing up, tell the House at what level that might sit? We seem to have an 80% norm when it comes to the coronavirus job retention scheme, so are we looking at the same here? As I say, I think that's a smart move. Many of our volunteers come from the older generation, so we've got to find a way to fill that gap. In closing, we need ruthless, determined, collective action to protect the NHS and save lives, combined with scientific progress. And this bill is part, but I have to say only part, of that national effort. Now, I've listened very carefully to the many voices lobbying us around the bill this weekend, but I am comfortable that it is a well-judged piece of legislation that provides the powers needed to respond to this epidemic and this pandemic and this national crisis that we face at this time.
David.
Madam Speaker, I'd like to begin by thanking everyone who's working hard to keep our country and our world as safe as possible from this dangerous pandemic. But above all, I'd like to thank the staff in the NHS and the staff in our social care sector. Madam Deputy Speaker, we're seeing people face personal risks, and we will forever be grateful for what they are doing. Madam Speaker, in normal times, I and my party would be opposing many of the measures in this bill with every breath in our bodies. The implications for civil liberties and human rights are profound and alarming. But our society now faces this unprecedented threat of coronavirus that leaves some of the most vulnerable in our society at serious risks. And it seems clear that at least some of the new powers being sought by the government are necessary to deal with this threat. Nevertheless, our position is that these powers must only be used when absolutely necessary during this emergency and not for a moment longer. So, like others, I welcome the government's change of heart over the 2-year renewal. The 6 months now proposed is self-evidently a significant improvement. Nevertheless, we remain unclear why it's 6 months and not 3 months. There may be good reasons, but I think it's important the government set out the reasons why they've chosen 6 months. After all, the Prime Minister was saying just the other day that the peak of the epidemic would be just 12 weeks away, so it's not unreasonable to ask why 6 months is needed. Moreover, Madam Speaker, I think we need to look carefully at the review process. When it comes, it should enable amendments to this law, and the other place need to be allowed to vote on this as well. Let me just give one example of why a more frequent renewal process should be considered. And it relates to the bill's provisions about social care. How the bill temporarily suspends the duties on local authorities to meet people's care needs, from older people to adults and children with disabilities. I'm yet to be convinced that these provisions are needed at all. I think they are amongst some of the most alarming provisions in the bill. At a time when the most vulnerable in our society need more care, not less, why on earth are people's rights being reduced? At the very least, such a reduction in the rights for the elderly, disabled and mentally ill must be subject to early review and renewal. And the Right Honourable Member for South West Surrey was right to raise the issue of personal protective equipment and testing. NHS staff contacting me are angry and alarmed at the lack of PPE, and they do not understand why the distribution system has taken so long and is still failing to provide it for so many people. And the testing experience in this country, Madam Speaker, compares appallingly with other countries. Madam Speaker, there are other problems with this bill. Let me just, because of time, mention just one. That's the failure of the bill to enable the government to extend the Brexit transition period. Now, I know this is politically sensitive, contentious. I know we need to bring our country together when Brexit tore us apart. So I'm not seeking to reopen the Brexit question, despite what my own heart tells me. I'm raising the question of the Brexit transition period as a practical and real issue. Our economy is facing its biggest challenge since the Second World War. Disruption to business on a scale even greater than would have been caused by a worst-case scenario of a no-deal Brexit. Surely the government should think again and allow itself to extend the Brexit transition period. Madam Deputy Speaker, we on these benches will be supporting the bill tonight, but with a very heavy heart, and we hope the government will come back and allow this House to ensure that we can protect our country against this coronavirus threat, but not ditch our civil liberties and human rights.
Bill Wiggin.
Thank you, Madam Deputy Speaker. It's a pleasure to follow the maiden speech from the Honourable Member for High Peak as well. Can I just say to colleagues across the House that being angry with the public for what they're doing wrong is no way to proceed. In my constituency, in Fownhope, a community that was hit very badly by flooding, we're seeing the most phenomenal community spirit, wonderful behaviour blossoming as people reach out to those who are lonely, to those who are self-isolating. We're seeing young people writing to people in care homes to make sure that they feel valued. And that wonderful sense of community spirit is shining forth. And that, for me, is worth so much more than being cross with people who may be getting their self-isolation or shielding wrong. Now, today I wanted to talk about the most important thing that we have here, which is our parliamentary accountability. And using the expression babies and bathwater, that accountability is a baby worth saving, no matter how toxic, how dangerous or how infectious the bathwater may be. And so 2 years calls into question the advice the government has been given. China has had 81,307 cases, 3,254 deaths, and yet it has managed to shut down the disease in 6 weeks from its epicentre. A much, much more difficult task than we have. And yet, flights are still coming in from countries like Iran, 3 flights a day. How is that possible when we are looking at such draconian legislation today? And it's not necessarily perfect legislation. If you look at section 23, which is powers on food, which I naturally was drawn to, a person may be required to provide relevant information to the authority in section 23.1, and yet, in section 23.6, a requirement under this section may not be imposed on an individual. That doesn't really look like it's quite right. So perhaps the government will look at that before we reach report stage today. In the last few seconds I've got on this, I want to just reiterate how much the public need to understand that what we are sacrificing, both economically and in terms of our freedom, is worth it if we are protecting the professionals, both in the health service, but also in local authorities, in all the caring services that are reaching out and providing that sort of community that we all hold so dear. I am seeing it every day in my constituency, and I want to make sure that we never forget that it's the goodness of the British people that makes all these sacrifices worth it.
Gavin Robinson.
Deputy Speaker, it's a pleasure to follow the Honourable Member for North Hertfordshire. Madam Deputy Speaker, when I indicated to some constituents and even members of my family over the weekend that I was coming to London today, they thought I was mad. And they think collectively we shouldn't be here. And they point to the information that we give out positively and the leadership that we show and wonder why we're here. But when I reflected that my brother, as a consultant in the NHS, will be going into hospital in the face of those acute difficulties on the ward, and his wife, my sister-in-law, would be doing just the same, and the tens of thousands of members of our National Health Service, not through bravado or machismo, but because they care, will be turning up to work yesterday and today and in the days and weeks that follow. We could do our duty and be here today, Madam Deputy Speaker. And I think it is a tribute to our institutions and our democracy that even though there are parts of this legislation that will curtail our freedoms, it is important that we are here and important that we put on record our gratitude for all of those who are stepping up in this time. The Shadow Secretary of State for Health, Madam Deputy Speaker, did raise parking charges at our hospitals as one point in his contribution. And I raise that today because I think it is totally abhorrent that in the face of such adversity we're expecting people not only to turn up to work at hospital but to pay for the privilege of parking there. Madam Deputy Speaker, I know all of these issues will be devolved and will fall to different trusts and commissioning groups across the country. I want to put on record my appreciation for the Belfast Trust for the decision they have taken to waive parking charges for staff members in all the Belfast facilities, and ask that the South Eastern Trust, who have the Ulster Hospital in my constituency, to take exactly the same measure. Madam Deputy Speaker, we need to be supporting people through this. When I attended a pharmacy on Friday, it could only be described as a war zone. They were asking, why are they left in this situation without sufficient pharmacists? I welcome Clause 4 and the extension that is going to bring 4 new registrants. Madam Deputy Speaker, they were saying we can't sell paracetamol, we've run out. You can't use anti-inflammatories in this situation, but our stores are filled with 100 packs of paracetamol, and yet we're legislatively precluded from breaking those down and giving them to people who need them. He said the government says that we have a home delivery service for getting prescriptions out to those in self-isolation, but it's an unfunded service and it's an overstretched service, and our vans run on diesel and not goodwill. Madam Deputy Speaker, there are huge challenges in every aspect of our society through this crisis that this bill alone will not resolve, but it is an important first step. Madam Deputy Speaker, I want to place on record my appreciation for not only the government's engagement with us over the last week, but also the substantive nature of this bill. There's hardly a section within this bill that doesn't replicate provisions for Northern Ireland, for Wales and for Scotland. This is a mammoth task that officials have performed over the last number of weeks, and I think we need to pay our appreciation to them. Can I raise one issue to the Paymaster General that I hope she will be able to give some clarity on 2 specific points? She will know in the bill that at Clause 13 we have continuing healthcare assessments, Section 14, Clause 14, local authority care and support for England and Wales, and Clause 15 for Scotland. There is no, this is the one part of the bill where I can see no corresponding provisions for Northern Ireland. And I raise it for this point, not to raise concern, but there are those out there advocating on behalf of charities and who have children who are in vulnerable situations in MenCap and with mental capacity issues who feel that this means they will not get the care they need. Could I ask the Paymaster General just to deal with that concern and respond appropriately to alleviate the concerns? Madam Deputy Speaker, I'm grateful for the time.
Caroline Noakes.
Thank you, Madam Deputy Speaker. And there have been some fantastic speeches this evening so far, including from my honourable friend, the member for High Peak, with a stunning maiden speech. But I wish to go back to the words of the Secretary of State, my right honourable friend, the Secretary of State, when he said that this virus impacts most the weak and the vulnerable. And he is, of course, right. I support the measures in this bill. They are extraordinary measures that can only be used in extraordinary times. But that, Madam Deputy Speaker, is exactly what we are facing. But tonight I wish to speak for the weak and the vulnerable. And you might expect that from the Chair of the Women and Equalities Select Committee, because I have real concerns about how equalities might be impacted and about how those people with protected characteristics for whom we speak might be affected. And I draw particular attention to the elderly, who we know are the most impacted by this disease, and their needs for care that is appropriate in their own homes at the right time. I speak for the disabled, who of course have the biggest challenges and who desperately need assistance. Now, I appreciate why we have the powers in this bill, but they must be used proportionately and reasonably. I also speak for those from a black and minority ethnic background, And of course, my right honourable friend, the Paymaster General, has done some absolutely phenomenal work with faith communities, making sure that funerals can be held appropriately for religions. But I would like to point out that in the gig economy, you are most likely to find people from a BAME background working. They're also most likely to be young people. They're also most likely to be self-employed or on 0 hours or sole traders. And we must be particularly cognizant of the impact that there is going to be on those people who we will want, when this horror is over, to be able to bounce back, to be the entrepreneurs who will enable our economy to recover from this difficult period. And I also, of course, am going to mention women. We know that caring responsibilities, Madam Deputy Speaker, falls most heavily on their shoulders. We also know that in areas like childminding, you are most likely not only to find that it is the childminders who are doing the caring, but of course they're providing the support that enables women to go out to work, whether it be in our essential professions at the moment or in all parts of the economy. And if we do not provide support to the childminding sector as well as the early years sector, then when of course this virus is quashed and we are in a position where the economy wishes to rebuild, we need childminders to enable that 50% of the workforce to be able to go back to work. We've done great work over the last few years in making sure there are more women in employment, but we have to make sure that it is possible for them, when this is over, to be able to play. I will, of course, give one.
So that's exactly the point, isn't it? The early years sector and the childminders, many of whom are self-employed, another reason to repeat the point that so many have made today, why we need something for this part of the economy.
I thank my honourable friend for that intervention, and he's absolutely right. So I've managed to fit in the childminded sector and, of course, the self-employed in one hit. I wanted also to speak about volunteering and the clarity that is needed. There is a great company in my constituency that run Kimbridge Barn. That, of course, is shut. But they want to enable their staff to go and volunteer, whether it be in the health service, whether it's in the care sector, whether it's as delivery drivers. They have many vehicles, but they want clarity as to whether the 80% salaries that the HMRC is going to underwrite, whether that will be applicable if these people are effectively out working in a voluntary capacity. And I also draw attention to the comments made by my right honourable friend, the member for South West Surrey. He spoke about whether local government officers should be considering planning applications at the current time. I would also argue whether they should be considering implementing or imposing parking fines. These are all areas of regulation which are undertaken by local authorities, which I would suggest at the current time are perhaps far from an imperative. I'd like to pay tribute in the voluntary sector to both the Southampton Volunteer Service and to Unity in Test Valley, who have done some brilliant work pulling together volunteer bureaus and making sure that those who are going to be in the shielded group will have the support from people in the community who can help deliver their medicines and their essential shopping. There is much in this bill which in ordinary times we wouldn't consider, but can I end with one final plea about parliamentary scrutiny? There is as yet no mechanism for select committees like the Women and Equalities Committee, who have much to scrutinise in this bill. There's no ability at the moment under standing orders for them to meet remotely or by video link or using Zoom or Skype for Business or any other mechanism. I understand that the Leader of the House is to make a statement at some point, and I very much hope that he will make sure that at the very least the Select Committee structures can work at this current time to make sure that measures like this are held to proper scrutiny so that we understand how they are impacting the most vulnerable.
Caroline Lucas.
Thank you, Madam Deputy Speaker. I very much appreciate the spirit of cooperation and purpose that's in the Chamber today. We all want the same thing: for the coronavirus outbreak to be over, for people to be safe, and for our public services to be resilient and well-resourced enough to cope. I believe that in order to achieve that, we do need today's legislation. But we also need to speak the truth. And the truth is, sadly, that we have wasted weeks. Time that could have been spent ramping up testing, acquiring more protective equipment, ordering more ventilators. This emergency legislation is welcome. But more than anything else, decisive government action is overdue. The UK had the advantage of being able to learn from the experiences of China and other countries, and yet to people watching from the outside, too often we have seemed like a nation in denial. Now, we can't change where we are now, but it is only by understanding the answers to those questions that we can ensure that similar errors of forward planning do not cost lives. So let us put that right now. With a clearer and stricter lockdown, I agree with the Labour front bench on that, but crucially with the economic security that will make that possible. And I echo everything that others have said about the importance of underpinning the livelihoods of those who are self-employed. And crucially, and I make no apology for repeating this, we need a much, much clearer, more comprehensive wall-to-wall public education campaign to underpin all of this. The message from our health workers couldn't be clearer. Stay home to save lives. We owe them a massive debt of gratitude, but we owe more than that. As MPs in particular, I believe we owe it to them to listen and model the behaviour that we're asking of our constituents. The clearest way to do that is for Parliament to start meeting virtually and voting electronically, rather than putting staff at risk here and risking sending mixed messages to the rest of the country. Now, I had three very brief points to make about the bill. The first was the point that has been made by many others around sovereignty and democracy, and I am very grateful that the government has accepted the amendments to make sure that this legislation will come back to the House after 6 months rather than waiting for 2 years. It's crucial we have that opportunity to correct any mistakes that could easily have been made in the understandably speedy drafting of this very large piece of legislation. The second concern I have is about what's missing from the legislation, from closing detention centres and safely housing those released, to allowing asylum seekers to work and have recourse to public funds, from preventing utility companies cutting off anyone's water, gas, phones, internet or electricity, to putting real pressure on the insurance companies who are hiding behind the definition of notifiable diseases and refusing to pay out businesses that are forced to close. Powers are needed to make them play fair. The bill should be giving local authorities the power to grant council tax holidays and suspend all business tax payments, with central government meeting the lost revenue. It needs to freeze household and business rental payments across all sectors, again with compensation for landlords for the lost rent, not just for 3 months, but for as long as necessary, and to allow for flexible provision for those at risk from domestic abuse, sexual violence and child abuse. But above all, this bill needs to include those measures to protect people's incomes, not just their wages. So many people in Brighton have raised with me the fact that their concerns are not covered by the government's guarantees so far. As a nation, we are rightly proud of our entrepreneurs, our creators and our innovators. We need to remember that many of them lack all the legal protections of redundancy and other rights that exist to help employees who are faced with a sudden lack of income. They need to be included in the government scheme. The 80% of average wages, something like that, needs to be made available to them as well, and it needs to happen very fast. And my last point is simply that as we go through this crisis, we need to do it in a way that prepares us for the next crisis, which is still there, my friends, the crisis that is the climate crisis. And therefore, the kinds of measures that we put in place, for example, when it comes to choosing which businesses we are bailing out, must also be driven by a concern for the climate and make sure that we are supporting the green economy, not the fossil fuel economy of the past.
Thank you, Madam Deputy Speaker. I have one or two points which I feel I would like to put on the record before this bill goes through. But the first thing that strikes me is that this is an ambitious virus. It's an aggressive virus, and it intends to infect every single one of us, both here in the UK and across the entire globe, unless we do something quite dramatic to stop it. And it doesn't discriminate between rich and poor, old and young, black, white, gay, straight, and it doesn't discriminate on the grounds of nationality. It doesn't respect borders, and the pace at which it's covering the globe is something to behold. And that's why I very much welcome the legislation today, because the pace at which we're delivering these important measures that the government does need to be able to take under executive action is equally as impressive. But there are a couple of concerns that I do have, or a couple of questions I do have for the front bench. I mean, clearly I'm going to support these measures. It's necessary that these type of measures go through, and they go through quickly in order for us to respond as a nation. But the first area is I just wonder, and I did ask this question last week but didn't get a full answer, why it was felt necessary to bring forward a brand new piece of legislation when we do actually have the Civil Contingencies Act on the books already. And it seems to me, looking at this bill, that it could quite comfortably, the measures and the powers could quite comfortably fit within the Civil Contingencies Act. The only reason I raise that is that some of the questions today, and I'm glad we've seen some compromises, are about accountability and about the time frame over which these measures will be enforced. And it seems to me the Civil Contingencies Act says that if a measure is brought forward by a minister, then within 7 days Parliament can say something about it. If Parliament is in recess, then within 5 days it can be recalled from recess and deal with any urgent matters. I only flag it and I suspect there are good reasons why a separate piece of legislation out with the scope of the Civil Contingencies Act was brought. So this is a very dynamic situation, it's very fluid, and things are changing, I mean, literally on a day-by-day basis. So it seems to me that some of the actions that the government may need to take, and rightly need to take, may have some consequences, some intended, some unintended. So, for example, last week we saw some measures which I suspect will really be incorporated under the powers within this piece of legislation, whereby pubs, restaurants, clubs were told to close their doors. The consequence of that would have been, without an immediate adjustment, that actually maybe 1 to 3 million people would have no money within a week or so. Thankfully, the government was able to bring forward measures which dealt with that, with the majority of those people. And I suspect that there will be situations in the weeks ahead when the numbers begin to escalate, when we all begin to worry about our own sanity, let alone our own health. There'll be moments when it may be necessary that the military or police services are on the streets and are committed to take actions which will surprise us. And I'm just concerned that actually that the Minister does explain how this House will be able to ask... I'll give way very briefly.
Can he just tell me, does he agree with me that all these measures need to be unwound one day and that ministers must keep an eye on how they're going to do so?
I certainly do, and he's put the point very well, and that's the central thrust of what I'm saying. I'd like to say that one of the key aspects of this virus, one of the key reasons why it is so aggressive and so intrusive and so ambitious and so quick to move around, is it may well have the ability to mutate. And if that were to happen, I would like to have confirmation from the government that they feel that within this Act, within this bill, they do have the powers necessary to actually ramp up the actions that they're taking within what's been within the wording of the bill. So overall, I very much welcome this piece of legislation, but I would like some clarification about why the Civil Contingencies Act wasn't used, which has been very carefully thought through and has a lot of checks and balances in there. And secondly, I'd like reassurance that were some of the powers under this Act to be deployed on the streets of our country, that Parliament would in some way, I know ministers are responsive, I know the Prime Minister has shown great leadership and he's looking to do the absolute best for the nation, but that in some way Parliament is able to express, even in recess, that it does have concerns, and concerns over which government ministers and the executive can respond quickly, rather than at the end of, let's say, a 6-month period, a 3-month period, or a 2-year period. Thank you, Madam Speaker.
Thank you very much, Deputy Speaker, and I would like to start where many honourable and right honourable members have also started, which is to put on record our profound thanks to the volunteers and public service workers who have just done so much. I think the definition of the front line is the point of maximum danger, and we know that there are hundreds of thousands of people who have put themselves in danger in order to keep the rest of us safe. There is one group I would like to single out, and that is the extraordinary group of people at Heartlands Hospital in my constituency who have been working tirelessly to help keep our city of Birmingham safe. It was Ernest Hemingway, Madam Deputy Speaker, who said that the definition of courage is grace under pressure. Well, our volunteers and our public service workers are under pressure today like never before. Their skill, their care, their compassion, their grace, their courage, I think is something that will live in the memory for generations to come. There are two issues that I want to touch on with this bill, Madam Deputy Speaker. Protections that are needed, but protections that are missing. One on the income side and one on the cost side. On the income side, the challenge is now, I think, for Her Majesty's Government to begin quilting together the patchwork of measures that have been so rapidly put into place. There are 5 areas where the income of a household will come under severe pressure very quickly. One is obviously for those who are in work. One is for those who are self-employed. One is for those who are newly sick. One is for those who are newly unemployed. And, of course, one is now for those who are having to take parental leave because the schools are now closed. Now, where the government has moved quickly and where it has been welcome is putting in place wage subsidies. That's good. I add my voice to those who are calling tonight for rapid measures to help those who are self-employed. But we also need to address 3 other areas in the income protection system. One is about making sure that the rate of statutory sick pay moves up very quickly to around £160 a week. It is very difficult for people to live on the extent of the pay cut that has been taken just because they are ill. Paid parental leave now needs to kick in from day one, and that has to be something that is now enforceable as a statutory right. And of course, for those now labouring on universal credit, that has got to go up to at least £100 a week. If you're a two-couple family in my constituency with 2 kids, you will now be £800 a month below the poverty line if you are having to live on universal credit. That is simply not acceptable, and we are going to have to improve that situation. The second area of protection, though, is on costs, and I talked about this earlier in comments made to the Leader of the House. We now have some companies behaving very badly. We have individuals like Philip Green who laid off thousands of staff before the income protection system kicked in. He should be summoned to the bar of this House to explain himself. I now have staff in Topshop telling me that they are being prohibited from circulating the petition that I have launched in order to have him summoned here to explain himself. But the second area where we need rapid protection is, of course, in price regulation. In times of emergency, prices go up. I have been inundated with complaints after Jute's Pharmacy in my constituency raised the price of Calpol from a couple of quid a bottle to 20 quid a bottle. Markets need morals in times of emergency more than any other time, and we now need rapid action to put in place the price regulation that I proposed in my amendment and which has been widely shared and supported by members across this House.
Tobias Elwood.
Thank you, Madam Deputy Speaker, and can I join others in commending the spirit, the tenacity, determination and the grit of those on the front line, not just those in the health service, but the police and other services, the growing team out there that are trying to keep our country together during these difficult times. I commend the government's work on providing the necessary medical support through mobilising the NHS at the start, the economic support that's come in to support our businesses and indeed the employees, and now societally with support provided to the 1.5 million of the most vulnerable. But ultimately, this emergency legislation is unparalleled in modern times, granting enormous powers to the state and expected to be approved in the shortest of time periods. So I very much welcome the Health Secretary's assurances that this bill, the measures in this bill are temporary, they're proportionate to the threat, only to be used when strictly necessary, and only in place for as long as required to respond to the crises. But as the bill is debated tonight, we should remember that a COBRA meeting is taking place. British nationals are being called back from, who are abroad, called back to the UK, and there is every expectation that there will either be a national or localised lockdowns. The Armed Forces has already been mobilised, and the MOD has had planners in various departments for a number of weeks, but we should expect to see more of them providing fantastic assistance to a number of agencies across the nation. We mustn't forget they're also preparing their own manpower and also need to watch our backs, because whilst the national focus is absolutely on the coronavirus, they have a duty to make sure that we can sleep at night, and they protect the skies, our shores and indeed our seas as well. We must not forget that they have a day job to do, as well as the contribution they give to the nation. But we should also remember that this was a decade, in fact, where we're on track to be one of the most dangerous since the Cold War. Complex and diverse threats remain out there, and a wily competitor will take full advantage of the global turbulence, not least because threats are no longer so much territorial, but also from a cyber and digital capacity as well. But this government has focused on the government's role, the power of the government to tackle the crisis. But as has been repeated again and again in this House, we can and all must do our part in reducing the spread of this deadly virus. Life is not on hold, as some commentators have made. We actually must adjust to a new normal. We must face the reality and understand that life will now be different as we tackle it, but also afterwards as well. In conclusion, Madam Deputy Speaker, this bill is unprecedented, but if the powers are used to their full, it's actually because too many Britons continue to ignore the guidelines and are part of the problem and not the solution. Madam Deputy Speaker, the Queen sent more than a message to the nation last week. It was an instruction. Let's change our routine, as the country has done in the past. Everyone must play their part for the greater good towards the common goal of saving lives. This is a national crisis, not a national holiday, as some people seem to be taking it. Every person, every authority, every business, every charity, every laboratory must turn their efforts either into helping saving lives and supporting our NHS, or helping us all to adapt to this new normal, because life is not going to go back to what it was for either months or years to come. The world has changed, Madam Deputy Speaker. We must all play our part in the solution.
Zara Sultan.
Thank you, Madam Deputy Speaker. This is an unprecedented crisis. How this House, the Government and the Prime Minister responds determines the fate of millions. We are making life and death decisions, choices that either save millions of people from poverty or plunge them into it. They're choices about priorities, about what and who is important. They're political choices, and Madam Deputy Speaker, I'm concerned about the choices the government is making. To give you an example, the rich can buy COVID-19 tests at private health clinics, but frontline NHS staff aren't getting them. That can't be right. And in response to this emergency, we must change our priorities. Public health must come before private profit. Now, Madam Deputy Speaker, I welcome that an amendment has been accepted which gives protections to Muslim and Jewish communities who feared this bill would have resulted in forced cremations. I hope these protections are heeded. But there are a number of ongoing concerns I have, and given time constraints, I will limit myself to 3. First, statutory sick pay. Even after this bill, millions of workers will not qualify for it, including low earners, the self-employed, and workers in the gig economy. And for people who qualify, at £94 a week, it is the second lowest rate in Europe. The Health Secretary himself has admitted he couldn't live on it, so he shouldn't expect our constituents to. So I urge the government, raise the rate to the equivalent of a week's pay at the real living wage and extend it to cover all workers. Second, the impact this bill will have on disabled people. The bill suspends the duty to meet needs of disabled people and their carers. It weakens duties to meet children's educational requirements, and it relaxes safeguards for detaining people under the Mental Health Act. The virus presents us with huge challenges, but it can't be an excuse for abandoning disabled people. 10 years of cuts has already drastically eroded disabled people's rights. Coronavirus must not be allowed to hit them hardest too. The third and final point I want to raise is about migrants' rights. There are now confirmed cases of COVID-19 in Yarlswood Detention Centre. The virus will cause a health disaster unless the government releases detainees. But it's not just migrant detainees who are at risk. In spite of the fact that NHS staff from across the world are on the front line battling this pandemic, migrants are still being charged for NHS treatment. Adding COVID-19 to exempted conditions does not go far enough. So long as conditions are charged and the NHS is sharing data with the Home Office, migrants will be deterred from seeking medical help when they need it the most. This is unfair and it's a public health risk. So again, I urge the government, release detainees from detention centres, suspend NHS charging, end data sharing between the NHS and the Home Office, and make sure NHS staff and migrants know about this with an information campaign. Madam Deputy Speaker, I will finish on this. Crises show us who we are. They show us what we care about. And across the country, people are answering that. They're reaching out to elderly neighbours they don't know, offering support and reassurance. Strangers are organising food deliveries for vulnerable people they've never met. In cities across the country, networks of support and solidarity are springing up. That is one answer. It's an answer that says we value everyone, that no one should go through this alone or unsupported. But that is not the answer the government is giving. Instead, it is abandoning the self-employed, it's neglecting the sick and disabled, it's letting businesses lay off staff and leaving sick workers destitute. It's giving millions to profiteering private health companies, while NHS staff don't even get basic protective equipment and are resorting to using bin liners. That is not a response true to our values. So before it's too late, I urge members, let's rise to this challenge and beat this virus together.
Chris Loder.
Thank you, Madam Deputy Speaker. Madam Deputy Speaker, on Saturday, we had our first death from coronavirus in West Dorset at our county hospital. However, while a fellow citizen was dying from this awful virus in hospital, others were congregating all along the Jurassic Coast, particularly in Lyme Regis and Bridport, sharing ice creams on the beach as if it were a summer Saturday afternoon with flagrant disregard for the government's advice. This country is not on holiday. It is time to wake up, and we must take this seriously. We need to minimise the transmission of this highly contagious virus, because with 38% of the population in West Dorset older than 60, the risk is considerable. So whatever is asked of us, we must follow the government's advice. But right now, Madam Deputy Speaker, I have an urgent need for two things in West Dorset. I appreciate very much indeed what the Chancellor has done so far to support people's incomes, and I commend all those on the front bench here today for their work. However, 24% of those in work in West Dorset are self-employed. At the moment, we are not doing enough to help them, so can I please urge the ministers to expedite measures to support our self-employed workforce? No, I'm sorry, I would like to keep going if that's all right. On Friday, our local bus operator gave 48 hours notice that it was stopping vital bus links into our second town. These buses have now stopped operating completely. They are connections that are desperately needed to get to Bridport Hospital. So can I urge colleagues and my right honourable friend, the Secretary of State for Transport, to consider what help he can give to help local buses in rural parts, as this will not just be an issue for my constituency, but for the entire country. Madam Deputy Speaker, I support this bill. It covers many of the measures that are necessary in this national emergency. This past weekend, people were still ignoring reasonable advice to observe social distancing. So this bill has to contain measures that enable the government to ban gatherings and to go still further if necessary, however uncomfortable that may be. It allows our recently retired healthcare heroes to return to the front line, and it puts into law the Chancellor's welcome statements on statutory sick pay. As the member for one of the most at-risk areas in the country, with the 8th highest proportion of over 65s in the United Kingdom, I am pleased that the government is taking this approach. But we must do more for the self-employed. They are the backbone of the economy, and whilst I welcome announcements regarding minimum income floor, we need to sort that out. Madam Deputy Speaker, the United Kingdom is facing a pandemic like none of us have seen in our lifetime. We need only to look to Spain and to Italy for an insight of the challenges that we are going to face. I pay tribute to the Chief Medical Officer, the Chief Scientific Advisor, both of whom are playing crucial roles in tackling this virus. And can I commend the front bench again, the Prime Minister, the Chancellor and other right honourable friends for their leadership at this incredibly difficult time. Madam Deputy Speaker, our response to coronavirus will prepare this country like never before. And I have only this left to say. To those on the NHS front line, thank you. To the volunteers in West Dorset and across the country, thank you.
Order. Order. The more people can keep their speeches short, the more can get in. Ruth Jones.
Thank you, Madam Deputy Speaker. And I want to start by paying tribute to all those who are working so hard in Newport West and right across the country to help their patients, their neighbours and their friends right now. My message to everyone across the UK is to think of others and act wisely. That is how we will get through the weeks and months ahead. As of last night, there have been 12 COVID-19 deaths confirmed in Wales. 5 of them have been in the hospital in my constituency. They and their families are in my prayers at this difficult time. Like all members, I want to extend my deepest sympathies to all those across Wales, Britain and the world who have lost loved ones. I am grateful to the Welsh Government and its staff who are working round the clock to ensure that vital services are maintained and that most vulnerable are protected and supported as best as possible. And there have been a number of specific practical Welsh measures that I welcome, including free travel for NHS staff on Transport for Wales services from today. One key demand, though, I have of this bill today is that this legislation must be renewed every 6 months by a binding and fresh vote on the floor of this House. Many parts of life, as we know, have changed and will change, but we cannot allow the basic democratic principles of this country to change. I am pleased that the Government has tabled its own amendment, and I welcome this provision for Parliament to review progress and hold the Government to account over the coming months. The second demand I have is action on jobs, livelihoods and incomes. Over the last week, as many others, I've been inundated with requests and demands for guidance, answers and clarity from local businesses in Newport West. The Government can take some very tangible steps now. They can underpin jobs and incomes with a comprehensive income protection scheme. They can introduce European-level statutory sick pay for all workers from day one. They can tackle universal credit by increasing it, suspending sanctions and scrapping the 5-week wait for the first payment. And they can act now to assist the many millions of self-employed who are worried out of their minds as to where their next penny is coming from. My third demand is that we must have action on rents. There should be a clear suspension and immediate ban on evictions for 6 months. I note the Government has introduced a ban for 3 months, but that doesn't go far enough or provide enough protection. My final demand is that the legislation is examined with regard to those with additional needs. The legislation as drafted removes the rights of those with disabilities to access care homes on their terms. The duty to educate children with additional education needs has been modified to only requiring authorities to make reasonable endeavours, and the civil liberties of disabled people appear to be severely eroded along with their right to support in many areas of their lives. It cannot be right that legislation which is intended to do most good will inadvertently affect the most vulnerable in our society, and I would ask the Minister to address this specific point in her summing up. Another specific ask is a plea for clarity on the definition of what is a key worker. There is much confusion where we need clarity. There are 5 million self-employed who have spent the weekend desperately worried about what is going to happen to them, their families, their staff and their livelihoods. We need immediate support for the beautician, the journalist, the childminder, the dog walker, the cleaner, the publican and those who support our churches, mosques and other places of religious worship. And talking of faith, I welcome the amendment regarding the burials, not cremations of victims, which would do so much to reassure the strong and vibrant Muslim community in Newport West that respect and decency is an important focus for all of us, as well as saving lives and getting through this crisis. My last point is a direct plea to my constituents and to people across the country. Please, please, please stay at home and follow the medical advice. This is a matter of life and death, but if we work together, we will get through this.
I'm going to have to take the limit down to 3 if there's any chance of getting people in. I'm sorry. Paul Bristow.
Thank you, Madam Deputy Speaker. I would just like to start by paying tribute to my honourable friend, the member for High Peak, for his maiden speech. I've been his friend for 12 years. It was an excellent speech. I knew he would always make a significant contribution in this House. I think everybody recognises that these are unprecedented times. The Government has needed to act with extraordinary speed, and I would like to thank Ministers, and particularly the Secretary of State, for the energy and the determination they have shown. The coronavirus pandemic is the biggest crisis facing our country for a generation. Today's legislation is necessary to tackle it. Both the Government and local authorities will require temporary emergency powers to get us through this period. The bill is the right thing to do. Nevertheless, we must hope that not all of the powers outlined in the bill will need to be used. Some are uncomfortable and are only justified by the magnitude of the moment. One concern I had related to the proposals around disregarding the wishes of the deceased in Schedule 27, which would have allowed all bodies to be cremated indiscriminately if the system couldn't cope. Understandably, this was causing alarm to anyone whose religion forbids cremation, including my local Muslim community in Peterborough, who made their feelings clear to me this weekend. However difficult circumstances become in the weeks and months ahead, it would be extremely undesirable for their religious beliefs to be ignored. To get through this crisis, we need to bring every community in our country with us. And for that reason, I'm enormously grateful for the reassurances today on this issue from the Government. Because of the speed required, we all understand that not every measure announced will be perfect or complete first time. Today's notice of the amendment from the Secretary of State, combined with his comments, will give our Muslim and Jewish communities much of the security they need. And I sincerely hope that this will now mean that local authorities will never enforce cremation of a dead body against the expressed wishes of the family when they have ample burial spots available, and the ability to transport the body to the burial spot. This is welcome and needed, and I've been in close contact with the leaders of all Peterborough's mosques, and they took a firm lead last week in closing Friday prayers, extracurricular schooling, on all their other activities, which was by no means easy to them. They saw through tough decisions, and I'd like to thank Mr. Abdul Chowdhury of the Faiz Madinah, Nazim Khan of the Masjid Guzia, Hamid Chowdhury of the Masjid Khadija, and Mr. Yunus of the Alma Road Mosque, and Salam Rahmatullah of the Hassani Islamic Centre, Burton Street. We need them and they need us, now more than ever, and I know they will be relieved and pleased by this news from the government. I also know that Peterborough can come together to find procedures that will allow for Muslim and Jewish burial. As this pandemic develops, we may face the heartbreak of capacity limits, but I am now confident that the City Council and local communities will now find a way through this, respectful to all.
Sarah Jones.
Thank you, Madam Deputy Speaker. I want to first pay tribute to civil servants across government who have worked incredibly hard to put this legislation together, and I welcome the content of the bill and the work that the government is undertaking. But I want to focus my remarks on housing, because, Madam Deputy Speaker, there are massive holes in today's proposed legislation when it comes to protections for the millions of people who do not own but who rent their home. And I'm basing my remarks on the amendments that have just in the last 15 minutes been published by the government, which we have absolutely no time to properly scrutinise. Madam Deputy Speaker, these are very difficult times for all of us in this country, but the risk of losing your home is surely too much to ask anyone to bear in this time on top of everything else, as the government itself has acknowledged with its action on mortgage holidays. The Labour Party, and in particular my honourable friend from Wentworth and Dearne, has published draft legislation to protect renters, which we published last week, which would have gone much further than the government has gone today. There is an overwhelming case for action. 20 million people in this country, in England, rent, and 6 million of those have no savings whatsoever. Last week, Shelter estimated 50,000 households could face eviction through the courts in the next 6 months, and these evictions don't include large numbers of Section 21 no-fault evictions. We have heard of landlords threatening to evict health workers because of their risk of exposure. And more alarmingly, some of the 1.5 million people the government has written to and told to stay at home for 12 weeks could face eviction notices over the coming weeks. Astonishingly, today's amendments don't get us to what the government itself promised last week, which is a 3-month ban. They simply extend the notice period for evictions by 1 month, which means over this entire period, eviction notices will still be landing on people's doormats. They simply won't be evicted until June instead of May. It's really clear what we need. We need to see 3 things: a real ban on evictions for 6 months, suspension of rents to defer rental payments and allow repayment over a further manageable period, and a substantial increase in support for rental costs through the social security system. Whilst I say again that I broadly welcome the work that the government is doing, it would be frankly disgraceful for ministers to have promised one thing last week and to have now misled renters with a promise to ban evictions when the reality is nothing short of that. So will the minister please tell us what they will do for the thousands of families who could be evicted in the middle of this lockdown? Will we see an immediate suspension of all possession cases, and Shelter has draft legislation in place? Will the minister also protect those families in temporary accommodation and bed and breakfast, and listen to the Children's Commissioner's call and pay attention to...
Peter Alders.
Thank you very much, Madam Deputy Speaker. I think it's important to recognise what the government have done so far. They produced a 321-page bill at very short notice. There is no template for this. They've moved very quickly. They've listened to concerns from all around this chamber, and they are leaving no stone unturned in minimising the impact of coronavirus, both on the British people and their businesses. There is still work to be done to address the needs of the self-employed and ensuring that our world-leading charitable sectors can be sustained. But we need to get this bill on the statute book as soon as possible, and the brief comments that I will make are intended to seek reassurance and not to thwart. Madam Deputy Speaker, in order to beat this virus, our statutory services need all the help and support possible from the voluntary sector. And as a former member of the St John Ambulance Suffolk County Board, I would like to highlight the work that St John can do working alongside the NHS. There are 15,000 St John volunteers, of whom 8,500 are clinically trained. They can provide ambulances, they can provide first aiders in emergency departments, and they can also provide support for the homeless with outreach clinics. But to make full use of their services, St John's volunteers need access to paid leave, ready access to emergency volunteer certificates as required by Schedule 6 of the bill, and also inclusion within the definition of key workers so that the children of St John volunteers can attend school. This bill has the very best of intentions, but the government must guard against unintended consequences. Many groups are worried that the disabled and the vulnerable will be disadvantaged, left both without essential support and any rights to request that support. This could put lives at risk. There are concerns about possible delays in carrying out assessments for the eligibility of NHS continuing care. There are concerns that local educational authorities may suspend a child's education, health and care plan. Reassurances from government on these 2 points would be welcome, and funds must be provided for and not diverted from this vitally important work. A final unintended consequence, based from the evidence from China, is that lockdown conditions created by the pandemic could lead to a significant increase in victims of domestic abuse. Safe Lives has set out a number of actions that the government can take to prevent this, and I would urge them to give these full and very serious consideration. Madam Deputy Speaker, we must not divert and delay. We must get on and enact this bill, but in doing so, we should continue to seek to build a consensus and to also guard against unintended consequences.
Rodder.
Thank you, Madam Deputy Speaker. I'll be brief given the time. Madam Deputy Speaker, it is quite clear that we face the most serious and sustained crisis, something which is quite simply new to many of us and is something which our generation has never faced before. I believe that I would like to commend the speech by the former Health Secretary where he pointed out the very effective action that's been taken in a number of Asian countries. And I would like to associate myself with the thrust of his remarks that we need to take very clear and determined action as fast as possible given the circumstances, and that means obviously much tighter social distancing measures and a much more active approach by the state. It also requires, as he pointed out and other speakers have said, the need for effective PPE and other supplies to our hospitals as soon as possible. And I should say that I have heard of cases in my own area, not my constituency but nearby, where there are real concerns about this. So we do need to look at what works, what has worked around the world in tackling this dreadful problem. There are examples where action has been taken immediately and it has constrained the spread of the virus. Now, I'm very pleased that the Prime Minister has now pivoted. He's listened to the World Health Organization advice and he's taken the UK on a different track. We do have a very narrow window of opportunity to stem the worst of this crisis. We've seen what's happened in Italy and in many other countries on the TV news, and we do not want to see that in this country. And I would urge everyone to support the measures that are being taken forward. However, I'm conscious of time. I have some reservations about this bill, and I would like to echo the points made by our front bench, and in particular by other members around the House, the need for consent, for protection of the needs of vulnerable people, and for greater thought to be put in. And I would urge the government to take on board points made across the House today. The spirit of the debate has been extremely constructive, and I know the Minister is nodding and thinking about this matter. Please do take on board the points about both the wider need for social consent and for review mechanisms to be effective at minimum 6 months, possibly a further ability for Parliament to bring it back within a year as well if possible. So I would urge Ministers to consider that. I'm conscious of time. Grateful for the opportunity to speak today.
Imran Hussain.
Thank you, Madam Deputy Speaker. I don't think that there is any doubt in this House that the situation that we are facing and debating this afternoon is unprecedented in living memory, with a raft of measures that would be unspeakable in any other situation outside of wartime. Such is the challenge we face. And the Government has my support in implementing measures to help keep us all safe and help keep each other safe from this hidden enemy. I do have a number of concerns, as raised by a number of our front bench, around those that are self-employed, around the impact on those that are disabled and frontline NHS staff. However, time not permitting, I will make one point that has been raised with me by a number of constituents around Schedule 27 of this bill, which suspends protections that prevent the cremation of an individual regardless of their wishes or faith. The right to faith and dignity in death are some of our most inalienable rights, and ones on which we must never compromise. And how our physical bodies are handled and treated after our death is a core tenet of all faiths. That is why I wrote to the Public Health England some time ago to express my concerns on how the deceased may be handled during this emergency, and why I was alarmed to learn of the measures in this bill overruling the right to faith and the right to dignity in death by permitting a local authority to cremate an individual against their wishes. Whilst I acknowledge that the Government has this afternoon taken a step in the right direction and shown that they are listening and engaging with faith communities by making it clear in law that faith must be considered and taken into account before a decision on cremation is made, there is still some confusion within it, as it appears to still allow a local authority to cremate on an individual against their wishes where there is a lack of capacity either locally or in the immediate area for handling the deceased. The Government must this afternoon address this confusion and make it clear the absolute right to refuse the option of cremation is upheld in this amendment and in Government policy. They must also make it clear that they are committed to ensuring that all local authorities will have sufficient capacity to handle an increased number of deaths. And it is on this point that I want to pay tribute to the work of Bradford Council over recent days and weeks to build our additional capacity to handle deaths in a faith-compliant manner and ensure that in Bradford we never have to compromise on the right to faith and dignity in death. As the leader of Bradford Council has firmly set out, those of faith where burial is a prerequisite will always have that wish respected, and that will always be Bradford Council's position in all circumstances, a point which I think should be clearly on the record. In short, our Muslim and Jewish faith communities are rightly concerned about the measures in this bill, and they want firm assurances from the Government, assurances which I am urging the Government today to provide, that there will never be compromise on the right to faith and dignity to death. They are fundamental and absolute rights, and they are non-negotiable.
Helen Hayes.
Thank you, Madam Deputy Speaker. I recognise the need for emergency legislation at this time in order to minimise and reduce the harm and devastation that COVID-19 is threatening to communities across the country. But I rise today to speak on behalf of the millions of people who are currently receiving social care, those who are in need of social care but not currently having their needs met, those who will need social care for the first time because of the impacts of COVID-19, and children with special educational needs and their families. These are already some of the most vulnerable groups in our society. Many are also in the vulnerable category for COVID-19 due to age or comorbidities. They are also exceptionally vulnerable to the social and mental health impacts of this pandemic. By suspending all of the rights of older and disabled people under the Care Act 2014, there is a significant risk that some vulnerable people will have care withdrawn as resources are prioritised, and that some vulnerable people may be left in truly desperate circumstances. I am concerned that in his opening speech, the Secretary of State appeared to say that the purpose of these measures was to ensure that people's life and death social care needs would be met over those who currently have a statutory entitlement, but for whom this was not a life or death issue. In my experience, it's simply not the case that anyone who is able to access social care in one way or another, that this is not a matter of life or death. I asked the Minister what assurance there is for people who are already eligible for care under the Care Act that their needs will continue to be met. We need greater clarity for the Government on what criteria will be used to allocate social care resources at this time, how individuals can trigger a review of decisions that are being made about their care under this bill. I am also concerned that this bill may result in the little progress that has been made in relation to the Transforming Care agenda for people with autism and learning disabilities being undone at this time, and that this could both directly, through the withdrawal of support for autistic people and people with learning disabilities, result in higher incidents of crisis, and that because of the provisions in this bill, more people could end up being detained and end up back in institutions which have been traumatising and where abuse has taken place.
90 seconds, Yasmin Qureshi.
Thank you, Madam Deputy Speaker. The Government amendment in Part 3A, Section 13A and B, sets out that the words are that it's clearly desirable for a local authority to consult with religious communities and groups in the event of a deceased person. However, what this particular provision does is it says that it's desirable to do so. It does not say that, however, if a family or a person objects to the cremation taking place, the local authority can still go ahead and cremate. I just wanted the Minister's assurance if that is correct, or is that going to be the case that perhaps in the course of the amendment of the Act, it will actually say very clearly that if a person does not wish to be cremated, that they will not have a cremation take place.
Shadow Minister Nick Thomason.
Thank you, Madam Deputy Speaker. And the tone of this debate, sober, serious, determined, reflects the mood, I think, of the people. And I'm conscious that on a bill of any importance, I would usually be addressing a packed chamber. But I want to thank those members who are not here, who've stayed away for reasons of social distancing. They are doing the right thing and they are still standing up for their constituents. And we've heard some very powerful speeches in the House from honourable and right honourable members. And I want to thank the members on these benches from Sefton Central, Rhondda, Birmingham Hodge Hill, Coventry South, Newport West, Croydon Central, Reading East, Bradford East, Dulwich and West Norwood and Bolton South East for their contributions. And also to commend the maiden speech from the honourable gentleman for High Peak, who said that his parents were not able to watch it from the gallery today, but at least they were able to watch it on television. I'm sure they were very proud, and I wish him well in his time in the House. Madam Deputy Speaker, this bill will change our everyday life in profound ways. Freedoms we've enjoyed over generations will be curtailed. As my honourable friend for Leicester South set out, the opposition in this public health emergency are supportive of this bill as a necessity to mobilise resources effectively, but most importantly of all, to save life. Our thoughts are with families who've lost loved ones in this global pandemic, and at this time of crisis, the public interest requires we consider extraordinary measures that only a few weeks ago were unthinkable. We have to ensure, though, that the arrangements are fair and just for everyone. Social distancing and self-isolation must be accompanied by guarantees of access to the basic means of living, of food, fuel, income and housing. For every sacrifice expected from our people, there must be an equally strong imperative on government to protect and provide for them. Nobody should have to choose between their own well-being and the nation's public health. Nobody, Madam Deputy Speaker, should lose out for doing the right thing, and I will set out in more detail at committee stage the measures that we will suggest to improve what the Chancellor has suggested. And as we ask many people to remain at home, with all the effects that has, let us remember too those who do not have a home to stay in and are on our streets needing our protection. And let us thank all those who have been working for the good of others in the most difficult of circumstances. To our brilliant NHS staff, caring and compassionate, to the teachers who, with school closures imminent, continue to do the very best for our children with dignity and determination. And to all our local government workers keeping vital services going, and our shop workers who've kept going sometimes in difficult circumstances. But words of gratitude are not enough. The government has to make sure that protective clothing and equipment is available to every single person who needs it, and there must be ventilators too for every patient who needs them as well. In time of peril, it is right the people look to government and elected representatives for leadership. And it's when government is at its most powerful that it needs most scrutiny. I'm pleased to see the European Convention on Human Rights compliance certificate and the fact that this bill will be subject to the supervision of our courts. But a 2-year sunset clause without regular scrutiny was not enough. I welcome the concession made by the government to move to 6 monthly votes, though I think the general view of the Chamber is that if it could be made clear that any votable motion is amendable, then it would make clear that certain individual elements of the bill could be switched off as well. In 1939, the then government passed emergency legislation to deal with total war. That actually required renewing on an annual basis. Times have changed now. We are not in a battle with other countries. Rather, we stand together in the values of our common humanity to drive back the coronavirus disease that threatens us all. The government's focus must be on diverting resources to this colossal national effort. But that should not mean that duties to people already in need completely fall away, and that hard-run rights over many years are not lost forever. New legal minimums of support should not be a default. Care packages should not automatically be cut back to the minimum required, and those with special educational needs must have the care they need, Those with disabilities must have their rights protected. The government must make clear its value in action, not words, for everyone who relies on support. Life will, Madam Deputy Speaker, return to a sense of normality in the not-too-distant future. But we are asking for changes in our way of life. There have, of course, been negative stories. In the course of the debate, the Shadow Transport Secretary has sent me a photograph of workers in a canteen in Teesside, clearly not respecting social distance. But alongside those negative stories, there are also great stories, too, of the very best values of our society. Hearing the famous You'll Never Walk Alone played simultaneously on radio stations across the world summed up where we are. We must not let this period be defined by isolation. I think of the grandparents not seeing their grandchildren as they otherwise would, the people whose attendance at community events kept them going. But being separate does not mean that people have to be alone. In this age of modern technology, we must use all the means at our disposal to keep talking, to stay together. And I say to anyone watching this, if you do nothing else this evening, contact somebody who is on their own to show them that. Madam Deputy Speaker, the late Aneurin Bevan, who created the National Health Service that we'll need more than ever in the weeks ahead, once wrote, "Not even the apparently enlightened principle of the greatest good for the greatest number can excuse indifference to individual suffering. There is no test for progress other than its impact on the individual. And there can be no other test for this bill and the financial measures that go with it than how it protects every single person. Let this be a time of togetherness across our United Kingdom, all determined to get through this. Let us look out for each other and set an example across the world."
Mr Penny-Mordaunt. Thank you, Madam Deputy Speaker. I don't have a lot of time left, so if I can't address points, I will try and address them during the committee stage. But I would like to briefly put on record and echo the sentiments that I think every speaker has made in this debate, thanking our care and our health professionals, the police, military, volunteers and everyone who is working so hard to combat this crisis. And I'd like to thank all honourable members who've contributed to the second reading debate. The key points are the fact that the vast majority of powers contained in this bill will not be live at royal assent, that parts of the bill and those powers can be switched on and off. They don't stand or fall together. And the bill can obviously be, the powers that it creates can be switched on and off as well. And that, I think, addresses many of the points that have been made by some members. We are only taking powers that we need. So many members, the Honourable Lady from Croydon Central, raised points about renters and self-employed, but this is really today about the powers that we need to take now, not about every aspect of our response. I'm going to come to the Shadow Secretary of State's points. And thank him for his approach to working with the government on all aspects of this response. What he says on social distancing and the offer of support that he has made for further measures is noted, and I thank him for that. He asks about EU joint procurement. Not all member states are part of that procurement system, and we have chosen other routes. He asks about car parking, and I believe there are ongoing discussions with trusts about that, and also about pay for nurses taking time out of training, and they will be paid in accordance with the terms and conditions of those roles. I want to also turn to the issue of social care. Many members, the Honourable Member for Hornsey and Wood Green, my Honourable friend, the member, Right Honourable Member for Romsey, members for Coventry South, Newport West, Dulwich and West Norwood have all mentioned social care. I fully understand why this is such an issue. Carers, adults in social care, parents of children with learning disabilities and others often feel they have a fight on their hands at the best of times, and we are heading for, I hope not, the worst of times. But I understand their concerns around that and wish to provide them with reassurance. The purpose of these powers is to protect the most vulnerable when we come under great strain in these systems. Clause 13 is live on royal assent, but clauses 14 and 9 are not. They need further regulations in order to commence. And my honourable friend, the member for Faversham and Mid-Kent, is doing an amazing job at ensuring that we do understand what is going on around the country. We will understand if these powers are switched on, what is happening, taking data from CQC, but other areas as well. And I think I can provide the assurance that honourable members are seeking on that, and happy to at length in committee stage if I get the chance. The right honourable member, my friend, the right honourable member from Surrey South West, mentioned personal protection, as many honourable members have. We are working with business, an incredible response from industry, injection moulders and others, to produce more PPE. I think the strains in the system are not the volume, it is in the distribution, but clearly my right honourable friend has stood up military assistance and other assistance to get that to where it needs to be. You will be hearing more, I'm sure, in the future about testing and the new end-to-end testing scheme that has been put in place, and on mobile phone data as well. My right honourable friend mentioned Dr. Tedros, of course, and we should all pay tribute to his and his team's efforts as well. The right honourable member for Dulwich and West Norwood, along with my right honourable friend, the member for South West Surrey, also mentioned the transforming care aspects, and I know that the schemes that my right honourable friend, the Minister for Social Care, has put in place on that scheme, monitoring referrals and other such data, I think will give us confidence that we can understand what is actually happening in the system. The spokesman for the Scottish Nationalists emphasised the importance of us working together, and that we needed to put in place economic measures. I would also say to him that we have to recognise that people who are travelling to other parts of the country may be doing that with the best intentions. He is right, and we are right, to ask them to follow the Chief Medical Officer's advice, and that's why we need to be clear about that advice and staying at home and the support systems that are around people in their communities. I'm sorry, I'm very, very short on time. Other honourable members have mentioned businesses, examples of good practice, but also, I'm afraid, bad, and that needs to be called out. My right honourable friend, the member for Chipping Barnet, spoke about care homes, and obviously policy is under review, but we have to find the right balance between those individuals' mental health and social support, and obviously keeping them safe. The honourable member for Sefton Central mentioned sick pay, and I know that DWP are, and what further support we could give to caseworkers and so forth. DWP are looking at training and teach-ins for citizens advice bureaus, caseworkers and others, so we can make sure that as these initiatives are coming out, that they're understood very well. I must, in the short time I have left, pay tribute to my honourable friend, the member for High Peak, in his maiden speech. As the honourable gentleman opposite pointed out, Louise and Terry, as I think they are known, are no doubt watching on television, and I'm sure the whole House would want to send them our best wishes as they follow the Chief Medical Officer's advice, to let them know that their son has done very well for himself. And he was absolutely right to acknowledge, and I know that this is very that members really do understand this, that we are in a very privileged position compared to many people, and I know that that is in everyone's thoughts as we consider our own personal response to this situation. The honourable member for Rhondda quite rightly raised the matter of people's behaviour. My honourable friend, the member for Winchester, also mentioned that this is not a new issue, that we have trained very heavily. I'm sorry to disappoint honourable members. I have their issues here. I will say more about them, including the issue of funerals in the committee stage of this bill, and I commend the bill to the House.
The question is that the bill be now read a second time. As many as are of that opinion say aye. Aye. Of the contrary, no. I think the ayes have it. The ayes have it. Money resolution to be moved formally.
I beg to move.
The question is, as on the order paper, as many as are of that opinion say aye.
Aye.
Of the contrary, no. I think the ayes have it. The ayes have it. Under the order of the House today, we now move to Committee of the Whole House. Order.
Order.
Coronavirus bill.
Order. I have a few things to explain just before we begin the committee stage. For understandable reasons, a large number of manuscript amendments have been tabled by the government today, and in fact large numbers of other manuscript amendments have been unusually allowed today as well. Members need to make sure, therefore, that they're working from the right version of the notice paper and that they have the latest version of the grouping and the selection list, although I should explain to the House that there is one group. Government Amendments 79 to 82 on extradition are on a separate supplementary notice paper, and a revised grouping and selection paper will be issued shortly. The late appearance of these amendments is not due to government action, but to a mistake on the part of the Public Bill Office. But lest anybody complains, I will defend the Public Bill Office because they have done a marvellous job today. I've seen it over the last few days, and the people who work here have worked miracles to get us to this stage in such good order. The business of the House motion, which the House agreed before second reading, allows the Chair discretion at the end of the time allowed for committee. In this case, that falls at exactly 10 p.m. To call non-government amendments and new clauses to be moved formally at that stage for separate decision. I have to tell the committee that my sense of where we are at this stage today is that I will call divisions only when they are really essential. As always, the Chair will listen to the debate and form a judgment on whether to exercise that discretion. I'm simply informing the committee now that today the bar is a high one. No one will be surprised to hear that. And that arguments in favour of going through the division lobbies tonight will need to be very persuasive. We will start with Clause 1 stand part, with which it will be convenient to take all the other clauses stand part, including amendments to clauses and government and other new clauses, and all the schedules, including amendments to schedules, government new schedules, and the other new schedule. The question is that Clause 1 stand part of the bill. Does the Minister wish to come in at this stage or later? Later. Clause 1 stand part of the bill. Goodness me. Chris Bryant.
Well, there we are. Right. Madam Deputy Speaker, I rise merely to refer to the issue of the timing and the length of the bill, because, as you will know, the Minister said in the previous debate that they were tabling an amendment which would allow, instead of a 2-year period for the bill to exist, the bill will still be on the statute books for 2 years, but nonetheless, after 6 months, there will be an opportunity to vote on whether or not the temporary measures in the bill should remain. Now, I just urge the Minister to look very carefully at the amendment that they've tabled, because I think it's defective. It says quite clearly in New Clause 19, in this section, relevant temporary provision means that any provision of this Act which is not listed in Section 2, provisions not subject to expiry. but I can't find anywhere a Section 2, provisions not subject to expiry. So I don't think that this amendment works in law. Now, I may be completely wrong and I may have missed something, and I hope, if so, that the Minister can enlighten me. And I don't think there's any conspiracy here. It may just be that something's been missed. But my anxiety has been from the start, as I think it has been for the Right Honourable Member for Halton, Price and Howden, that 2 years is a very long time to have such draconian measures on the statute book at all. And secondly, to have them on the statute book without a moment at which the House, rather than ministers, can decide to switch individual measures on or off is quite problematic. The government has already used the 1984 Public Health Act for the statutory instruments which is now tabled to close pubs, restaurants, casinos, spas, gyms and so on. That is under that still has to go through the House under the 1984 Act, and that's secondary legislation which it needs Parliament, the Commons and the Lords to vote in favour of within 28 days of that having been tabled. If they had gone down the route of the Civil Contingencies Act 2004, likewise, they would have needed to come back for each of the individual powers that they presented under that Act every 30 days. And if the House chose not to allow those powers to remain, then they wouldn't be able to continue using them. And in addition to that, the 2004 Act makes it clear that if Parliament is adjourned for more than 4 days, or even if it is prorogued, then the Speaker and the monarch have to summon Parliament. So, of course, I give way.
You may be coming to this, forgive me if he is, but there's one other element of this. By putting this in primary legislation rather than secondary, it also takes it out of the purview of the courts. So here we have one of the heaviest duty acts we have seen post-war, prevented from judicial review in the interest of citizens.
Well, I agree, and I don't really understand why the government have gone down this direction. I have been told in several private meetings that this is because the government believes that the Civil Contingencies Act 2004 can only be used where the government doesn't know that something's coming down the line. But the definition in section 19, I think it is, of that Act, of what an emergency constitutes, I think would allow for every single thing that we are presently considering. Now, I tabled an amendment, and I must apologise to the Honourable Member for the Wrekin, because it is entirely my fault that by accident his name ended up on my amendment. I'm terribly, terribly sorry. And if any of his government whips want to beat anybody up, they should be beating me up. So I apologise to him. But there is a serious point here, which is that if the government is going to take draconian powers and give itself the power to switch them on and off, I think that should come back to Parliament more frequently, even than is allowed for in the government's amendment. I give way.
I thank the right honourable gentleman very much for giving way. He may well be right about the civil contingencies point, because the clerk who drafted that legislation, the drafter of that legislation has confirmed that that is indeed his understanding. At least that is, I believe, the case. But can I just go back to what he was saying before? I agree with him that 2 years is too long. I would have preferred the amendment which stands in the name of my right honourable friend to have been the amendment that was adopted. But I don't think there's any sense in the House that we want to have a vote on this. What we do want to do, of course, is to put the government on notice that the length of time is a matter of concern and that we must have a chance, and the government appears to be moving towards agreeing to 6 months, to review this matter. And although I completely agree with him about the importance of the matters which he has sought to enshrine in his amendment, I think that would encapsulate the will of the House at the moment.
I have absolutely no intention of dividing the House. I don't think the nation needs dividing, and I don't think that the House needs dividing either on these matters. And I'm grateful to the government, which I think has tried to be in as listening a mood as it possibly can. My anxiety, however, is that the government's amendment, as it's tabled, I think is defective and simply doesn't work. And my final line, Madam Deputy Speaker, is that my anxiety is that in 6 months' time, the government will present us with a take it or leave it. You've got the whole of the Act, all the provisions carrying on for another 6 months, or you've got to leave it. And of course, then they'll retain these powers for another 18 months. Of course, I have to give way to the honourable gentleman.
I'm grateful to the honourable gentleman giving way, and
I think he's been very gracious in his apology, so thank you very much indeed for that. He says he doesn't want a division tonight, and that's welcome. And he says that the government's amendment is defective in his view. But on the principle of the government conceding a 6-month break, does he accept that?
Personally, I would prefer it to be shorter. I would prefer the government ministers not to be switching powers on and off, because I think that that will lead them to be more queried by the nation at large. I prefer it to be more like a 3-month period that they had these powers, and then for regular review by the House. But I'm not going to die in a ditch. There are no ditches here. I laud the government for the movement that they have taken, but I think that they still may need to move some way further, and it may be that they need to amend their own amendment when it comes to the House of Lords.
David Davis.
Madam Speaker, Madam Chairman. I rise to speak to specifically to Amendment 6 in my name and others, and also to the government's amendment to its own bill, which I'll come to in a second. The Secretary of State himself said this bill has an astonishing range of powers, just as a taster, from forced quarantine to cancelling elections, from allowing single doctors to section people to reducing parliamentary oversight of intelligence gathering, and much, much more. And the opposition health spokesman described it as having draconian impact on many basic freedoms. Now, as the Honourable Member for Rhondda has just said, many, if not all of these powers are actually to be found in 2 pre-existing acts. One, the Public Health Control of Diseases Act, ironically 1984, was designed for exactly the position we are in now, dealing with pandemics and epidemics, and it was amended later, I think in 2008, to make it even more specific. So it's got all of, not all, but the vast majority of the requirements that the government already needs. And as the Honourable Member for Rhondda says, it's been used already for the closure of pubs, restaurants and the like through a piece of secondary legislation. The other item is the Civil Contingencies Act 2004. And as the Honourable Member for Rhondda said, they could have used that. The government has argued, most recently last week at business questions, that it's the wrong sort of emergency. It's like the wrong sort of snow. It's the wrong sort of emergency to fall under the remit of the Civil Contingencies Act. Well, I have to tell them they are plain wrong. I was here for the debates on the Civil Contingencies Act. I remember, as does he, the arguments about what it would apply to and what it would not apply to, and this is specifically the case. But also, not just me, I'm not a lawyer. A number of public lawyers of my acquaintance think the government's wrong. But most importantly, and as my right honourable friend alluded to, we've got a much greater authority than that. After the statement of business questions last week, I put a point of order and asked the Speaker to get the opinion of his counsel, Speaker's counsel, who is Mr. Daniel Greenberg. And I'll read the House just the relevant paragraphs, only a couple of lines. He said, the 2004 Act, open brackets, which I wrote, close brackets, including the powers to make emergency provision under Part 2, is clearly capable of being applied to take measures in relation to coronavirus. The man who wrote the Act, the most authoritative source we can have in this House, Speaker's Counsel, somebody who's completely impartial, says the government is wrong. They could have used the Civil Contingencies Act.
Well, my right honourable friend,
of course I could.
So further to his point, and to back him up, when the draft pandemic influenza bill was drafted, which I spoke about earlier during second reading, it was agreed that if specific circumstances at the time meant that a freestanding bill, i.e. that bill on which this coronavirus bill is based today, was not able to be brought forward to the House, then clauses could very easily be converted into regulations under Part 2 of the Civil Contingencies Act. Yeah. So I remember those discussions very clearly from being in office at the time, so I think he has a point here.
Well, I'm glad to get his support. He's always been very assiduous in these matters, and he's right here. Now, you might say, I mean, a reasonable person might say, well, the logical argument to me, surely, is if all the powers are identical to ones that exist already, what am I complaining about? Right? That's a reasonable question. Well, the reason is that this bill loses many of the checks and balances in the preceding emergency legislation. We who put these, well, I wasn't quite here for the 1984 one, but the later ones, we who put these through the House fought hard and long to get the proper restrictions on government power, the proper requirements to bring them back to the House so the House could approve. Requirements like it's got to be cleared in 7 days, that if we're in recess we have to be recalled in 5 days. They're all in there. The fact that it has to be done through secondary legislation, which makes it capable of judicial review. And I know the government doesn't like judicial review, but there is nothing where it is more important than when the government exercises powers at the expense of citizens, and the courts have to step in. Now, as the Honourable Gentleman of Rhondda said, the 6-monthly review that the government has conceded is an important concession, but only if this House can amend or strike out. Anything else puts the House in the position of having to vote for an act that may be horrific in one part because the other 3 parts are essential. Not likeable, not pleasant, not beneficial, but essential for fighting this real threat. And don't get me wrong, this is a real threat. I've argued in this sort of legislation over the years when it's related to terrorism, and we are facing 10 to 100 times the death rate in 1 year the death rate from terrorism in 10 years. So, of course, there's a real threat. But we will then be put in a position of saying we take this whole bill, 3/4 vital, 1/4 horrible, or we strike down something which is vitally important for protecting the public. Now, that's the position that this House has been in for 30 years, and I'm looking straight at the Leader of the Opposition now, because he and I were in the same lobby time and again when we had counter-terrorism regulation, which was put through on a rubber stamp, precisely because of that. Which is why Labour, if they'll forgive me giving them advice, why Labour should be pressing for an amendable 6-month approval. Yeah, good, excellent. I'm glad they're learning. The 6 months and amendable, then it makes it completely different. Because it means the House can say, we need to prune this down. We need to reduce the size of this legislation. I will, of course, give way to...
Will he join me in calling on the opposition also to adopt his amendment, limiting the putting the sunset on this bill at 1 year, not 2?
I'll come to that in a moment. He's exactly... Of course, I'll give way.
I am grateful to the Honourable Gentleman for Halton Price and Howden for taking the intervention. Can I just confirm that I asked in the second reading wind-up, and I confirm again, I think it would be helpful on these 6 monthly votes at 6, 12 and 18 months that are already in the government amendment, if the government would confirm that the motions they bring that are votable are also amendable. Because if they're amendable, I think it covers the point that's being made by the Honourable Gentleman that part of it could then be switched off, but not all of it.
I'm glad you did that. I'm now glad I teased him, because I think it actually got something very useful on the record. And if I may pick up my honourable friend's point as well, that's why I proposed Amendment 6. It recognises that the government needs its new powers. It also recognises that Parliamentary Council have created a 320-page bill in a matter, by the sounds of it, a matter of days, in truth. It's an astonishingly short time that they did whenever they did it. And they've done it at a time, however, when scientific evidence, to put it mildly, is fragile and likely to change. It's changed already in the last 2 weeks. It's likely to change again as different tests become available, different vaccines become available, and so on. So scientific evidence will change. When economic analysis of future outcomes is unbelievably uncertain, and when the societal effects of this are completely unknown. So the bill is guaranteed to have flaws, even with the best draftsman in the world. So my amendment proposed that instead of 2 years, which is anyway too long, we have 1 year. And we invite the government to write a new bill in 9 months. If it thinks its bill is perfect in 9 months, put it back again and we'll put it through again. But this time, with 3 months for the House to consider it. Remember, the Civil Contingencies Act took a whole year to go through both houses. So then we'd have a proper democratic approval of the process. Of course I can wait.
I'm grateful to the right gentleman giving way. He's making an excellent speech.
There will, of course, be many things that we learn, not just about things that we need to take out, but critical measures that we need to put back into the bill. So actually having a flexible piece of legislation is going to be absolutely essential as we go through an emergency and learn things.
Great. I mean, I actually think the government's done a pretty good job so far in the face of unbelievably difficult judgments and decisions. I mean, you know, the Americans talk about drinking from a fire hose. That's how every minister in this government must feel at the moment, the sort of information and problems arising on their desk every day. And so he's right that there will be change. There'll be change in science, there'll be change in economics, and we'll know, frankly, also what's worked and what hasn't worked in the previous 9 months. So if we then allow Parliament 3 months to scrutinise it, we'll get good law, solid law, well-supported law on all sides of this House, with the sort of debate we've had today, which frankly has been one of the better debates I've heard in years, because all sides are committed to the same cause. Now, my final point is this. I recommend colleagues to read the report on this bill, published at lunchtime today by the Delegated Powers and Regulatory Reform Committee of the House of Lords. That's the expert committee of the other house, of the other place, that considers our legislation and makes recommendations to their own house. It's led by Lord Blencathra. Those who have been here a long time may remember him as David McLean, a tough, no-nonsense security minister at the Home Office. So their analysis is very clear, very straightforward. It's not a libertarian fantasy. It's very straightforward. And they come to a conclusion, which I'm now going to read out to the House, and it's this, in the last 5 lines of a 5-page report. We anticipate, it's talking to the House of Lords, remember, we anticipate that the House may well wish to press the Minister for an explanation about why the expiry date was not set at 1 year, thereby enabling the Government to exercise the powers needed in the immediate future while allowing a further bill to be introduced and subject to parliamentary scrutiny in slower time. So the House of Lords Committee on this bill has arrived at exactly the same conclusion as my amendment proposes, and that is why I move this motion.
Nick Thomas-Symonds.
Thank you very much, Madam Chair. And I rise to speak ostensibly to Amendments 2 to 4 and new Clause 4 in my name and the names of my honourable and right honourable friends. But I should say at the outset, and it's certainly no criticism of the Public Bill Office, Madam Chair, because they've worked extraordinarily well under huge pressure. Neither is it a criticism of ministers or indeed officials working under tremendous pressure. But as an opposition spokesperson today, I think in the last hour and a half, I was presented with 60 pages of covering 61 government amendments, and I've got 27 opposition amendments. Now, I think it is clear that I'm not going to be able to cover every single item in my remarks, but I will try to, very clear, I will try to refer to, not this early in the evening, but who knows. I will try, Madam Chair, to cover as many of those in a thematic way and perhaps refer to amendments when I think it will be helpful to the House, and with your leave I will take that approach. The amendments 2 to 4 relate to the Bill's emergency powers. And I want to deal with this first of all because the Honourable Gentleman for Halton, Price and Howden mentioned that, and I want to just make absolutely clear the position with regard to that. New Clause 4 is to place on the Government a duty to support the basic means of living, food, water, clothing, income and housing, employing all available statutory and prerogative powers. And those two themes, Madam Deputy Speaker, may be separate on the order paper, but they go hand in hand. The public health emergency and restrictions on freedom must be accompanied by the strongest possible financial measures to ensure that people can still have the means to get by. I should also make clear that I don't intend to divide the House on any of this evening, but I hope that the Government will listen to the points that I'm going to make. Now, the Second World War emergency legislation required renewal every year. I've noticed as well that the emergency coronavirus legislation in Ireland is subject to 6-monthly renewal, and we do need safeguards. Often the issue with this type of legislation, understandably done in haste, is not so much the intended consequences, but often the unintended consequences. And it is important because there are vulnerable people across our society whose lives are going to change and will need protection. The bill is subject to the European Convention on Human Rights. It doesn't exclude judicial review. There's no ouster clause in it. And these are very important safeguards. We do need more. Now, I do welcome the government concession on 6 months. I've listened carefully to a number of the speeches, and I, like many others, would like it to have been even more frequent, but I accept that that is a reasonable compromise. There are some issues that I'd like assurance from the Minister on when she comes to speak a little later on. Firstly, it is clear, I think, that it is subject to a vote in both houses, but I do think the point that's been made is an absolutely crucial one by the Right Honourable Gentleman, because if it is simply an unamendable motion, then the House is left with the choice of take it or leave it on everything. And the issue there is there could be 4/5 of the bill that we think are achieving their intended purpose and 1/5 that isn't, but we would be left in the position of having to keep everything operational. Now, if the Minister could confirm that the motion is amendable, so we could make clear the bits that we wanted to switch off, I think that would make a significant difference. Even if she gave that as a verbal assurance, it would be a step forward, and I think that might gain some sort of consensus across the House. I'm not saying that will make everybody satisfied, but certainly I think it would be of assistance in trying to move forward on a consensus basis tonight. There's also a carve-out, as I read the government amendment, in terms of devolved matters. Could the Minister also make clear what precisely the position is there? If this House were to switch off powers, does that mean they're automatically switched off for the devolved institutions? Or if there is a power that's been switched on by the devolved institutions, that they then have the power to switch off when they see fit? And in relation to those parts of England without formal regional devolution, that as soon as it's switched off, it's switched automatically for those areas. More widely, we have to ensure that these measures are temporary and that hard-won rights are not lost forever. And there are a number of groups in our society I want to deal with in relation to this. Firstly, in relation to children with special educational needs and disabilities, these are amendments 68 to 71, Madam Chair. And here I would like more reassurance from the government. Clearly, there is a removal in the bill for disabled people's rights to social care and support, and a real concern around that I know many honourable and right honourable members will have received from groups over the weekend. And also around the duty to meet children's educational requirements to a reasonable endeavours duty. And I thank the all-party group on this for raising it over the weekend. Now, of course, there has to be a need for flexibility. There has to be a need to redeploy staff, and we all understand that to be the case. But I do believe there are still reassurances necessary. If we are removing the rights, for example, in the 2014 Children and Families Act, then could we at least look at something which is in the amendments of changing to something like all practical steps that could be taken to ensure that our duty to some of our most vulnerable and youngest people is actually met. In relation to the care sector, where there have also been very deep concerns, and I refer to amendments 57 to 63 and new clause 29. Now, most statutory duties relating to social care are being suspended in Schedule 11, and local authorities will only have to provide services deemed necessary to prevent breaches of people's human rights. Now, that's clearly not the vision of social care that anyone in this House would have envisaged when the Care Act 2014 was originally passed. Now, it doesn't prevent local authorities from providing higher levels of care, of course not, but there is no longer any duty to carry out assessments or involve user input in care delivery, local authorities no longer having to assess the needs of carers. These are sweeping changes, potentially downgrading the level of support. Can the government make clear they still expect care to be provided to the highest level possible in the circumstances? This is not some sort of green light to cut back to the minimum that is provided for in the bill. And this has wider issues. There are doctors, nurses, NHS staff and key workers who rely on social care for their family members. That new legal minimum level of support cannot become a default. We cannot have care packages automatically cut back to the minimum, and care levels should never be reduced too far and too fast. Now, there's a series of amendments that I've referred to, and I would push the government on this, can we look at things like reasonable practicability? Can we look at disrupting care as it is in the minimum way we possibly can? And try and at least see, whilst recognising, of course, the pressures on staff, that reductions in care packages will still be a last resort. We know too that there are many, many unmet care needs and people who are being looked after by family members in their own homes where they've been visiting every day. Now, for a start, that unpaid army of carers, I think, deserves deep gratitude from all of us. But what if one of those unpaid carers does need to self-isolate? What will the government look at in terms of protecting those in their homes who will still be in need of care? The government still has to make absolutely clear its value for those who are older, those who are disabled, and our young people who are in need of support. And many, not just constituents, but across the country, disabled rights groups and indeed disabled people have contacted me are very, very concerned about what they see as the scaling back of their rights under this bill. We must protect them as best we can for the duration of the emergency powers, but also make clear that this temporary hiatus does not represent a rolling back of progress over decades. I turn to mental health, Madam Chair, and Amendments 64 and 65. And there are changes to the detention regime, and there's also this restriction where someone can be detained on the basis of a say-so of a single doctor, which clearly is a significant change for a committal, and that's set out as well in Schedule 7. In the first instance, can that be the case only where it is absolutely necessary? Second, can we have no single recommendation from a doctor at a private hospital when the patient will themselves be detained at that particular private hospital? And can we at least seek to adhere to timetables that are already in place? There are powers in the bill on extension and removal of time limits, which clearly no Parliament in ordinary circumstances would wish to pass. But at least if the Minister can give some sort of guarantee that timetables will still be respected as far as possible. I'll certainly give it.
Sure, I've understood this point. And is he also saying that once the immediate crisis is over, anyone who has been sectioned under that regime should immediately be the subject of the existing regime?
Yes, absolutely. And that, in fact, shouldn't just apply in the mental health sphere. If these are truly temporary measures, that's got to apply across a range of measures. And I think... I agree with the Honourable Gentleman. Yes, I'll give it back.
Wouldn't a better way of doing it? I accept that there's going to be a lot of pressure on doctors, and I understand why this provision is being brought in, so you can get one doctor to sign to commit somebody under the Mental Health Act. Wouldn't a better way of doing it would be to get that one doctor to sign it, and then within a certain period of days, somebody else review the case or countersign the actual documentation?
Well, it's a useful and constructive suggestion from my honourable friend, actually. I am in favour of doing all that is reasonably practicable to comply with the existing duty. That's the simple position I think that the government should take. I don't disagree with my honourable friend, actually. I think that's a useful suggestion, and that's why I've also suggested that the single doc should only be where it's absolutely necessary. And even in that case, the point my honourable friend makes is a useful one. I'm sure the government understands the concern there is with regard to these proposals, and I hope the Minister will be able to give some reassurance in relation to them. I want to turn just to the issue of law and order just for a moment. I am grateful, and be grateful if the Minister would pass on my gratitude to the Security Minister, who's spoken to me mostly from home, where he is self-isolating at the moment, on a number of provisions. They're in clauses 21 and 22 of the bill, and it's around the appointment of temporary judicial commissioners and changes to urgent warrants in the bill on investigatory powers. There's also an additional measure with regard to data retention, which I hope the Biometrics Commissioner, I understand, is in support of it, but I hope he'll be able to comment on and deal with those provisions in the next few days. I also understand that with the temporary judicial commissioners that action will be taken to ensure they receive the appropriate training, but clearly it's going to have to be done on a remote basis. but it's important, firstly, that we maintain existing standards as far as possible. And secondly, with the measure on data retention, which I know is an emergency power, of course we don't want data on people who may be wishing to do us harm to simply disappear because somebody wasn't available to carry out the national security determination. But at the same time, we must say, as indeed the Honourable Gentleman did in relation to the last point, that this can only be a temporary measure and we must return to the existing deadlines as soon as we can. In relation to courts and tribunals at clauses 51 to 55 of the bill, clearly we must look to live links and audio technology, but we must try to secure justice in each and every case. We cannot either allow any court user to be in danger of being transmitted the coronavirus. And any court hearing that does take place, the Lord Chief Justice has said today no new jury trials, but clearly there'll still be some jury trials, some of them fairly long term, that are ongoing. Every step must be taken to ensure that social distancing is imposed by the judges in those courts. And whilst all members agree on following advice about self-isolation, in the field of domestic violence, it can create a situation that is favourable to abusers. So where our courts are functioning, domestic violence must remain a priority for those courts to deal with. I'll give way to them.
Note that in Spain, where this has been considered, the government is running a scheme where if an individual goes into a pharmacy and asks for a mask 19, they have used as the code, they're then referred to a domestic violence unit for assistance. I was wondering whether the government in our country had thought of the same.
Well, this debate has been carried out in a constructive spirit, and I hope the government listens to all the suggestions that are put forward, but it is a real concern. If this emergency lasts, which it is going to, I'm afraid, that if people are put in situations where they are close to their abusers, we have to still have some sort of safeguards in place, particularly in our courts system. Our prisons cannot become laboratories for transmission either, neither can our immigration detention centres, which is something I hope that the Paymaster General will pass on to the Home Secretary. The issue of burial has been one that clearly has caused great controversy, and I know that the Right Honourable Lady has been one of the people who has come up with the final version of the wording on the legislation, and I do thank her for the effort she's made in relation to that. I mean, this issue is clearly of vital importance for Muslims, for those of the Jewish faith. Clearly, they need to be in a position where we, as far as we possibly can, respect their rights in terms of burial. I think that the amendment the government has put forward is much stronger now in terms of the wording, and I welcome that. But I think the government can also do something else in terms of its communication with local authorities as to how it wants that to be interpreted in the days and weeks ahead. I'll give it to Honourable Friend.
Member for giving way. Would he agree with me that members have in this House raised the issue of having a 100% guarantee that nobody will be cremated against their wishes would also be very welcome?
Yes, and I really do congratulate my honourable friend on the work that she's been doing in recent days in this, and it's been most welcome, and I'm pleased that the Minister has listened to the campaigning work that she's done, and I hope the Minister will be able to give reassurance on that. Madam Chair, in restricting freedoms, and there are quite frankly draconian restrictions of freedom in this bill, on mass gatherings, on closing ports and borders, detention powers on potentially infectious people, which I read as applying to children and adults in the bill. The government must do only what is necessary and proportionate. And we must be very wary as well because of restricting the right to protest, because we are actually restricting the right...
Trying to avoid doing this, but while he's been on his feet, it seems the Prime Minister's heard the call of the opposition front bench earlier. It's widely reported online that the Prime Minister has announced that people can now only go out to shop for basic necessities, to exercise once a day, for any medical need or to provide care, and to travel to and from and do essential work. So I think that our restrictions are now very substantially constrained, and it may help him as he makes his speech.
I'm always grateful for updates on the rolling news, and I'm grateful to the honourable gentleman. It must be a rare example of where a shadow minister called for something at the start of a debate and it's actually appeared before we've actually finished the debate. The Prime Minister is responsive on that, if nothing else. Proportionality and necessity still applies, even in this particular situation. And I think that as we talk about detention powers for potentially infectious people, including children in isolation facilities, this is clearly something that's going to have to be implemented in a sensitive way. Whilst it is necessary to postpone elections, as set out in Clause 57, we still have to do all we can to maintain our democracy, and I welcomed the Speaker's statement setting out any moves that we can do to vote in a different way and operate in a far more digital and remote way than has been the case in the past. I'll turn now to new Clause 4 and the issues that are raised in that, which is quite simply that if you are asking people to sacrifice their freedom to stay at home, to subject themselves to the measures that the Honourable Gentleman for Wickham set out, then they must have their basic means of living catered for as well. And there are some specific measures that are in the bill. At Amendment 74 to 78, lowering of the threshold for eligibility for statutory sick pay, and its extension to the self-employed and its uprating is at new clauses 32 to 34, all of which I would commend to the Minister. Before I move to some of the other economic measures, particularly in the Government's new amendment, I would just refer to new clause 35 as well. A number of honourable and right honourable members on all sides have raised the issue of access to personal protective equipment. New clause 35 really does set out the importance of that to the opposition, where it would be defined as part of the Minister's role to make sure that's provided to everybody who needs it. That's the imperative the opposition puts on that. I hope the government will do all it can to ensure that there isn't a person in this country who doesn't have the personal protective equipment that they need to keep all of us safe.
To him giving way, I'm carrying on in the context of my honourable friend Wickham in terms of running rolling news. But one of the things, of course, we need to provide is good healthcare. And there's just been published the new NICE guidelines. The new guideline on critical care states that all patients with confirmed COVID-19 must be assessed on the basis of frailty when healthcare professionals are making decisions about whether to admit a patient in need to critical care. Now, it's being interpreted by a large number of mental health organisations as potentially excluding people with learning disability and so on. So will you make the point on the behalf of the opposition that we need equality of access to healthcare as well as equality of access to all the other things he talked about?
I certainly wouldn't disagree with the Right Honourable Gentleman on equality of access to healthcare. He's absolutely right about that. I'm getting worried about how many points I've agreed with him on in the course of this debate, but I certainly agree with him about... I'll give way to him.
I do think the point that's just been made is an absolutely critical one, and I can give my right honourable friend that absolute reassurance. The government clearly has an advisory committee, ethics committees, but also these judgments are made by healthcare professionals. They make these types of judgments in the course of their work, but obviously the period that we're going to be entering is extremely intense. But clearly, a criteria they would look at would not be about someone having a learning disability. And I know this from the exercise, the pandemic exercise that my honourable friend, the member for Winchester, mentioned earlier on. I've had experience of that. I can absolutely assure him of that point.
I'm grateful to the Minister for that intervention. I just want to turn to new clause.
I'd like to thank my honourable friend for giving way and for the very important points he was making. I just wanted to on that point, to emphasise that the equality of access to healthcare must apply surely to our excellent healthcare workers, and that some concerns have been raised with me that healthcare workers are receiving different advice from their national health service trusts to the ordinary working people, particularly when it comes to isolation, when there are symptoms at home. And as one person put it to me, you know, the applause and support for healthcare workers is all very well, but they also want to know that their health and well-being is considered just as important, if not more so, than everybody else. And would you agree?
It absolutely is just as important, and I'm grateful to my honourable friend for that intervention. I'll turn to new clause 16, Government New Clause 16, which increases the top threshold for the level of assistance that can be given to industry for the purpose of the economic crisis. Now, I welcome that proposed change. The government must do what it can to prevent an economic disaster. However, I would also ask that the government structures financial assistance to ensure government bailouts support the workforce, the sustainability of the company and the wider national interest. So perhaps the Minister can confirm, or indeed subsequently confirm, the government will attach restrictions on areas such as staff retention, dividend payouts, share buybacks and executive remuneration for any company receiving financial assistance, and if the government is seeking equity, stakes in those companies which receive significant assistance too. There's also the issue of renters, in respect of which the government has tabled a new clause. And there is real concern about this. It was set out by the member for Croydon Central in the course of the second reading debate. But there is a concern about the Prime Minister and his promises to the country's 20 million renters to protect them from evictions, because it does not seem to be an evictions ban, which is what the opposition has argued for and we understood was promised by the Prime Minister. The legislation does not seem to stop people losing their home as a result of coronavirus, just gives some extra time to pack up the bags, it appears. Now, it does, in a sense, make us wonder why the government is not willing to make a very simple change. I understand my honourable friend, the member for Wentworth and Dearne, wrote to ministers to give them the legislation that would provide the protections, banning evictions and suspending rental payments beyond the crisis. There's already welcome help for homeowners. I hope the government will look again at its promises to renters. We do not need this public health emergency to become a crisis of housing and homelessness as well. Madam Chair, as the government disturbs people's way of life, it must also sustain everyday existence, and people are anxious about sustaining themselves through this difficult time. There are millions of self-employed people not covered in the way they should be in the measures set up by the Chancellor. I think a number of colleagues on all sides of the House have raised it. I give way to my honourable friend.
I'm grateful to him for raising the challenge faced by self-employed people. 4.7 million people quoted by the Federation of Small Business. And he's right, members, he's raised it. I was sent a screenshot of a claim being made by somebody who's self-employed this afternoon. It said that there were 33,383 people ahead of them in the queue to use the claim section of the website. I'm sure he will agree that this is a very worrying sign of the ability of the system to cope.
I appreciate the honourable gentleman's making a very important point, and one which every Member of Parliament has received similar emails from their constituents to the one that he has just described. I'm very concerned here that we have only an hour and a bit to go. No, I make no criticism of the honourable gentleman. It's very important that in emergency legislation that the official opposition has a full say in what happens at this point of this bill. But I implore members to just move a little bit faster. And then if everybody makes short points, we'll get all those points in, which we must do. Sir.
Madam Chair, and I say to my honourable friend, he's absolutely right, because one of the issues of making announcements, you then have to have a situation where people can actually access what they are being offered. Now, I've already set out with regard to statutory sick pay and it being too low at £94.25 a week. There are amendments regarding that, and also with regard to people who don't qualify for it, and I urge the government to look at that again. And we must also speak of the businesses laying off workers and not applying for the 80% coverage of wages, which is what they should be doing. There are people who've lost their jobs, but there are also people who need help fast, and it is a concern that 80% wages support applies in the April payroll, not the March payroll. And what that will mean is that money will not be available until the end of next month. I appreciate the scale of this. I appreciate Treasury officials who've done work on it. But as the days pass, more and more people are losing their jobs. Every day matters in terms of bringing that help forward. I've already spoken in relation to renters and mentioned the help for homeowners. With regard generally to businesses, I would say to the benches opposite that grants are better than loans. We don't want to build up a stack of debt. And where the government is relying upon the universal credit system, they must look at the fundamental structural problems in that system, to look at the 5-week waits, and surely we cannot be continuing with face-to-face assessments in the next few months with the scale of this crisis. The government, well, I do what the Honourable Member for Wickham says, but it actually has to operate on the ground as well. And I think we're all hearing various stories of what's happening in the universal credit system. It may well be what the government intends, but that has to be then implemented right across the country. The government will stand beside each and every person to get through this. We, of course, support the principle of doing whatever it takes, but that has to mean whatever it takes for each and every person. And can I say a word, too, about food supplies? It's in the bill, which is clauses 23 to 27, but it's the power to require information. The government does require a strategic approach. The profiteering, the unnecessary stockpiling, all of it, I think we have to ask people to think of others in what they are doing, but also say to the Minister that the government may well need to take a more strategic approach on that and not simply... I'll give way.
Honourable friend for giving way on that point. I'll be very brief. In all emergencies, there is profiteering. And in countries like the United States, where it's been prevalent for a long time, 2/3 of US states now have legislation in place to stop profiteering. We need it here now because it is hitting the poorest communities now.
Absolutely right, Madam Chair, that the issue of profiteering is affecting people now. We heard some examples from across the House in the debate, and clearly that issue needs to be seriously considered. What all this means taken together, and I'll draw my remarks to a close, Madam Chair, because I know you wish other people to come in, but this is an unprecedented change in the relationship between government and Parliament, government and people. Firstly, I would say to the Minister, the imperative is to protect everyone and support them in this time of peril. We ask people to make sacrifices, we must support them too. And secondly, the need for safeguards in this legislation is paramount. I hope the Minister will look in particular at the suggestion I've made around the 6-month review and it being amendable. We are not seeking to divide the House, but we hope and very much say that the government will heed what has been said, and we of course reserve the right to pursue these matters further in the other place.
If everyone takes around 3 to 4 minutes, then everyone will get a chance to come in. Andrew Selous.
Thank you very much, Madam Deputy Speaker, and I won't detain the House long. I rise to move formally new clause 1, which I understand has been agreed in advance with the government, and I will be moving it at the end of proceedings this evening. New clause 1 is very straightforward. It enables the elections to the General Synod of the Church of England to be postponed. So quite recently we postponed all the elections which we are involved with in this House, the mayoral, the local government and the Police and Crime Commissioner elections. But the General Synod is the National Assembly of the Church of England. It is a church which is episcopally led and synodically governed. The General Synod is a devolved body of this Parliament. It is the first devolved body of the Westminster Parliament and has been so since 1919. Synods last 5 years, just as Westminster Parliaments do. The last one was elected in summer 2015 and therefore would expire, Madam Deputy Speaker, this summer, and currently there is no legal power to extend the current General Synod. New Clause 1 provides that power, and it does so by allowing the Archbishops of Canterbury and York to ask Her Majesty to postpone the date of dissolution by an order in Council. That order actually postpones the date of the dissolution of this current Synod for as long as would be necessary, and it does so by dissolving the convocations of Canterbury and York, and the dissolution of those convocations triggers the dissolution of Synod. Now, honourable members may not know what I mean by convocations, but convocations are the historic assemblies of bishops and clergy. They go back to the time of Archbishop Theodore of Canterbury, who was enthroned in 668. So the convocations give this Parliament a run for its money in terms of historical precedent. This may sound a bit dry, but it is important, and it will enable the Synod to deal with important matters like the independent inquiry to child sexual abuse, which the Church takes very seriously and will need to react to that body's findings. It will enable the Synod to move forward the important work on cathedral finances and governance, which also need to be addressed urgently. And just finally, Madam Deputy Speaker, I would say that the Church is fulfilling an important role today. It is caring for the vulnerable. It is reaching out in terms of helping with the delivery of food, working with food banks, working with night shelters, and I commend New Clause 1 to the Government and the House.
Stuart MacDonald.
Thank you very much indeed, Madam Chair. I rise to speak to new Clause 7 together with the new schedule that it introduces, which is new Schedule 1. And can I start by thanking the clerks and other staff for the extraordinary work in processing so many amendments in such a short space of time. The changes that we propose are designed to ensure that the Government's response is truly whole of society, as the World Health Organisation has urged. And they do that by seeking to ensure that nobody is excluded from getting the support that they need simply by virtue of their immigration status. Our immigration and asylum laws and processes, touching as they do upon millions of people right across our country, must be made to help and not hinder the public health response to coronavirus. Because if we let those people who are subject to immigration control down, we are letting the whole country down, and if we fail to protect those people, we fail to protect the population as a whole. The new schedule is in 4 parts. The first relates to Home Office rules on that prevent many people from accessing public funds. Now, many of this group will already be hugely marginalised, including a very significant proportion of the street homeless and destitute. And as matters stand, many more will become destitute because their earnings will stop, or sofa surfing will no longer be possible, and there will be no social security to fall back on. Meanwhile, across the country, many shelters providing the only source of refuge are having to close down, either because dormitory conditions are no longer fit for purpose, or because the brilliant volunteers that staff such centres can no longer undertake the necessary work amidst this very serious crisis. So suspending no recourse to public funds rules would be a first but significant step towards allowing everyone to access the financial support and accommodation that they need to protect themselves. Secondly, Madam Deputy Speaker, the second part of the schedule deals with those who are in immigration detention. At the end of last year, I think there were around 1,600 people in immigration detention, most of them in immigration detention centres, a small number in prisons. But we know from recently published expert advice that detention centres provide ideal conditions for the spread of the coronavirus, and that 60% of those in such facilities could rapidly be infected if the virus got hold there. And we know, in fact, that one woman tested positive for COVID-19 in Yarlswood at the weekend. And of course, the detainee population will include a significant number with underlying health conditions. We also know now that there is no realistic prospect of immigration removals taking place imminently. And imminent removal is, of course, the legal threshold for justifying the detention in the first place. So the clear consequences of these two facts, bringing them together, is that not only is continued detention morally wrong, but it undermines the public health response to the coronavirus outbreak, and it almost certainly is illegal. So we welcome the fact that the Home Office has started by releasing around 300 of the current 1,200 estimate of people in immigration detention, and we ask it to move faster and urgently in getting the other 900 out of there as well. Thirdly, Madam Deputy Speaker, we turn to the issue of the asylum process. Those working on behalf of asylum seekers are concerned at the lack of communication with them about what changes have been made to these processes. There was a welcome announcement made about ending the requirement to access or re-access the asylum procedure by attending either Croydon or Liverpool. Yet even this very afternoon, I'm reliably informed that a new arrival in Glasgow was told by Home Office staff to get the bus to Croydon, essentially, to make an asylum claim. And without support from the Scottish Refugee Council, that individual would be street homeless tonight. And that clearly is undermining rather than helping the public health approach. So we need the Home Office to look at all asylum processes and procedures, reporting requirements, interviews, other appointments must all be suspended. We need to look at the extent of asylum accommodation and we need to look at rules around why asylum seekers who do have medical skills are being prevented from working at this particular time. We need to look at asylum support and support for providing accommodation to the destitute and the homeless. Fourthly, Madam Chair, the new clause makes provision for those whose visas are about to run out or have already run out, but who are prevented from travelling home. And I think many members will have been contacted by their constituents who have concerns about people in that situation. There were reports, in fact, today about an 80-year-old Ukrainian woman whose visit visa has just expired, and her solicitor, on phoning the telephone office, Home Office, was told that she should in fact consider driving home if needs be, and clearly asking an 80-year-old woman to return to the Ukraine by car is simply ludicrous. So it's time, and what our amendment suggests is that the government puts in place an automatic extension of leave to remain at least until September or later, depending on the advice that the government is getting from medical officers. Madam Chair, I pay tribute to all those who have pushed the government to accept a more limited time period for the extraordinary powers provided in this bill, including my honourable friend for Edinburgh South West, while at the same time ensuring that there can be an extension with appropriate scrutiny and approval in this House. We lend support to the principles that are behind new Clause 2, the provisions that are in this bill impinging most upon civil liberties that deserve the greatest of scrutiny. Also pay tribute to the honourable member for Bradford West for the work she did with Amendment 66, and we are grateful to the government for listening to her concerns. Finally, every member that has used amendments to prompt the government to go further in its provision of support for workers and the self-employed has our solidarity. The measure announced on Friday by the Chancellor were, of course, hugely significant and very welcome, but we are all being contacted by self-employed people whose costs are not going to disappear in the same way that their incomes will in the weeks ahead. So we look urgently to hear from the Chancellor again about the further support that will be provided. So even if our amendments cannot be accepted by the government today, I hope that ministers will listen carefully to all the constructive advice that has been offered and act upon it urgently.
Yeah. Minister Penny Mordaunt.
Deputy Speaker, I'm going to attempt to answer the points that I didn't answer earlier in second reading in the course of my speech. This bill has been introduced to support public bodies and wider society in responding to a serious emergency. The bill is required as part of a concerted effort across the whole of the UK to tackle the outbreak. And the intention is to get to a position whereby the right people, public agencies in all 4 countries, take the right action as set out in the UK Coronavirus Action Plan at the right time as a result of decisions taken by the 4 UK governments, usually under the auspices of COBRA, using the same powers at the same time in the same way. The action plan sets out the options that can be taken as part of that response. This bill ensures that the agencies and the services involved, schools, hospitals and the police, have the tools and powers they need. They are our front line in our fight against this disease, and they have the right to expect our support for the action that they need to take. This bill provides the possibility for that and for the duration of the emergency. Turning to a point my honourable friend, the member for Windsor, made, we cannot use the Civil Contingencies Act to do this. It is proper that if we have time to bring forward legislation, we do that. And the Civil Contingencies Act, anything that we did under its powers, would only apply for 30 days. And he should have reassurances that other rules that we follow, for example, the military aid to civil authorities protocols, will give him the assurances that he asked for in his speech earlier this evening. I will.
Very briefly, it seems to me that the 30 days was the whole purpose of the Civil Contingencies Act, so that actually the Executive was accountable to Parliament. So if, for example, in a scenario, and I don't suggest this in any way, shape or form, but in a scenario where the government said nobody can travel, Parliament is therefore unable to reconvene. It's that kind of scenario which is why those checks and balances need to be there. I simply say that, but I'm not looking to cause a division or anything like that.
My honourable friend has made my point for me. This is why we need this particular course of action as opposed to relying on the Civil Contingencies Act. Turning to the issue of the 6-month review, and I just want to reiterate for people how these decisions are going to be made in what is an incredibly dynamic situation. Apart from a few parts of the bill, these powers are not live at royal assent. They will be called upon, drawn down, if you like, by the appropriate government in the four nations, because it's obviously appropriate that some of these matters should be decisions for the devolved nations. And they could be applied to very local areas, depending on what is happening in that particular situation. We are therefore ensuring that the support that people need is there, with regular reports and debates in Parliament to ensure proportionate accountability that does not itself make the management of this outbreak harder than it already is. These mechanisms currently include ministers reporting to Parliament every 2 months on how we have used these powers. There will also be a debate after 12 months and a meaningful vote on renewal after 24. We have also listened to people's concerns about the need for periodic reviews of these powers. We are therefore bringing forward a government amendment to this bill that will enable the House of Commons to take a view every 6 months on whether the provisions of the Act need to be reviewed. This will be done within 7 days of each 6-month period if Parliament is sitting. If the House declines to renew these temporary provisions, the Government will ensure that they expire. We will then, if I can just make a little progress, because there's quite a lot that I haven't managed to say at the dispatch box yet. We will therefore be able to carry out the will of Parliament quickly and efficiently, and this mechanism therefore gives the House of Commons the final say on how the powers in this Act are to be used. I note the very pragmatic suggestions my right honourable friend, the member for Howden and Holton Price and Howden, but I don't think that any thing that he says about future legislation or measures that we wish to bring in, or indeed this House being able to express a view, is negated by the way we are setting this out. For each of the 4 countries of the UK, obviously having its own set of laws, and these tools and powers differ to varying degrees in each area. If I can just make a little progress, sorry, I haven't had very much time. Consistency of outcome will be achieved by making a range of tools and powers consistent across the UK, and I will give way in a moment. And this is therefore just one part of the overall solution, but a vital part nevertheless. A 2-year overall lifespan for this Act has been chosen to ensure that its powers remain available for a reasonable length of time, with the option for provisions in the Act being extended by the relevant national authority. A reasonable worst-case scenario for this outbreak is that it could last for over a year, and therefore some of the provisions in the Act bill will need to be in place for up to 2 years. But equally, the bill provides a mechanism for early sunsetting, but we cannot guarantee that 1 year will be enough, nor predict which powers will be required for how long. I'll give way to the honourable gentleman.
I'm grateful to the Minister for giving way. Just very briefly, can she confirm that the votes in Parliament on a 6-monthly basis that are already in the Act will be on an amendable motion?
Well, this comes to the point of that the honourable gentleman wishes to might wish to take part of the provisions and say that they cannot be applied. We do not wish to do that. The whole purpose of this bill is that the powers, apart from ones which are live at royal assent, but the bulk of this bill is at the direction of either the devolved nations or the UK government to respond to a very dynamic situation. We do not wish to call on these powers. We only wish to use them in extreme cases. Some of them we think we will never use, such as the well, there are several we think we never use, particularly looking at food supply and so forth. But we do need, I think, to allow that flexibility in what is going to be an incredibly unpredictable situation. And I think the safeguards we've put in place will allow us to have that flexibility. I'll give way.
Let me give a simple practical example. Let us, one element of this Act, or Bill at the moment, allows the delay of the oversight of the Investigatory Powers Act. It's the case because we have 15 commissioners, only one of whom is less than 70. That's the reasoning behind it. Now, were the government to do something sensible, like appoint 15 deputy commissioners, all under 70, then that would no longer be required. But we know, because we've seen the government before resisting attempts to improve the accountability, and they may want to keep it in. We may want to take it out. It's a precise example. Why can't we do that?
Well, I think that, and indeed in his earlier remarks, my right honourable friend was talking about things that we might wish to do in a year's time and so forth. I don't think any of those things are being ruled out. But what we think is that the extensive work that has been done on this bill, which is only looking at powers that we know need to be enshrined in primary legislation, not other issues and there have been many other issues that colleagues have raised. I don't think that those very practical options are removed from us by supporting this bill today. And I do also want to emphasise this point because in this bill, the government is legislating for areas of devolved competence. And I should underline that the devolved administrations could have legislated to create their own powers through their own primary legislation. However, they have agreed, given the urgency of the situation, that the UK government should do it on their behalf. This bill consequently engages legislative consent motion process for all of the devolved legislatures. The amendment in the name of my right honourable friend, the Secretary of State for Health and Social Care, requires the continued operation of certain key powers contained in the bill to be reviewed every 6 months. Unless the UK Parliament consents to their continued operation, UK ministers would be under an obligation to switch off the relevant powers by way of regulation. This scrutiny process, can I just finish this point? The scrutiny process created by the amendment does not have an equivalent effect in relation to the devolved powers. This is consistent with the devolution settlements. Once these powers have been legislated for in this bill and are exercisable by the devolved administrations, the UK Parliament has no further role in relation to them. It is rather for the devolved legislatures to scrutinise the activities of their ministers. On Thursday, the 19th of March, for instance, Mike Russell, the Cabinet Secretary for Constitution, Europe and External Affairs, made a commitment to the Scottish Parliament that the Scottish Government would institute appropriate reporting on how and when it used these powers of the bill. And if the House will allow me, I just want to turn to the amendments and just set out the government's reasoning. I do sympathise with the intentions of the amendment tabled by the Right Honourable Member for Camberwell and Peckham. While we agree with these in principle, there are a number of technical reasons why I believe the amendment we have brought forward is to be preferred. First, I will give way. I'm just going to very briefly go through the amendments. I know, but honourable members have tabled amendments, and I wish to tell them why we have not accepted those amendments.
Order. We're getting through this, and we're not having interruptions when you're sitting down. Minister.
Thank you, Madam Deputy Speaker. First, in the event that Parliament is not sitting, we think that the made affirmative procedure would impede our ability to manage efficiently the use of these powers. It may be difficult to make an order in Council during a pandemic. It may be difficult to safely convene the necessary Privy Council meeting. A made affirmative instrument can be made more and ensures that there is a vote on the extension of the Act when Parliament returns. Second, it is not clear from the proposed amendment whether the Act can be extended more than once. It is the unfortunate situation that with this pandemic possibly lasting longer than a year, it is essential that we have the flexibility to keep the important measures in this bill in force for longer than a year, where they are needed. And turning to my Right Honourable Friend's amendment, I am also aware of the real public concerns, policy concerns behind this amendment. I should also point out that without Clause 76, we will have no mechanism to extend the life of the bill if it was needed, other than by making further primary legislation. So we could potentially be left without vital measures to protect public health and support essential public services whilst in the middle of the outbreak. Similarly, without Clause 76, we would have no simple means of sunsetting the legislation at an earlier date if it proves to be no longer necessary. Finally, colleagues will wish to note that as drafted, the amendment would impact on the devolved administrations without their consent. I will give way to the honourable gentleman.
To say to the Minister, she's worrying me more and more every sentence that she continues with this, because it very much feels as if the government is intending to drive this through for 2 years, come hell or high water, and to keep all the powers in place for all of that time. I thought that what the government had announced earlier this afternoon was a concession, which was that, namely, in 6 months' time, if the House wanted to strike down some of the individual measures, it would be able to do so. It seems that she's no longer saying that.
I think the honourable gentleman has not understood what I set out at the start, and this is how these powers will be activated. Some of them will be for the UK government with regard to England. There will be, it's absolutely right that it is the devolved nations that are switching these powers on, and it could be in very localised areas. Those decisions will be taken in response to a very dynamic situation, probably in Cobra, and that, having sat round that table and knowing some of the decisions that may be coming down the line, I think that is appropriate. I want to just turn to the honourable gentleman opposite on some of the issues he's raised. I did touch on social care in my earlier remarks. And he is absolutely right. We have to have those measures in place, and I hope that what I said about my honourable friend, the Minister for Social Care, will go some way to address that. And he is absolutely right in what he says about domestic violence and the fact that we have to be alert to the potential for there to be an increase in demand for those services. Turning to new Clause 1, I would like to thank my honourable friend, the member for South West Bedfordshire, for tabling this amendment, and the honourable member for Rhondda for his support for the amendment. As my honourable friend has set out, the purpose of this amendment is to make provision for the postponement of the dissolution of the General Synod of the Church of England. This dissolution is to take place in July and would be followed by an election of the new General Synod over the summer. We support this amendment. It is consistent with the approach the government is taking this bill along with other elections. I just want to turn to other government amendments, and particularly the issue of cremation, which many honourable members have raised. I want to thank in particular for their engagement the honourable members from Bradford West, Birmingham Ladywood, Bradford East, Peterborough, Dudley North, Stoke-on-Trent South, Wickham, Wealden and Meridian. And first of all, I want to set out that the policy that has been developed on dealing with excess deaths has from the start involved all faith groups. And it was the purpose of these provisions is to ensure that people's choices can be adhered to, and also the dignity of the deceased and support services to their family are in place, even in times of great stress. There should be no public health reason or capacity reason why someone who wished to be buried would be cremated. And I hope that is very clear, and I can give the House those reassurances. We have put further measures on the bill. And also, I think that local authority leaders, because clearly it is going to be chief executives of local authorities who will be using these powers if they are ever used, will also in the coming days be wanting to reassure their communities. I'd also like to put on record my thanks to Councillor Sharon Thompson of Birmingham City Council. I will give way to the Honourable Lady.
I thank the Right Honourable Lady for giving way. The actual legislation provision says that it is desirable for a local authority or a public authority to seek the wishes of the deceased person's family or a place of worship if there is no next of kin. Saying that it's desirable to take their views into consideration does not mean that if a local authority or a public authority decides that cremation is going to take place, that means that that will or the desire will not therefore apply, because the legislation as it currently stands. Now, of course, if the government will make an amendment to it, to the fact that very clearly specify that if somebody does not wish to be cremated, they will not be cremated, and that is missing from the bill at the moment.
So we have brought forward an amendment which does give those guarantees with regard to someone's beliefs, someone's religion and their wishes. But in addition to that, I want to stress that it has never been the case that it was ever in any doubt that somebody who wished to be buried would have to be cremated. There is no public health reason, there is no capacity reason why that is the case. We have worked from the off, as I say, with all faiths in producing these guidelines, and the amendment that we have tabled today, which has been again done in conjunction with consultation, I can see no circumstance, and it certainly wouldn't be related to these powers, that somebody would be cremated against their wishes. I don't think I can give any more guarantees than that. It is absolutely not the intent of the policy, and it is certainly not anything to do with practice. I am going to make progress, but I hope, and I thank all members who have spoken to me over the last few days, and in particular the Honourable Member for Wealden, who has also been very helpful to me and Public Health England with regard to additional things we may need to do with funeral services. There are a number of other new amendments that the government is bringing forward. New clause 16 on the industrial development cap, new clause 20 on removing existing requirements for local authorities and councils to hold annual meetings, new clause 24, which touches on, I think, issues that the Honourable Member for Croydon Central raised earlier, suspending new evictions from social or private rented accommodation, and what I said in my previous remarks applies. And new clause 27 in indemnifying returning officers for polls. New clause 79 to 82 on the use of video in extradition hearings, and new clause 55 to 56 on trading standards enforcement, which is for the enforcement of provisions related to gatherings, events and premises, widening the scope for those who can be given powers and bringing proceedings for offences. New clause 23 is concerned with biometrics, obviously a critical tool used daily in support of our national security. This amendment establishes a time-limited power to enable the Home Secretary to make regulations after consulting with the Independent Biometrics Commissioner to extend the statutory retention deadlines for biometrics already held by the police and for national security reasons by up to 6 months. Also, we are tabling an amendment regarding medical practitioners. Yes.
I'm very grateful to the Honourable Lady. Before she moves on the issue of data, I understand that the Biometrics Commissioner will be very soon publishing his assessment of the government's proposal. Does that remain the case?
I will certainly let the Honourable Gentleman know. I am, as he will appreciate, covering several departments. I would not want to mislead him, but I will find out what the timetable is for the Commissioner to publish their report. We are also tabling an amendment with regard to medical practitioners in Wales, which is designed to enable any practitioners who are registered by the GMC on a temporary basis to start providing health services immediately to a local health board. Again, this is another example of levelling up the law currently in England and Northern Ireland that is already in place. And an amendment to regarding the Mental Health Review Tribunal arrangements for Wales, again bringing in line with the situation in England and Scotland. And emergency registration fees for doctors to enable any professionals who are registered under the emergency powers to do so, with the understanding that once the emergency period has passed, their temporary registration status will come to an end. I am happy, as the debate goes on, to answer any questions that honourable members have. Madam Deputy Speaker, as my right honourable friend, the Secretary of State for Health and Social Care, has outlined, the bill contains vital measures to support citizens, protect our workforce and achieve our goals at beating this dreadful disease. I know and thank honourable members for their constructive comments and their attendance today. Certainly.
I'm grateful, Madam Deputy. Just before the Minister winds up, clearly the Prime Minister's made the announcement in the course of my speech, but there's a specific query about whether separated and divorced parents who co-parent can still transport their children between homes and whether that's essential travel. Now, I appreciate the Minister may not know that off the top of her head now, but could she undertake to at least provide clarity on that from the Prime Minister's announcement?
Comments from the honourable gentleman opposite will have been heard, and I'm sure that they will be clarified. But in all of this, whether it has been about key workers, whether it has been about new policy of this matter, of this ilk that has been announced, the objective is to keep people at home, is to keep as many children at home as possible, to keep as many people at home as possible. So again, I would say that that principle would underlie any policy of what is actually essential. The bottom line, as the Shadow Secretary of State outlined in his remarks, is that if we stay at home, we will be helping save lives, protecting the NHS and fighting the virus. And I commend this bill to the House.
Madam Deputy Speaker. I'd firstly like to pay my respects and put my thanks on record on this occasion to our brave NHS staff and the key workers and everyone in our nation playing their part in combating the COVID-19 outbreak, and advance thanks to the police who have now been given extra responsibilities by our Prime Minister this evening to police people's distance and social going out. I'll be formally withdrawing my amendment, Madam Deputy Speaker, because I want to thank the Government for their amendment, which has actually strengthened what I was putting forward and I was proposing. But I believe it's important for me to say a few words on that. I would like to say in this process I've been truly heartened by the cross-party support that I've had from across every bench in this House. It really does demonstrate, at times of crisis, how, when democracy works, it can work and it can respond positively to the concerns out there in the community. So I would like to say thank you for that spirit of unity. This truly is a difficult time for everyone in our nation, and they're not normal times with the emergency bill today. We know how life as we know it will have to change, and it's true that origins of this bill had caused huge distress to religious communities, especially those of Muslim and Jewish backgrounds. Death is a sensitive time for everyone, and losing a loved one is difficult for us all. We all want for our loved ones a dignity in death. And the idea that in extreme circumstances, when capacity issues arise, the deceased would have to be cremated was something hard to bear, especially for those from Muslim and Jewish faith, and whose faith strongly oppose cremation. I further thank the Minister for clarifying and giving the assurances just now, as she has done, that guarantees that nobody will be cremated against their wishes. So I thank you for that. Her for that. The aim of my amendment was that in such difficult circumstances where capacity issues do arise for local authorities, further legal protection is given to consult the next of kin and the relevant faith institutions to provide the added support to protect the deceased from being cremated. I'd like to take this opportunity to thank the members of Ilford South, Wickham, Bedford, Wakefield and Bury South for co-sponsoring my amendment, and over 110 cross-party MPs that formally showed their support on this. And I would like to thank the APPG on British Muslims for the tireless work it did behind the scenes. The community organisations such as the Muslim Council of Britain, MINAB, Wifaqul Ulema, the British Board of Scholars and Imams, the Board of Deputies for British Jews, and individuals such as the member for Birmingham Ladywood who couldn't be here tonight, Qari Asim, MBE, the advisor to the government, Mohammed Shafiq of the Ramadan Foundation, Vikas Hussain, and all those individuals and organisations who have played a huge role silently in the background, influencing and putting in tremendous efforts to work through this process. Madam Deputy Speaker, I've never done a campaign like it in 24 hours, so I have to put my thanks on record for Joseph Hayat at British Muslim TV for doing the 1-minute video, absolutely amazing. But also the contributions made by government and the many in the party opposite. The efforts of Lord Tariq Ahmed ensuring these concerns were seriously recognised, and the role played by my Muslim sister in the House of Lords, Baroness Saida Warsi, in ensuring community nerves were calmed while conversations and negotiations with government were taking place. And I am grateful to the Right Honourable Paymaster General and the Minister for State for recognising the concerns of all religious communities and by taking this on board with the additional amendment the government has put forward on the issue. Finally, I would like to formally thank all of those from faith communities across this country that lobbied their local MPs to support my amendment, and from what I'm hearing some of my colleagues, the inboxes are rather full. And maybe we've lobbied a bit too much. But it does show that in times of crisis, that we, in politics, in Parliament, and indeed as a nation, come together and work together to ensure we support all citizens. From Scotland through to my constituency, Bradford West, right across the nation, faith communities are playing a vital role as the fourth emergency service, providing food, medicine and much needed necessities to those most in need. For example, in my constituency, the Bradford Foundation Trust has developed a coalition of over 50 local businesses and 30 BCS organisations with support from Bradford for Better and supporting our local authority during this difficult time. And whilst faith communities are playing such a vital role in this difficult time, we cannot be that we neglect their rights in death. That would have been a grave injustice. The government amendment recognises those rights and provides the legal protection for the deceased of Muslim and Jewish communities to be shown due regard for their wishes and their faith, to prevent cremation, in some ways clearer and further than my own amendment. It provides a protection for those from faiths where they choose to be buried or cremated as well, and those that actually choose to be cremated also. Therefore, Madam Deputy Speaker, I withdraw my amendment and support the Government on providing the much-needed additions to the bill.
Bob Seeley.
Much indeed, Madam Chair. I'm speaking to new clause 6, and I have put it down to enable quicker action to support island and isolated communities. And I'd like to talk briefly about the clause and ask some questions of the front bench as well. Specifically put, the island is dependent on 3 private ferry firms. If staff from one or more of those ferry firms go ill with COVID-19 and we have an outbreak, there will be very serious consequences for the island. Competition law prevents the firms currently talking, and that is still the case despite 8 days of trying to get it moved. The basics of the clause are that it allows the relevant Secretary of State or the devolved administration to issue directions to allow the ferry firms to talk to each other, to potentially plan and potentially implement joint services for the purpose of resilience, for the provision of food, medicine and other essential goods, and the provision of passenger transportation. Despite the fact that we are an island, we need to stay open because we need food going out and we need food coming in. We need key workers going backwards and forwards, and we need people to continue to go to life-saving medical treatment in Southampton and Portsmouth. And if the ferry firms fall over, we can't do that. They are a true lifeline, and I think people don't realise that an island separated from a landmass without a fixed link, you need ferries. The Department of Transport understands the lifeline nature of our services and are doing a good job. BEIS has not yet acted on it. I understand that officials are working up a SI, delegated legislation, and apparently there is a letter coming from the Secretary of State at some point. The CMA says it won't take action, but as of this evening, and I'm being texted by my ferry firms as we speak, they are still not willing to talk because for compliance purposes, they need a letter from a government minister and a Secretary of State. What is critical here, and I want ministers to understand, is that I don't blame government. I know how stressed you are across the provision. This clause is designed to be helpful because it means effectively government diktat, a fiat, means that you will allow, the government will allow the ferry firms to talk to each other, avoiding much of the bureaucracy which seems to take place at the moment by getting a statutory instrument in place. So I would be delighted if the government would either accept new Clause 6 in its entirety, and I thank the Bill Office very much for their work, or if it is not going to, can a minister reassure me this evening that a Secretary of State will write a letter with the assurances that I need? Can somebody give me the assurance that the delegated legislation will be put down? And can somebody reassure me on medical supplies? For example, a consultant at my hospice today contacted me to say, if we run out of morphine on the island, can we give out other opiates? Because of the change in, because of a glitch in the system, nurses can give out morphine, but they can't give out other opiates. Thank you. Wilson.
Can I just answer this point, because you made this point during second reading, and I have checked the issue. The Department of Health and the NHS England are looking at this precise issue of being able to authorise other healthcare professionals to administer other opiates, and I am assured by my honourable friend that he will very shortly be getting a letter from the Secretary of State with regard to the Isle of Wight ferry issue. I do not know its contents, I am not briefed on that, but his lobbying has worked.
Good. Geoffrey Donaldson. Really have to be really quick now. I hope the honourable gentleman will do 3 minutes. Geoffrey Donaldson.
Thank you, Madam Deputy Speaker, and I will be brief. I speak to new Clause 5 in my name. As we have already heard, there have been calls from across the UK to look out for the members of our society who are elderly and vulnerable. And I wish to add my voice in saying that the victims of modern slavery must be addressed urgently. I've spoken to the Minister's colleague earlier today, and I've received assurances from the Minister. I welcome the fact that the Department is working closely with the Salvation Army, who are the contractor dealing with these issues, and I have faith in the Salvation Army that they will do the right thing and look after these people. But I think it would be important to issue guidance on this when possible. I recognise the Department is pressed and officials are working hard on this, but I really do hope that the government will be able to address concerns around this area, particularly to ensure that the victims of modern slavery continue to receive the special payments, that where their key worker is off ill due to the virus, that someone else will liaise with them and keep in contact, that there are arrangements around the need to protect them when they are in shared or cramped accommodation, as is often the case, and that the government will look into these matters and ensure that these very vulnerable people who are already victims are not further victimised or isolated as a result of a lack of capacity to deal with the issues and concerns around this very vulnerable group at the moment. So we're looking for that assurance, and I hope that the government will be able to issue guidance along the lines that I've suggested in my new Clause 5.
Steve Baker.
Madam Deputy Speaker, I stand first my honourable friend from the Isle of Wight. We cannot neglect his constituents in the island. I fear it's gone on for far too long, and I want to say sorry to him that we didn't weigh in behind him sooner. It's just got to be dealt with, and I know my right honourable friend, the Minister, knows. Secondly, I'd like to pay tribute to the honourable lady for Bradford West. She's done an absolutely fantastic job in the last 24 hours. It's been a real privilege to work with her to secure what I think is a fantastic result. At a time like this, matters of the hereafter are very close in everybody's thoughts. As they sometimes say, there are no atheists in a foxhole, and I certainly wouldn't want to stand by and see my constituents cremated against their wishes, nor indeed would I want to see people buried against theirs. So I really want to congratulate her. She did a fantastic job, and she did it in a wonderful cross-party spirit, which has done a lot to reinvigorate my faith in this place and what we can achieve together when we put our constituents first. So well done to her. I want to pay particular attention to the provisions relating to the expiry of these powers, Amendments 1 and 6 and Government New Clause 19. When I got into politics, it was with the purpose of enlarging liberty under parliamentary democracy and the rule of law. And when I look at this Pandora's box of enlargement of discretion and extensions of powers, I can only say what a dreadful thing it is to have had to sit here in silence and nod it through, because that was the right thing to do. But my goodness, between this and the Prime Minister's announcement tonight, what have we ushered in? I'm not a good enough historian to put into context the scale of the infringement of our liberties which has been implemented today through the Prime Minister's announcement and through this bill, which we are enacting with only 2 hours to think about amendments to this enormously complicated bill. I mean, I could speak for the time I have available several times over just on the provisions relating to the retention of DNA, which we dealt with in the Protections of Freedoms Bill. I see from the expression on my right honourable friend's face that she understands the anguish. She probably knows it better than any of us that we're all going through in delivering this. We are, perhaps let me be the first to say it, implementing tonight and in this bill at least a dystopian society. Somebody will call it totalitarian, though I don't think that's quite fair, but it is at least dystopian. It is implementing a command society under the imperative of saving hundreds of thousands of lives and millions of jobs, and it is worth doing. And by God, I do hope that the Prime Minister has a clear conscience tonight and sleeps with a good heart, because he deserves to do so. Because libertarian though I may be, this is the right thing to do. But my goodness, we ought not to allow this situation to endure one moment longer than is absolutely necessary to save lives and preserve jobs. So that's why I have said that while I welcome New Clause 19 to give us a 6-month review, I would very much urge upon my honourable and right honourable friends and the Prime Minister sunsetting this Act, as it will become, no doubt, at 1 year, because there is time to bring forward further primary legislation. If it comes to late autumn and we can see, and God help us if it's true, because I fear for the economy and the currency, but if come the autumn it's clear that this epidemic, this pandemic continues, then there certainly is time to bring forward further primary legislation to properly scrutinise the provisions of carrying forward this enormous range of powers. I mean, every time I dip into it, I find some objectionable power. There's not enough time to do it. But I've done it there. I can glance at it and see objectionable powers. There would be time to have several days of scrutiny with a proper piece of legislation, easily in time for March, April 2021. And I just implore to my right honourable friend, for goodness sake, let us not allow this dystopia to endure one moment longer than strictly necessary.
Roshanara Ali.
Thank you, Madam Deputy Speaker. And I want to start by concurring with the Honourable Member for Wickham, because while this is absolutely the right thing to do to support this legislation, we must make sure that the scrutiny remains and that his warnings are heeded by the government and the warnings of those of us on this side of the House. Can I start off by setting out my deepest sympathies for those who've already lost their lives in my constituency, but also around the country, and also pay tribute to the emergency workers around the country who need our support right now, but also need direct, immediate action from the government to give them the PPE equipment that they are lacking. Madam Deputy Speaker, here in London, we're at the front line, and in my constituency and around the city, these are densely populated areas with huge amounts of overcrowding, intergenerational living, high health risks, which means we face ahead of the challenges that are spreading around the country, we face challenges now. And in the last week, we have had several reports of major problems in my constituency. The Royal London Hospital doctors have already said, have described, clinicians have described the situation like a war zone. And others have said that already they're having to make decisions that will be devastating, choosing between who to save and who dies, and the collateral damage that they speak of. Doctors having to order equipment online. So I want to echo the importance of making sure that PPP equipment is sent to people immediately. Care home outbreaks that are of great concern around the country, vulnerable people at risk. So I wanted to just raise a few questions for the Secretary of State. The first being that we need to make sure hospitals like the Mildmay Hospital doesn't close on the 31st of March, as is still being planned, which is utterly scandalous to see AIDS sufferers who need care being thrown out of hospital into the NHS when the NHS won't be able to cope. I also asked the Secretary of State to make sure that councils like mine get the help they need, because they're at breaking point already. My discussions last week have highlighted just how difficult it is for them to be able to feed some of the poorest people in the country. And other councils will have the same problem, with millions living in poverty, and this is going to trap them into complete devastation. We need action now for councils. GPs are reporting that they're running out of inhalers in other constituencies that my colleagues have fed information to us to pass on to government ministers. And the government needs to act to ensure that the 1 million or so undocumented workers who will continue to work if they are not stopped and if they are not given an amnesty is going to be a risk to public health, and I hope that the government takes that on board. And I imagine that this is not something that's been addressed yet, because that is also a public health emergency. On burial, I welcome what the government is doing, and I congratulate my honourable friend for her leadership in this. But we need to make sure local authorities work together to ensure that the burial facilities are available. Finally, Madam Deputy Speaker, there are many thousands of people who are going to be stranded in other countries. We need an evacuation plan in the light of the Prime Minister's remarks to get them back to our country, back home safely. I thank the Minister for her work and the government's work. Thank you.
Richard Fuller.
Thank you, Madam Deputy Speaker. I rise to welcome the government's new clause 19 and to support in spirit the amendments of my right honourable friend, the member for Halton Price and Howden. Madam Deputy Speaker, 2 years was unconscionable. 6 months is livable. 3 months would have been better for this draconian bill. But we need that reduction because it provides a much more reasonable basis not only to assess the restrictions, the unparalleled restrictions that may be imposed on people, but also to enable an alignment of timeframes between our medical responses and the impact on the economy. And I want to make some comments on that briefly, Madam Deputy Speaker, on this issue of balance between those two features, because at the moment we are passing this legislation when there are a monopoly of voices pointing in one direction. Do more, go faster, impose more restrictions. What we need is an environment of balance to understand that all of those measures, as we pursue with all of our hearts and our heads the medical cures, the support for our NHS workers and the care for those who are sick, that they have consequences. Consequences for our economy, consequences for the mental health and well-being of our citizenry, and consequences which are as yet unforeseen. And so a restriction in the timeframe for this legislation is absolutely crucial. Embedded in the phrase, whatever it takes, is a blank check that has to be paid at some point. It may not be favourable in public discourse to talk in that way. It may appear callous to talk in that way, but at some point in the future, a reckoning for the decisions that have been made in response to this medical crisis and the economic consequences for families across this country will come. And whether the government likes it or not, in the bill that it's passing today, in new clause 19 that it passes today, that will become the vehicle upon which government is held to account. So let me give the Minister some questions that she might to pass on to Minister to think about what we might be discussing in 6 months. First of all, we need to set a clear goal. Second of all, we need to outline what are the reasonable benchmarks to show, measurable benchmarks, that we are making progress in achieving that medical goal. We need to explain what is the exit strategy for our medical plan, and the government in 6 months or at other times has to say what is the plan, or what are their considerations have they made if the approach to secure those medical goals have not been achieved, and what are the costs and consequences for the economy. There are no easy answers here, of course, but as we pass this legislation this difficult time, Madam Deputy Speaker, it is important that we understand we will have to do that evaluation in a mood of much more balance than we can today.
Munira Wilson.
Thank you, Dame Eleanor. I rise to speak in support of the amendments and new clauses tabled in my and my Liberal Democrat colleagues' names. Of course, we are not seeking to divide the House, but keen to put on record our concerns. In the interest of time, I wanted to focus on two areas in particular: social care and the self-employed. Now, there's unanimity across this chamber about that these exceptional times call for exceptional measures. I find it very strange to find myself in violent agreement with the Honourable Member for Wickham and indeed the Right Honourable Member for Holton Price and Howden. And in these difficult, challenging times, these measures must be proportionate, strictly time-limited and with appropriate safeguards in place. I therefore welcome the Government's concession that the bill will be reviewed every 6 months, although our amendment sought to do so every 3 months and to have a full review by both houses. And I note the concern that's been expressed about whether we can amend and disregard parts of the bill at each review, and I hope that will be taken on board by ministers. This bill gives the government sweeping powers over our civil liberties and also impacts how we look after the most vulnerable in our society. And that's where I wish to turn to our Amendment 14 and new Clause 14. Social care provision is inextricably linked to NHS provision. They're two sides of the same coin. Fast and safe discharge into the community is essential to free up hospital capacity for those who are critically ill. But the system is already so stretched to breaking point that many feel that standards of care are already on the borderline. And so our concern is that with this bill seeking to potentially lower standards, they could be raised to a very dangerous level, putting the many elderly and disabled people of all ages at risk. And although the Secretary of State told me earlier that these provisions seek to do the opposite in terms of enabling local authorities to prioritise, I do fear that the only safeguard being the Convention on Human Rights could result in many of these vulnerable people being harmed. They must not be cast by the wayside in this crisis. This bill is here to tackle one serious threat, but it is potentially raising another threat amongst the most vulnerable in our society. The Chancellor made it clear that he will give the NHS whatever resource it needs in dealing with coronavirus. Surely the same commitment must be given to social care as the sister service to the NHS, and Amendment 14 seeks to address this very point. Turning now to new Clause 13 on statutory self-employment pay, the Chancellor has rightly stepped in with a far-reaching set of economic measures to support the millions of people across this country whose livelihoods and incomes are being decimated by this pandemic. As many members from all sides have said today, the 5 million self-employed and freelancers feel that they have been completely overlooked. With over 11,000 self-employed in my own constituency, I, like many others, have been inundated with hundreds of emails from childminders to events organisers to tradesmen and women to musicians to those who work in the TV industry, begging me for action. Many have seen their income dry up overnight with no prospect of when they may be able to work again. New Clause 13 seeks to provide for the self-employed on the same terms as the wage guarantee scheme for employees. I fully understand that the mechanism for delivering such a provision is not straightforward for government. However, let's not let the best be the enemy of the good. The situation is urgent for millions of people across this country who are struggling to put food on the table for their families and keep a roof over their heads right now. In 2008, the government stepped in to bail out the banks. Now it is time to do the same for everyone whose livelihood is at threat, whether employed or self-employed. So at this time of national crisis, of course, we support this bill with an extremely heavy heart. But I implore ministers to take on board our grave concerns, particularly around care of the vulnerable and providing for the self-employed. And please let us make sure that not one single provision in this bill is in place for a minute longer than it has to be.
Jim Shannon.
Thank you, Madam Deputy Speaker. Very quickly, can I first of all thank the Government for their contribution. Can I also highlight the plight of the NHS staff who do not have enough protection gear. Just can I ask the Minister to ascertain whether any factories can be used to reduce this in the interim. I've also been approached by under new clause 3 and 4 in relation to those who have an HGV on their licence could step in the drive supplies, but due to a DVA technicality are precluded from doing so. Can we lift the restriction legally, which is only a technicality, and allow him and others to step into these days? The Shadow Minister referred to the 80% wages being available by the 1st of April. Can I implore that money to be available in March? And can I also make the comment in relation to new clause 4 as well, and factories producing the food and the medication that we need? I think of TG Aikens and Cumber producing the colostomy bags. They cannot go home. What help is in place for them? Those who are self-employed, having electricians, employers under new clause 9 and 11, with no premises as their jobs consist of them fixing electrics in homes and businesses, yet can they access a business grant? Cafe owners, self-employed, asked to close their own businesses and their staff are getting a wage that they are not. What's being done to help them? Those who have shops stocking cleaning and basic groceries, who are delivering free of charge cleaning products, potatoes, milk and other things under new clause 9 and 11, what help is for them and their staff? The business grant will only pay it for his rent for a few months. How does he feed his 5 children? And the last one, self-employed people get a basic wage when they're telling them to close and when they cannot reasonably stay open. Again, I would ask what has been done for those who are self-employed. Self-employed coaches on the new clause 8, education, day-to-day life to the mental health and physical well-being of our children. And what about agency staff working in colleges and civil service? Do they qualify for the 80% wages that they should under new clause 9 and 11? Thank you.
Helen Hayes.
Madam Deputy Speaker, time is very limited this evening, but I want very briefly just to return to an issue that I did not have time properly to probe during the second reading debate, and that is this question of people with learning disabilities and autistic people whose rights are at risk as a consequence of this bill. As someone who's campaigned on the Transforming Care agenda and the government's failure to implement it over many years, there are people in the autism community and those who support people with learning disabilities who are very worried that this bill could result in further unnecessary admissions to hospital. This could happen both indirectly through the withdrawal of support for autistic people and people with learning disabilities, resulting in higher incidents of crisis, and it could happen directly because of provisions in the bill which make it easier for people to be detained. Any institutional setting where large numbers of people live together has increased risk of COVID-19 spreading. Families who've battled for years to get their loved ones out of hospital are very frightened that this bill could mean their loved ones end up being detained once again, and that if this happens, they may also fall victim to COVID-19. So I just want to seek once again assurance from the Secretary of State that for those families, that their loved ones will not end up once again in settings which have been traumatising in the past and where abuse has taken place as a consequence of this bill.
Kevin Jones.
Thank you. Could I ask the Minister to look again at the provisions in this bill around the Mental Health Act? I accept reasons why one doctor to free up capacity may be relevant, but could I ask it to look at provisions whereby you could get one doctor to sign and then that be reviewed by a second doctor within a day or in a very short time period? Without that, I think some very vulnerable people could be left unprotected. Could I also ask, under the provisions of the elections, which I accept the reason why they've been postponed, positions, for example, like County Durham, where we have a PCC by-election in May because of the police commissioner dying, the current acting police commissioner is only in there for 6 months. Is there provision in it to extend his period for another up to another 12 months, which will be needed because the elections will not take place next year. And lastly, can I just urge you and urge the Treasury to do something for self-employed people?
Yasmin Qureshi.
Thank you, Madam Lane. I asked the Minister earlier about the issue about cremation, and I know the Minister gave me the assurance that no one will be cremated or buried against their religious wishes. However, with all due respect, the assurance of the Minister is not the same as the actual provision in the bill. The bill currently still talks about it's desirable to ask the views, it's desirable to do so. Unless the body of the bill actually states that no one can be buried or cremated against their religious wishes, the law at the moment as it stands is not compulsorily, it is still only advisable, or it is only something to consultation. And the reason I say that is because currently the legislation is that you cannot cremate without a consent of the person. Precise reason that the government was introducing this legislation was so they could actually circumvent this. By putting the particular provision, by saying it's desirable, in a court of law, desirable is not the same as saying that you must or you cannot cremate or bury somebody unless they wish. That is the kind of guarantee that's required in the body of the bill.
Order. Under the terms of the order of the House of today, I must now put the questions necessary to bring proceedings in committee to a conclusion. The question is that Clause 1 stand part of the bill. As many as that opinion say aye. Aye. The contrary, no. The ayes have it. The ayes have it. The question is that Clauses 2 to 10 stand part of the bill. As many as that opinion say aye. Aye. Of the contrary, no. The ayes have it. The ayes have it. We now come to Clause 11. Minister to move Government Amendment number 20. Formally, the question is that Amendment 20 be made. As many as that opinion say aye. Aye. Of the contrary, no. The ayes have it. The ayes have it. The question is that Clause 11, as amended, and Clauses 12 to 30 stand part of the bill. As many as that opinion say aye. Aye. Of the contrary, no. The ayes have it. The ayes have it. We now come to Clause 31. I call the Minister to move Government Amendments numbers 21 and 22 formally. The question is that Amendments 21 and 22 be made. As many as that opinion say aye. Aye. Of the contrary, no. The ayes have it. The ayes have it. The question is that Clause 31, as amended, and Clauses 32 to 36 stand part of the bill. As many as that opinion say aye. 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 Of the contrary, no. The ayes have it. The ayes have it. We now come to Clause 37. I call the Minister to move Government Amendment number 40 formally. The question is that Amendment 40 be made. As many as that opinion say aye. Aye. Of the contrary, no. The ayes have it. The ayes have it. The question is that Clause 37 as amended and Clauses 38 and 39 stand part of the bill. As many as that opinion say aye. Aye. Of the contrary, no. The ayes have it. The ayes have it. That's a hay fever cough. Nothing else. We now come to Clause 40. I call the Minister to move Government Amendments number 41 formally. The question is that Amendment 41 be made. As many as that opinion say aye. Aye. On the contrary, no. The ayes have it. The ayes have it. The question is that Clause 40 as amended and Clauses 41 to 51 stand part of the bill. As many as that opinion say aye. Aye. On the contrary, no. The ayes have it. The ayes have it. We now come to Clause 52. A Minister to move Government Amendment number 79 formally. The question is that Amendment 79 be made. As many as that opinion say aye. Aye. Of the contrary, no. The ayes have it. The ayes have it. The question is that Clause 52 as amended and Clauses 53 to 57 stand part of the bill. As many as that opinion say aye. Aye. Of the contrary, no. The ayes have it. The ayes have it. We now come to Clause 58. I call the Minister to move Government Amendment number 26 formally. The question is that Amendment 26 be made. As many as that opinion say aye. Aye. Of the contrary, no. The ayes have it. The ayes have it. The question is that Clause 58 as amended and Clause 59 stand part of the bill. As many as that opinion say aye. Aye. Of the contrary, no. I think the ayes have it. The ayes have it. We now come to Clause 60. I call the Minister to move Government Amendments numbers 27 to 29 formally. The question is that Amendments number Numbers 27 to 29 be made. As many as that opinion say aye. Aye. On the contrary, no. The ayes have it. The ayes have it. The question is that clause 60 as amended and clauses 61 and 62 stand part of the bill. As many as that opinion say aye. Aye. Of the contrary, no. The ayes have it. The ayes have it. We now come to clause 63. I call a minister to move government amendment number 30 formally. The question is that amendment number 30 be made. As many as that opinion say aye. Aye. Of the contrary, no. The ayes have it. The ayes have it. The question is that clause 63 as amended stand part of the bill. As many as that opinion say aye. Aye. Of the contrary, no. The ayes have it. The ayes have it. We now come to clause 64. I call a minister to move government amendments numbers 31 and 32 formally. The question is that amendment 31 and 32 be made. As many as that opinion say aye. Aye. On the contrary, no. The ayes have it. The ayes have it. The question is that clause 64 as amended and clauses 65 to 73 stand part of the bill. As many as that opinion say aye. Aye. Of the contrary, no. The ayes have it. The ayes have it. We now come to clause 74. I call a minister to move government amendments numbers 33 and 23 formally. The question is that amendments numbers 33 and 23 be made. As many as that opinion say aye. Aye. Contrary, no. The ayes have it. The ayes have it. The question is that clause 74 as amended stand part of the bill. As many as that opinion say aye. Aye. The contrary, no. The ayes have it. The ayes have it. We now come to clause 75. I call a minister to move government amendments numbers 34 and 24 and 47 formally. The question is that amendments numbers 34 and 24 and 47 be made. As many as that opinion say aye. Aye. Of the contrary, no. The ayes have it. The ayes have it. The question is that clause 75 as amended and clauses 76 to 78 stand part of the bill. As many as that opinion say aye. Aye. Of the contrary, no. The ayes have it. The ayes have it. We now come to clause 79. I call the minister to move government amendment number 37 formally. The question is that amendment 37 be made. As many as that opinion say aye. Aye. Of the contrary, no. I think the ayes have it. The ayes have it. The question is that clause 79 as amended and clauses 80 to 82 stand part of the bill. As many as that opinion say aye. Aye. Of the contrary, no. The ayes have it. The ayes have it. And we now come to clause 83. I call the minister to move government amendment number 18 formally. The question is that amendment 18 be made. As many as that opinion say aye. Aye. Of the contrary, no. The ayes have it. The ayes have it. The question is that clause 83 as amended and clause 84 stand part of the bill. As many as that opinion say aye. Aye. Of the contrary, no. The ayes have it. The ayes have it. We now come to clause 85. I call a minister to move government amendments numbers 44, 80, 25, 48 to 50, 38, 39, 17, 81, 35, 36, 42, 45, 72, 43 and 73 formally. The question is that amendments numbers 44, 80, 25, 48 to 50, 38, 39, 17, 81, 35, 36, 42, 45, 72, 43 and 73 be made. As many as that opinion say aye. Aye. On the contrary, no. The ayes have it. The ayes have it. The question is that clause 85 as amended and clauses 86 and 87 stand part of the bill. As many as that opinion say aye. Aye. Of the contrary, no. I think the ayes have it. The ayes have it. We now come to government new clauses. I call the minister to move formally that government new clauses, new clause 15 to new clause 26, new clause 30 to new clause 31 be added to the bill. The question is that government new clauses 15 to 26, new clause 30 and new clause 31 be added to the bill. As many as that opinion say aye.
Aye.
Of the contrary, no. The ayes have it. The ayes have it. We now come to new clause 1. I call Andrew Selou formally that new clause 1 be added to the bill. The question is that new clause 1 be added to the bill. As many as that opinion say aye.
Aye.
Of the contrary, no. The ayes have it. Ayes have it. We now come to the schedules. The question is that schedules 1 to 6 stand part of the bill. The question is that schedules 1 to 6 stand part of the bill. As many as that opinion say aye.
Aye.
Of the contrary, no. The ayes have it. The ayes have it. We now come to Schedule 7. I call the Minister to move Government Amendments numbers 15 and 16 formally. The question is that Amendment 15 and 16 be made. As many as that opinion say aye.
Aye.
Of the contrary, no. The ayes have it. The ayes have it. The question is that Schedule 7 as amended and Schedules 8 to 17 stand part of the bill. As many as that opinion say aye.
Aye.
Of the contrary, no. The ayes have it. The ayes have it. We now come to Schedule 18. I call the Minister to move Government Amendments number 19 formally. The question is that Amendment number 19 be made. As many as that opinion say aye.
Aye.
Of the contrary, no. The ayes have it. The ayes have it. The question is that Schedule 18 as amended and Schedule 19 stand part of the bill. As many as that opinion say aye.
Aye.
Of the contrary, no. The ayes have it. The ayes have it. We now come to Schedule 20. I call the Minister to move Government Amendments numbers 9 to 13 formally. The question is that Amendment 9 to 13 be made. As many as that opinion say aye.
Aye.
Of the contrary, no. The ayes have it. The ayes have it. The question is that Schedule 20 as amended stand part of the bill. As many as that opinion say aye.
Aye.
Of the contrary, no. The ayes have it. The ayes have it. We now come to Schedule 21. I call the Minister to move Government Amendments numbers 55 and 56 formally. The question is that Amendments 55 and 56 be made. As many as that opinion say aye.
Aye.
Of the contrary, no. The ayes have it. The ayes have it. The question is that Schedule 21 as amended and Schedule 22 stand part of the bill. As many as that opinion say aye.
Aye.
Of the contrary, no. The ayes have it. The ayes have it. We now come to Schedule 23. I call the Minister to move Government Amendment number 82 formally. The question is that Amendment 82 be made. As many as that opinion say aye.
Aye.
Of the contrary, no. The ayes have it. Ayes have it. The question is that Schedule 23 as amended and Schedule 24 stand part of the bill. As many as that opinion say aye.
Aye.
On the contrary, no. The ayes have it. The ayes have it. We now come to Schedule 25. I call the Minister to move Government Amendment number 5 formally. The question is that Amendment number 5 be made. As many as that opinion say aye.
Aye.
Of the contrary, no. The ayes have it. Ayes have it. The question is that Schedule 25 as amended and Schedule 26 stand part of the bill. As many as that opinion say aye.
Aye.
Of the contrary, no. The ayes have it. Ayes have it. We now come to Schedule 27. I call the Minister to move Government Amendments numbers 51 and 52 formally. The question is that amendments numbers 51 and 52 be made. As many as that opinion say aye.
Aye.
Of the contrary, no. The ayes have it. The ayes have it. The question is that Schedule 27 as amended stand part of the bill. As many as that opinion say aye.
Aye.
Of the contrary, no. The ayes have it. The ayes have it. We now come to Government New Schedules. I call the Minister to move formally that Government New Schedules, New Schedule 2 and New Schedule 3 be added to the bill. The question is that Government New Schedules, New Schedule 2 and New Schedule 3 be added to the bill. As many as that opinion say aye.
Aye.
Of the contrary, no. Ayes have it. Ayes have it, and that concludes proceedings in committee on this bill. Order. Order.
I beg to report that the committee has gone through the bill and directed me to report the same with amendment.
Very well. Thank you. Consideration. That was consideration. No amendments on consideration. Under the... Nope. Under the order of the House of today, I must now put forthwith the question on third reading. After the necessary consents have been signified, Queen's consent, Prince of Wales' consent. The question is that the bill be now read the third time. As many as of that opinion, say aye. Aye. Of the contrary, no. The ayes have it. The ayes have it. Thank you.
Point of order.
A point of order, Helen Hayes.
On a point of order, Madam Deputy Speaker, I know that many members across this House welcome the Prime Minister's statement this evening and the clarity that it provides to our constituents in this perilous situation that we face. But I wonder, Madam Deputy Speaker, whether you have received any indication from the government that they intend to send a minister to this House to deliver the statement here and to enable members to question and to scrutinise it.
The Honourable Lady raises the perfectly reasonable point of order. The House will understand why, while we were undertaking the proceedings which we have just concluded, why the Prime Minister spoke to the nation in a forum other than this chamber. But Mr. Speaker has made it very clear to the Prime Minister that when announcements are made outside this House, they must, as soon as is practicable, be made within this House, to this chamber, and to the duly elected representatives of the people here gathered. Thank you.
ParliamentLive.tv 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 ParliamentLive.tv